According to Lindsay, coffee's king. Cigs in hand, she does her thing. Maggie's got the jokes we know. Together we are ready for the show. Chats on fire, the crowd goes wild. Maggie's quips just drive me wild. Leanie's love for Java steams. We're living out our crazy dreams. On a course of Leanie, life's no lie. Sip that coffee, watch time fly. With Maggie by her side, it's clear the best damn show around is here. Subscriptions climbing, views so high. Leanie's truth, it makes us cry. Maggie's got that wit so quick. We tune in daily for our fix. Community that stands so strong. Laughing, chatting all day long. From sunrise to the longest nights. Leanie's tales put out our lights. On according to Leanie, life's no joke. Spark that cig and take a toke. With Maggie by her side, it's clear the best damn show around is here. Subscriptions climbing, views so high. Leanie's truth, it makes us cry. With Maggie by her side, it's clear the best damn show is always near. On accordance with Leanie, life's no loud. Maggie's quips just drive me wild. Leanie's love for Java steams. We're living out our crazy dreams. On accordance with Leanie, life's no lie. Sip that coffee, watch time fly. With Maggie by her side, it's clear the best damn show around is here. Best damn show is always here. The best damn show is always near. According to Leanie, coffee's king. Cigs in hand, she does her thing. Maggie's got the jokes we know.
Next, is there any other serious matter of concern bearing on your service as a juror in this case that anybody needs to bring to my attention? All right. Thank you for following those instructions. And then in regards to today's schedule, we've got a number of witnesses. I'm not quite sure how long it may go. So we may break a little bit early today, just kind of depending on the way the case comes in. And then in regards to where we are right now, we're going to, if you remember, when we broke on Friday, there was a witness at Dr. Tufts. The Commonwealth had finished their direct examination. We're now going to have that witness return to the stand, and the cross-examination by the defendant will begin. All right, and so with that, if we could recall that witness.
All right, so they've put Dr. Tufts back up on the stand. Good morning, you guys. Thank you so much for being here. I appreciate you. I'm sorry I'm running a little bit late. No excuse. Okay, I have some. All right. No excuse. I won't give you guys any excuses at all. Just my fault. Maggie will, I don't know if I haven't really had a chance to check up Maggie, to tell you the truth, but I remember her saying that she was taking today off for some reason. So good to see all of you guys. So good to see the mods in chat. Let's give the mods the honor that they deserve, you guys. Thank you guys so much for always being here, always keeping this chat clean, always keeping us going. We appreciate you so much. Yeah. Take it out, ladies. All right. There we go. Volume's low. It's probably just me because I'm trying not to. I have morning morning, what do you call this? My morning voice right now. Can you guys hear me? Can you guys hear me? You want me to get louder? I have to baby my voice in the morning just because if I don't, then I lose my voice really easy. It really sounds like a whisper. I'm sorry, you guys. Oh, you know what? And you know what? I have my microphone up too. Alrighty. Anyways, all right. Let me get back over here. Why did they just stand? Why did everything just stop right there? What the hell happened? What the hell? All right, let's get on with it, guys. Here we go. What is she bringing her mommy with her? What?
Morning, this on is ready for testimony and you should get to collect the insurance and have an outcome between the Commonwealth and Thank you, you can have a seat.
Just watch yourself, please.
Hi, Jamie.
All right, good morning, Doctor.
Morning.
All right. Ms. Reddington?
Thank you.
She looks so
Good
fragile.
morning, Doctor.
Let me shut up.
Morning.
Do you have your record in front of you, your notes? Or
I do.
and you can look at that anytime you want, just to refresh your memory of what's going on with you.
Thank you.
Dr. Tufts, you are presently a psychiatrist, correct?
Correct.
And can you tell me where you went to med school?
University of Vermont.
And what were the years that you were at University of Vermont?
2014 to 2018.
Beautiful country up there. Great place to visit, right?
It is. It's beautiful.
And when you graduated from med school, you then did your residency?
Correct.
And where was the residency?
Boston Medical Center.
And can you tell me, what is it exactly that you do as a psychiatric resident or a psychiatrist resident? What do you do?
You do a lot of different things. You rotate in all the different aspects of psychiatry, as well as internal medicine, so that you have a foundational knowledge of broad medical topics. You admit patients into the inpatient hospital. You manage emergencies in the hospital and in the emergency room, decide whether patients need to be admitted psychiatrically or not, and also carry a panel of outpatients.
And is this a hospital that you're working in, or is it Boston University? Is it a medical center?
So yes, it's the Boston University program located at the hospital, Boston Medical Center, with also a lot of time spent at the various Boston VA locations.
And what were the years, I'm sorry, that you did your residency?
2018 to 2022.
So you basically were working as either a person studying to be a doctor, graduating, and then becoming a resident through the entire pandemic.
For the first part of the pandemic, yes.
The pandemic ended when Joe Biden said it ended. I think it was July of 2022, right?
I'm not sure exactly when he said that.
Would you agree with me that when the pandemic started, around 2019, when you began your residency, 2020, 21, into 22, it was a large push, if you will, of the pandemic time frame?
Yes.
All right. And we all had to walk around with masks and have no contact with people and make sure you have 6-foot radius before you touch anybody, all of that, right?
Yes.
How did that impact your residency?
Well, I still went into the hospital most of the time, wearing the proper protective equipment, but I absolutely still provided the necessary medical care that was needed. And some of the outpatient experiences were done via telemedicine.
Telemedicine?
Yes,
That's like on a television screen. Like a Zoom or something?
it's Zoom or something similar.
Did you touch people, shake their hand, give them a hug, anything like that while you were working in your residency during the pandemic?
Sometimes, not, I think everybody had to keep their distance at certain times. I began my program before the pandemic. So, of course, there was a lot more handshaking and things like that then.
You can't really keep your distance, though, when you're working as a labor and delivery nurse with a woman who's having a baby directly in front of you, can you?
I imagine not.
So, when you finished, do you graduate from a residency, or is it like you get a certificate or something?
Yes, there is a certificate for completing it.
And then, at that point, you are now a licensed doctor? Is that how it works?
Well, you're actually a licensed doctor the entire time that you're in residency. But upon the completion of that, you can obtain a full, unrestricted Massachusetts license and also become board certified.
And the board certification, for example, you have a board certification in general psychiatry, is that correct?
Yes, sir.
And when was it that you got that certification?
When was it?
Yes.
It was September 12th, 2022.
When was it that you actually started working as a physician, as a psychiatrist?
I started working as a physician and as a psychiatrist during the residency training program, but I started practicing completely independently at Astor Mental Health in August of 2022.
August of 2022.
Yes.
Now, prior to working with or at Astor, is that ASTOR or ER?
ASTER, like the flower.
And what is Astor? What is it, like a group of doctors? Is it a medical center? What is it?
It is a outpatient practice that is owned by a psychiatrist. It has a number of psychiatrists as well as therapists.
And where is it located? Is it a brick and mortar type place where you have offices?
Yes, the original offices were in Braintree, Massachusetts, and now there's an office in Peabody as well.
Your office, where do you work?
So at the time I saw the patient, I was working in the Braintree office. I currently work in Peabody.
Where, I'm sorry?
Currently in Peabody, Massachusetts.
So when you start working at Astor, obviously like anybody else, you submit a resume, an application, you perhaps when they hire you, right?
It's a fairly lengthy process and a number of interviews with different staff at the practice, and some recommendations, letters of reference, verification of credentials, all of that. But yes, it can be comparable to another profession in that process.
Now, in August of 22, when you, congratulations, obviously you were hired by Astor, how many women had you treated in your residency that were postpartum?
With postpartum depression? Or just in the postpartum period?
How many women that were in the postpartum period did you treat prior to August of 22?
Many. It's hard to give an exact number, but I did have specific training in that population.
In that population. And where did you have the training in that population?
At Boston Medical Center.
And can you tell us in that 2-year period approximately how many that were in the postpartum period that you treated as a resident?
Okay, so it's really hard to give an exact number, but if I had to say, at least 50.
So in the 2-year period, you treated 50 people in the residency that had postpartum. And can you tell me, what is postpartum? What is that?
Well, I just want to address that it was a 4-year period, not a 2-year period.
Oh, I'm sorry. Okay.
And sorry, what was your question?
Hold on. You saw 50 people in a 4-year period that had postpartum. In other words, they had been after having a baby, right?
Possibly, yeah, more or less. I saw a number of other patients. I saw much more than 50, but yes.
So after you had your residency and after you were hired by Astor, is that when you began in August of 22 your practice as a practicing psychiatrist?
Yes.
And when was it that you actually got your DEA license that authorizes you to prescribe medication to citizens?
So during residency, I had a DEA license, but it was affiliated with the with Boston Medical Center. And then when I started at Astor, I had my own DEA number. I don't know exactly when, maybe sometime around August.
So August of 22, you started working at Astor. August of 22, you got your DEA license individually that authorized you to prescribe medication, correct?
Yes.
And it was when that you saw Lindsay Clancy?
I believe our first visit was September 15th
Of
2022.
So you were practicing as a psychiatrist for a little more than a month.
I was practicing independently with my full credentials for about a month, but the training is just immense that goes on before that.
Absolutely, it must be. But that's a residency that you're talking about, right?
Yes.
And you know, in a residency, I mean, all I know is Grey's Anatomy, but I mean, working under a doctor, the doctors are supervising you and they tell you what to do and then you report to them, correct?
They don't really tell you what to do. They're there as a resource if you need additional support. But I followed many of my own patients. I was the only person in the room with them. And, my notes were signed off by an attending physician, and that attending was available for any support I needed.
So in August of 22, when you started working at Astor, you actually filled out a form for your advertising. Is that correct?
I believe that was handled by other people at the practice.
And who would that be?
Well, we have non-clinical staff that handle the administrative matters.
Okay, but you're a doctor and you're out there to the public. You're advertising yourself and your services to the public. Is that fair?
I believe yes. I'm not directing the marketing of our office, but yes.
Okay, never mind your office. I'm talking about you. You had an ad that was on the computer that if somebody wanted to reach out to a doctor, they could see your ad amongst many others, right?
Well, I don't think there was an ad. I think we have a website that had some information about myself.
Okay. Now, in August of 22, up until when you saw Lindsay, how many patients in that month or so had you treated for postpartum psychosis?
How many patients in a month? Up until that month?
I'm asking you about when you started working in August of 22 for Astor, and you are now on your own as an employee. How many patients had you treated before you saw Lindsay Clancy for postpartum psychosis?
Well, in the span of 1 month, I would say none because it's a very rare disorder.
Okay. But it exists, doesn't it?
Absolutely.
And one of the things would be the voices that people hear, right?
That is a symptom of psychosis, absolutely.
And that's legitimate, isn't it?
It is a legitimate diagnosis, absolutely.
It's not the diagnosis. People that have postpartum psychosis hear voices, do they not?
Many do. The disorder can manifest differently in different people, but yes, many people do hear voices.
How about postpartum depression? How many people in that month or so before you met Lindsay did you treat for postpartum depression?
In the span of 1 month, it's really hard to pinpoint that. Maybe a couple.
Maybe a couple? And do you recall how long you treated them for?
Again, it's hard to really pin down the individuals in a short span of time.
Can you tell the jury what you put in your ad or in the Aster website that you indicated that described you?
I don't recall.
Well, one of the things you did is that you said that you basically were a specialist in postpartum, people that have postpartum psychiatry. You indicated that on the website, didn't you?
Are you able to read the actual document? I don't remember exactly the wording.
You've been working now for how many years now? 3 since you saw Lindsay? Or more?
Almost 4, yes.
You haven't changed your ad on the website, have you?
I have not personally, no.
And you've read it probably a bunch of times, right?
I've read it a couple of times, but I don't spend a lot of time on my website.
Okay. Do you recall that you indicated that you were specializing in any particular aspect of psychiatry?
Yes. It probably includes a special interest in women's health, in perinatal psychiatry, in trauma-related disorders, anxiety, and there may be some other things that were mentioned.
Yeah, like women that have babies and they're suffering from postpartum depression. Right?
Absolutely.
You advertised that after a month in working for Aster, right?
That's listed as one of my interests, definitely.
And again, forgive me, how many women did you treat for postpartum depression in that month and a half before you met Lindsay?
I don't know, maybe a couple. But I've treated many of them in the residency, which was just immediately before.
So when a person needs to see a psychiatrist, generally they're not well. Is that fair?
Some are not well. It really can vary.
So when someone comes to see a psychiatrist like you, it's because they need help, right?
Yes.
And when they come to you because they need help, for example, with Lindsay Clancy, she came to you because of your ad, right? Or your website for Aster, what you said about yourself.
I don't know exactly how she found us.
Well, do you know why she came to see you?
I'm not sure exactly.
Friday, we spent a long period of time going through the initial intake that she had to fill out. Is that correct? You recall that?
Yes, we did.
And the district attorney kept asking you, and this is in September, is it September 12th? Is that when that form was filled out?
I believe she completed the form on the 12th. The appointment was on the 15th.
So what does a person do? Do they call you or do they talk to somebody in administration? How do you get the form to fill out?
Yes, our administration handles that.
And what do they do? How does that happen?
They send them the documents, probably by email, and the patient fills them out. It might be all within the portal that we use.
Within the portal?
The patient portal, yes.
Okay, and that means that you go online and you can access Aster Mental Health, and then all these little drop-down boxes would come up?
Something like that.
Are you aware? Is it something like that, or are you aware of what it does?
So because I don't handle the scheduling and the sending of forms, I don't know exactly what it looks like.
Well, this is the form that you're giving a person that needs help because they're possibly mentally ill. Is that right?
Yes, and what's important is that I review the forms and we go through them in the appointment. Absolutely. Yes.
Now, understand that your records, Exhibit 219, I believe, the jury will have access to the Tufts records. Okay, you're aware of that, right? You know it's an exhibit.
Yes.
because you have talked to the prosecution about what an exhibit is, and you know that your records are now in evidence before this jury, right?
If that's what you say, yes.
I wouldn't take what I said.
Well,
If you don't know, that's fine.
I don't know the details of how this works, but
Have you talked to them prior to your testimony?
no,
You haven't talked to the DA's office?
no, not at all.
You're a defendant in a very large lawsuit, are you not?
Yes,
You would happen to be represented by an attorney, would you?
I am.
And the fact that you have an attorney is your right under the Constitution. It doesn't mean that you're guilty of anything, right?
Right.
Okay. And you know that the outcome of this case is very, very major to the outcome of your lawsuit. Is that right? Oh.
I don't actually know that.
So you understand that if, in fact, it's determined that you advertised as an expert in postpartum and in postpartum psychiatry, and you had a month experience plus a residency, would you consider that to be negligent or misrepresentation?
I do not believe that I have been negligent.
Do you understand what misrepresentation means?
Yes.
With a month under your belt plus your residency, do you really want this jury to believe that you were an expert? Can you advertise that?
I don't think that's exactly the wording that I used. I think I said that it was an interest of mine.
You were what?
The answer.
No, go ahead. Good, the answer.
I just think the wording was that it's an interest of mine. I don't believe I called myself an expert.
Are you an expert in postpartum?
I may be. I don't know. I think it depends on what you define an expert as.
Well, when a patient comes to you and they fill out the form, you agree with me that your records reflect that form that she filled out on September 12th of 2022, right?
Yes.
And the form that the district attorney went through painstakingly with you is basically, it looks something like this, right? That's one of the forms that you have people fill out, right? Right?
Yes.
You see the little check mark?
Yes.
Who puts the check mark in there?
The patient.
So how many pages, because I don't want to go through all the pages yet, how many pages does a patient, or how many pages did Lindsay go through to check the boxes for acid?
There were a lot of pages.
What's a lot, 10, 20?
Yeah, maybe between 10 and 20.
Okay. And basically, they're all little checks in boxes, correct?
Not just checks.
No? So does the person then answer questions by typing in an answer such as, do you have any pending legal problems? No. Have you ever been arrested? No. Things of that nature, right?
Those are some of the questions.
And the questions also, do they ask the patient what medications they were on
Yes.
before seeing you?
Yes.
And Lindsay told you that she was on SSRIs in the past, right?
Yes.
And SSRI means what?
A selective serotonin reuptake inhibitor.
And that's pretty powerful stuff, isn't it?
It's an effective treatment for depression and anxiety.
Well, it affects the serotonin levels in the brain, doesn't it?
Yes.
It rewires the brain, doesn't it?
It doesn't rewire the brain. It increases the serotonin, and many individuals with depression have low levels of serotonin.
So Lindsay told you that she had been prescribed an SSRI when she was in nursing school. Is that right?
Yes.
What was the SSRI?
Prozac.
And how long was she on the Prozac?
I'm not sure.
Never asked.
I probably asked.
Probably asked. Isn't it true? Don't you guys have a saying that if it's not written, it didn't happen? You take copious notes, do you not?
It's impossible to write down every single thing that's said. So I write down what is clinically relevant, clinically necessary. But there's a lot that is discussed over an hour that is not able to be written down.
Such as the fact that a person was on an SSRI when they were in nursing school is not an important fact to find out.
Oh no, that's important. Sorry.
No problem. I'm not doing, the Sophie Cunningham act. I'm just asking a question. That's all, and you can answer it, okay? How about if she had a reaction to Prozac?
I asked her about the Prozac.
Is that written in your notes?
Yes.
And what did she say?
She said that she took it for a period of time. She didn't mention any side effects.
Oh, she didn't tell you that she had side effects. I see. So when a patient comes to see you with a month under your belt and they're sick and they're looking for help, you wait for them to volunteer facts to you?
She volunteered a lot of information. She knew very well what her medical history was and was able to provide that for me.
Such as what? That she was in nursing school and took Prozac?
That's part of it.
And she told you that, right?
Yes.
And she was pretty upfront and honest with you, wasn't she, in answering these questions, right?
I believe that she was.
We all spent some time talking about the fact that she declared that she had consumed alcohol, that she felt guilty about it. You recall that on Friday? We dwelled on that for a while, didn't we?
Yes, that was a component, yes.
I mean, that's something that's important, right?
Yes.
What was her drink of choice?
I'm not sure.
Did you ever ask her?
I'm not sure. We were not concerned that her level of alcohol use
Well, the DA certainly was Friday, right?
All right, and everybody knows. Doctor, wait for the question, all right? And then the same thing, I'll have counsel wait until you finish your answer. All right? Go ahead, Mr. Reddington.
So is it important, doctor, for you as a physician to know your patient? In other words, know who they are.
Yes.
And you know that Lindsay was a nurse, correct?
Yes.
You know that she graduated, obviously, from college, right?
Yes.
Is she a good student?
I don't recall.
Do you know when she got married?
I don't recall
Did you
that
ask her?
specific detail. I don't know. I knew she was married.
She had 3 kids, right?
Yes.
And the reason that you know that she was married is because you spoke to her husband, Patrick, correct? Or did you?
Sorry?
Or did you?
He attended one of the appointments, and I spoke with him on that date.
Ah. And did you say hi, how are you? Give him a handshake when you came in your office?
It was telemedicine.
It was what?
Telemedicine.
Telemedicine. Is it fair to say that after, 14, you said to the jury, 14 appointments that you had with Lindsay during that period from September till January? 14 appointments?
Yes.
Every single one of them were by telemedicine, weren't they?
Yes.
Until you came in this courtroom Friday, you never saw this woman in person, did you?
Correct.
Were you ever concerned about her mental health as a person?
Absolutely.
She was crying. She told you symptoms that she couldn't get out of bed. Isn't that right?
At one time, she said it was difficult to get out of bed.
Oh, difficult to get out. Why was it difficult for Lindsay Clancy to get out of bed?
Because she was very depressed.
And did you give her a hug? Oh, no, you're on telemedicine, so you couldn't give her a hug, could you? You didn't have any chance to even look at her in person, did you?
I could look at her. It was always a video appointment. I couldn't give her a hug, but that's not actually something that psychiatrists typically do with patients.
I imagine. Now I'm looking at you, and you've got the witness here cutting you off in half, right? So I can't see from your waist down, your legs, your feet, your hands, anything. That's the same view that you have on the telemedicine, right?
Yes.
Isn't it fair to say that you've studied and that you've learned that there are objective manifestations that patients may have that would be a tell, like if you're playing poker, you have a tell, that would be an indicia of the fact that they're stressed or emotionally disturbed, right?
Yes.
Like hand wringing, right?
Yes.
Were you able to see the hands wringing when you were on telemedicine?
I don't recall seeing her hands.
Do you recall, how people sit there and they do this with their leg and the leg bounces because they're going through some type of emotional stress? You couldn't even see her legs, could you?
I couldn't see her legs, but I knew that she was under stress.
So when she came to you, September 15th, I believe, is the first time that you all actually discussed her condition, correct?
Yes.
And looking at the medical records, which the jury will be able to look at, it says visit date September 15th, 2022, and you can look along with me if you wish. Indicates why she came to see you, right?
Yes.
Right? Yes?
Yes.
Okay. Why did she come to see you? According to, not guessing and speculating, never mind the TV, you just look at your notes. Tell me what brought Lindsay Clancy to your office.
Postpartum anxiety.
Is that it? Is that what you noted in the records?
Well, those were her words when asked, what are the problems for which you are seeking help?
I see. Postpartum anxiety. Now, as a psychiatrist, meeting with this young woman after a month or so of working as a psychiatrist for Astor, there are tests that you administer to a woman who's in postpartum to find out what type of anxiety they have, right?
Well, there are some screening tests, but the most important thing is what the patient tells you and what my assessment is in the session.
I see. And that would carry through the Tufts evaluations for all 14 of those meetings, is what the patient tells you, right?
Yes, and what I observe in the session
Through the television.
through the computer.
What, if you can tell me, is the Edinburgh test?
It is a scale that looks at symptoms of postpartum depression.
And when you administer, that's a major test, isn't it, for a doctor to evaluate a patient for PPD?
I wouldn't say it's a major test.
It's a pretty big one, though, isn't it? It's the only one that measures the postpartum depression, right?
It's a common one.
So what?
Commonly used.
All right, so when you used it on Lindsay, when was that administered to her?
I did not use it on Lindsay.
Why?
We used the PHQ-9, which
What
is
PHQ-9?
It's a depression screening form.
That's like generalized anxiety disorder, general depression. It's got nothing to do with a woman suffering from postpartum depression, does it?
I disagree.
Well, do you agree that people perhaps that may know a little more than you determined that the Edinburgh scale is the appropriate scale to administer to a pregnant or postpartum woman?
To state as a form.
You're familiar with the Edinburgh scale, right?
I've heard of it.
And can you explain to me how it's graded?
No, I cannot.
There are 30 questions in it, are there not?
I don't use this scale, so I don't know how many questions there are.
So the Edinburgh scale, do you even know that the cutoff for someone that is depressed in their condition of postpartum would be 15? Anything over that, they're in severe depression?
Okay.
Do you know that her first Edinburgh test that was administered to her put her at a 23?
Objection.
Overall. Severe depression?
I was not aware of this test. I was not aware that this had been administered to her.
Well, you know that except for the Prozac that she had when she was a nurse, what, 23 years old. She hadn't, other than seeing her own doctor for having the baby, she hadn't seen any doctors. You knew that, right?
I didn't know exactly which doctor she sees. I think we ask about your primary care doctor, but she did not report any other medical issues that she was under treatment for.
So is it important for Dr. Jennifer Tufts to know whether or not a patient who is coming to you for help has a prior medical history other than what they might tell you?
Well, when patients are able to advocate for themselves and share their medical history, we rely on what they tell us.
Was she able to advocate for herself, in your opinion, when she came to see you, when you evaluated her in September?
Absolutely.
How about October?
Yes.
How about November?
Yes.
How about December?
Yes.
And your medical records, you would agree, show that during that period of time that she was deteriorating, was a word that was used on Friday. Isn't that right?
So
No, so. You used the word deteriorating on Friday, did you not?
she was a little bit worse at certain appointments, and the deteriorating word, which is not my word choice, is what is in the note because I had to select that.
Because why? You have some kind of a program that you have to check the box and you have to bring down the drop box. You can't take a pen and write something down about a patient.
There are certain parts of the note where I can write whatever I feel is necessary, but that specific aspect of the note is a button where you have to click one of three choices.
So when the jury's going through your medical records, one of the things that they're going to see is that when you meet with the patient, you have a form that you fill out where it says, if you feel like you're going to harm yourself or somebody else, make sure you go to the emergency room, right?
Yes.
If you have any urges to harm yourself or others, go to the nearest emergency room. That's in every single time that you meet with a patient, right?
Yes.
And it indicates that if there's any, call the Suicide Prevention and Crisis Hotline. If you feel that you're in crisis, you may text home to a particular number anytime. What's a suicide hotline?
It's a phone number that patients in crisis can call and speak to a trained counselor.
Now, a psychiatrist, you'd agree with me, is not a counselor, that's for sure, right?
Well, a psychiatrist has training in therapy as well as in medicine.
Did you give Lindsay Clancy any therapy?
There was some therapy incorporated in our sessions,
like
but
what?
we did.
Like
sorry, providing emotional support, listening to her.
Hold on, no, please.
Finish her answer. Hold on, everybody. She can. You ask the question, I'm going to let her finish, and then you can follow up with any questions you want. Go ahead, Doc.
Anything else you want to say?
So her sessions were largely focused on the medication management, but there was an aspect of therapy including those items.
Okay, and the sessions were for what, 17 minutes?
No,
How long were they?
25 to 30 minutes.
So 25 to 30 minutes on the television, and were you face the TV screen with her for the full 25 minutes?
Yes.
And that's not noted in your records. It says 17 minutes on all your records, doesn't it?
So if you look closely, it says the therapy component was for 17 minutes. It doesn't say the entire duration is 17 minutes.
So what do you do when you're trying to give therapy as a psychiatrist to a patient that came to see you? What do you do? What do you do for therapy?
It depends on the person.
Well, how about Lindsay Clancy? What did you do for therapy with her?
I listened to her. I listened to her concerns and provided support. I tried to provide her with hope that eventually things would improve.
So you listen to her concerns, and you'd agree with me that her concerns were, for example, that she actually was unable to sleep. It's one of her concerns, right?
She was having a lot of difficulty with sleep.
On the September 15th meeting, you indicate that her mood was okay, but her affect was anxious, and you called it incongruent. What does that mean?
So she said she was feeling okay. She appeared anxious, and she also stated that she was anxious.
So one of the things that you talked about Friday is when a patient presents with an incongruent something like that, I don't remember, appearance perhaps, that would mean that they're saying, I'm okay, but they don't look like they're okay, right?
Well, it could. I don't think her affect and her mood were really that incongruent at that time. I think that she didn't appear terribly depressed. I didn't say she was terribly depressed in that initial visit, but she said she was anxious and she appeared anxious. That's pretty congruent.
Okay. So did you put in the report that she was congruent or incongruent?
So that is not an option for me to indicate in that section, but
So
it was congruent.
You're like a robot. You can't take a pen and write something down. You have to do the drop box and the X's on the computer.
Well, if it's on the computer, I'm limited by the options that are up there.
Why? You're a doctor. Why are you limited?
Because of the technology.
What technology? The fact that there's a form on a computer? You're trying to treat a human being who comes to you for help.
And that's what's most important. What's most important was the treatment, not what is checked off on a box.
Makes sense. So you were unable to make a note as to whether or not her affect and her mood appeared to be in conflict, and that she would have been incongruent, and that she had poor insight. You couldn't write that down. Is that right? Because the box doesn't let you.
Correct.
So basically, she's telling you that I'm okay. Well, actually, when she came, do you know that she never saw, other than when she was in nursing school, would it surprise you, a psychiatrist? And that was only for like a week when she got the Prozac in nursing school because she was afraid of public speaking. Did you know that?
I was aware that she did not have a significant past psychiatric history. I was aware of that.
Okay, so you were the first psychiatrist that she had the pleasure of meeting. Is that correct?
Yeah. I think it was.
And isn't that important for you as a doctor to take a history?
I did take a history.
So can you tell us? You're testifying here for the government. Tell us whether or not she had any past psychiatric history other than in nursing school for a week for the Prozac.
She did not report any other past psychiatric history other than the Prozac and Wellbutrin.
So when a patient comes to see you and you're treating to help that patient, if they don't report something to you, you don't know about it apparently, right?
Well, I think it depends. There are certainly things I can assess, but if it's related to their history, I do need them to tell me.
Well, you can't assess it unless you ask, right?
Unless I ask, or they volunteer it, or they fill it out in
Of course, we already talked
forms.
about the volunteering. How about you as a doctor, when you're evaluating a patient coming to you for help, do you ask them questions?
Yes,
You didn't ask her a prior history.
I did.
What did she tell you?
She said that her prior history was what we discussed about the Prozac in the nursing school.
So, basically, other than hoping to give her hope, is what you said, for the therapy. How do you give someone hope for therapy? The other doctor.
Try to encourage them and.
What did you encourage her on September 15th?
Sorry?
What did you encourage her to give her hope on September 15th?
What did I encourage her?
Yeah.
I don't remember exactly the words. It was almost 4 years ago.
Records?
No, we don't write those, details of everything
That's
that was
the therapy
said.
you're talking about, right? Yes?
Yes.
And you don't write down the therapy you give the patient in the records, right?
Well, I write something about it. I mentioned that.
Hold on.
So yes or no?
Hold on. You gotta let her finish the question. If you listen to the question and answer just what they asked, okay? Go ahead. You can rephrase that question.
No, let her answer.
All right.
I mentioned that I provided supportive therapy.
What is supportive therapy?
It's listening to the patient's concerns and providing emotional support and validation.
So, emotional support and validation all sounds good. Here's a young woman who was what, 20, 29, 30 years old, came to see you?
Yes.
And came to see you for help, right?
Yes.
Told you she couldn't sleep and she was anxious, correct?
Yes.
You know that she was postpartum, correct?
Yes.
You know that as a patient who was postpartum. By the way, what is your opinion of the period of postpartum wherein one could have postpartum depression, or more importantly, postpartum psychosis? What's the time frame?
It's typically 1 year.
So she was well within that time frame, correct?
Yes.
And you tried to provide therapy by giving her hope. And how long do you figure did that take? 5 minutes, 10 minutes, 2 minutes?
I'm not sure. I think it was different in each session.
Okay. So the only thing that you diagnosed Lindsay with on September 15th was GAD, Generalized Anxiety Disorder, correct?
It was generalized anxiety disorder as well as an adjustment disorder with depressed mood.
And you prescribed medications to her, right?
Yes.
And the medication that you provided to her was the sertraline, right?
Yes.
And the sertraline would be Zola, right?
Yes.
Now this is a little chart that shows the prescriptions that Lindsay was on. And you are the yellow colors. They're the types. Okay? You can see that. Would you agree with me that on September 15th you prescribed sertraline, Zoloft, 30 count on September 15th, 25 milligrams, right?
Yes.
Have you ever read the website for sertraline?
The website for sertraline?
Yeah. I mean, sertraline, Zoloft, is a chemical that is marketed as a pharmaceutical, right?
Yes.
Right? It's a pill, right?
Yes.
And as we said, it's an SSRI pill, correct?
Yes.
Do you know that Zoloft is not indicated for generalized anxiety? Why'd you give her Zoloft?
It is a very effective medication for generalized anxiety disorder.
So you're familiar with the drug labeling for Zoloft, is that correct?
Generally.
Generally. Are you aware of what the manufacturer of Zoloft indicates it can be used for, to treat?
I'm aware that it's used to treat various forms of anxiety disorders as well as major depression.
So when Lindsay came to see you, you know that she had stopped breastfeeding her son, right?
Not at the time of the first appointment.
When did she stop breastfeeding? In October?
Something around then.
You know that she had little or no psychiatric history other than seeing you, correct?
And the Prozac, yes.
You know that, in fact, that she had stopped drinking whatever it was that she was drinking, because you never asked, right?
I was not concerned about her level of drinking.
Well, it's in your form, right?
That was at the intake, but
Did you know that she wasn't drinking when you were meeting with her, correct?
Yeah, that's what she told me.
Okay, and you believe what she told you, right?
Yes.
So when she sees you, she's not on any psychiatric, anti-tropics, or whatever they're called, medications, correct? She wasn't on any medication.
Correct.
And she had stopped drinking anything, whatever it may have been, right?
I'm not sure when she completely stopped drinking, but yes.
You don't know when she started, when she stopped, what she drank, do you?
Well, I was not concerned that she was an alcoholic.
That's a yes or no. Did you have any idea? Because we spent a long time on Friday talking about her guilt and having that she drank alcohol. You don't know what she drank, when she started, when she stopped, do you?
I know some details about her alcohol use, but it was overall minimal.
What were the details then? Tell me what the details were. There was that one little box that was checked off. What are the details with it?
That she drank 1 to 2 times a week, 1 to 2 servings 5 times a week.
And you don't know what it was. You have no idea, right?
I think she had mentioned at some point that it was calming. It was something that was helpful. Calming.
Okay,
calming.
So it was numbing. It was like trying to numb something, I guess, right?
That's one way of saying it.
I mean, I imagine you've treated veterans that have post-traumatic stress disorder, right?
Yes.
And would you agree with me that many times when people have an anxiety disorder or PTSD, whatever the case may be, they try to numb their feelings? Is that fair?
Sometimes they do.
And sometimes they use alcohol, right?
Sometimes they do.
But we don't know what alcohol. So we don't even know if it was a beer, do we?
I didn't think that was relevant for her.
So, with all of that information, you then prescribed Zoloft to her, correct?
Yes.
You went over the side effects of Zoloft, circulating, I imagine, with her, right?
Yes.
Did you tell her that one of the known side effects is suicidal thoughts and actions and ideation?
Well, that's specifically in children, so I don't think I mentioned that because it wasn't relevant.
Not really. Suicidal ideation and homicidal ideation is a black box warning on Zoloft, along with other SSRIs, right?
Under age,
No?
for children and adults younger than Lindsay.
I apologize. Can you just listen to my question and answer it yes or no? Is there a black box warning on Zoloft?
Yes.
All right. And a black box warning is required or prescribed by what? The FDA?
Probably.
Probably. And it basically warns that, especially with young people or young adults, that it may cause suicidal or, God forbid, homicidal ideation. Yes?
Yes.
And you're aware that, in fact, the FDA has determined that that goes up possibly to a 23, 24, 25-year-old. You know that, right?
I think 24 is what they said.
Yeah, I'll give you 24. It's possible, is it not, that the SSRIs that get into a person's brain affect a person that's 3 or 4 years older than the FDA cutoff with suicidal ideation or homicidal ideation? Possible?
There's a lot of development that happens in the brain between ages like up to 24 and closer to 30. The brain is fully matured at past age 24, and so it's less vulnerable than in a younger individual.
So with 24, you're suggesting as a cutoff, are you suggesting to the jury that a drug that increases the risk of suicide in a 24-year-old patient cannot increase the risk of suicide in a 29 or 30-year-old patient? Just a little bit.
I don't believe there's evidence that it causes that at all in individuals over 24.
So, as a psychiatrist who had the ability to issue these types of medications to patients and citizens, what research did you do on Zoloft and suicidal ideation, homicidal ideation?
I was taught extensively about SSRIs and suicidal ideation in my training.
Vermont, right?
In Vermont, in Boston, yes.
Okay, so in Vermont was when you get your medical degree, right?
Yes,
And in Boston would be when you were a resident, right?
yes,
And then you had board certification on general psychiatry, right?
yes.
You can have a certification on a subspecialty, right?
There are certain subspecialties, yes.
Right, and some of the subspecialties deal with postpartum or women that are pregnant and have babies and have psychiatric symptomology.
There's no board certification for perinatal or reproductive psychiatry.
Well, there are plenty of classes that are recognized as, for example, at Harvard Medical School, there's an annual class or symposium, if you will, for postpartum. Have you ever been to that?
No, sir.
What have you done to research or to improve your education? I understand you went to med school and that you were a resident. What programs, continuing education, symposiums have you attended since you got the ability to prescribe these medicines to people?
I have not attended a symposium.
Have you attended anything?
I have not, but I have done a lot of reading on my own, of research and guidelines about this area in psychiatry.
Did you tell Lindsay when you were going? This is one of the things that you guys are always concerned about is what's called informed consent, right?
Yes.
And what is informed consent? What does that mean?
It
In a
means
medical sense, not just like out in the street or something.
explaining to a patient the risks and benefits of treatment and possible alternatives, and making sure that the patient understands what you're saying.
Now, when you were going over the symptomology or when you were going over the side effects of Zoloft, one of the side effects of Zoloft is, and I quote, severe trouble sleeping, right?
Yes.
Did you tell her that?
Well, insomnia is listed as a side effect.
No. You already said yes, you know it. Did you tell her that Zoloft has a side effect of giving the patient severe trouble sleeping? That's all.
So I didn't use the word severe because it typically doesn't cause severe trouble sleeping, but I thought you were referring to when she told me that she did have severe trouble sleeping, and that was true.
That's what you told her, right? That she had severe trouble sleeping, right?
She told me, yes.
And you know that one of the side effects of Zoloft is, let's say, trouble sleeping. You know that, right?
Yes.
Your answer is yes. The jury has to be able to hear you.
Yes.
And why would you prescribe Zoloft to a young woman who's postpartum, who's coming to you with anxiety, who's telling you she can't sleep, she's got all of these symptoms, and you prescribe a medication that would have a side effect of trouble sleeping?
So individuals have very varied responses to medications. Some have no side effects, some have one or two. It's impossible to predict, but Zoloft is a top choice, a first-line medication for her. It was
Says who?
Says it's the general consensus
Well, know
among
about the
psychiatrists.
lawsuits
Hold on,
Right?
again, you can't have both of you talking at the same time. So let her finish her answer, and then I'll give you plenty of time to follow up any questions regarding her answer. So, you finish your answer on that?
There's extensive research supporting the use of sertraline in this instance, and the general consensus among psychiatrists is that it's a first-line safe medication for individuals, including postpartum women.
How about the kids that shoot other kids in high schools and the lawsuits that come out of that against Zoloft? You ever read about them?
Overruled.
Sorry,
You didn't hear me?
I wasn't sure what the question was.
Question was, in response to your observation about how all the psychiatrists think that it's a very, very safe, wonderful first-line drug, and you researched it. How about the kids that kill other kids in schools with the lawsuits that arise out of the use of SSRIs? Have you ever researched that?
I don't know much about that.
You know about the SSRIs and messing with someone's brain. They go out and they shoot people for no reason, right?
I'm not aware that that's linked to SSRIs.
So you didn't really talk to her about increased risk of suicide in 24-year-olds or down because she's 4 or 5 years older than that. You didn't talk to her about the trouble sleeping that could be a side effect. But she describes there's other drugs that you could have given her that would be perfectly safe and calming and allow someone with no psychiatric history to sleep better, right?
Not necessarily.
Okay, so you prescribed her with the Zoloft. It was 25 milligrams, right?
Yes.
And when you prescribed her with the Zoloft, 25 milligrams, was that increased up to 0.05 milligrams? Or did you increase it at some point?
The instructions were to increase it to 50 after 1 week.
After 1 week.
Yes.
And you expected that she would listen to your instructions, right?
Yes.
And she did, right?
She waited about a month, but then yes, she did.
Why did she wait a month?
I think it took her some time to decide whether that was truly what she wanted to do.
Right, she was afraid of the drugs, wasn't she?
She was afraid of side effects.
And she didn't want to take the pills, did she?
She eventually did want to take the pills because she wanted to feel better.
A month later, right?
Yes.
So you prescribe the Zoloft, SSRI, and then you tell her after a week to increase it, and she doesn't take that medication for a month, correct?
Correct.
And then she did take the medication, right?
Yes.
And did you meet with her or talk to her before she actually started to implement that particular regimen?
I had met with her beforehand, but I was not aware of when she made the decision to go ahead and take it.
So you met her on the 15th of September, right?
Yes.
When was the next time you met her?
Can I check?
Sure, of course. Absolutely. You can look anything you want.
September 28th.
And on September 28th, did you discuss with her the fact that she was afraid to take the Zoloft?
Yes.
And did you recommend that she do that?
Well, she said that she was feeling better at that point and wasn't
It's a
sure.
real easy question. When you talked with her, did you recommend that she increase or take the Zoloft?
At that visit, I don't think that I did.
Okay. So when did she actually take the Zoloft?
She told me in her October 20th visit that she had taken it 1 week prior.
And she told you that when she increased it in accordance with your instructions, she went off the rails, right?
I don't think she used those words, but she had
What words did
side
she
effects.
use for you as her doctor?
She felt awful.
Awful. Why did she feel awful? Did she have a stomachache? Did she have a headache? Why did she feel awful?
She did have some stomach aches. She had some diarrhea and had a difficult time eating. She also had increased anxiety. She had some more depressed feelings. She had more difficulty sleeping.
And what was your advice to her as her doctor on the 28th of October after she told you about the effect the Zoloft had on her?
I told her to stop it. Stop the medication.
Okay. Now, Zoloft being an SSRI, and a patient that is taking the Zoloft, And the 0.05, we spent Friday afternoon going over the drugs, and 0.05 milligrams is the lowest dose, and all that. That's the dose that is prescribed to people invariably, correct?
It goes up to 200, but that is a starting dose.
For pretty much all of you psychiatrists would agree with that, right? 0.05, right?
50.
50, okay. And you then told her to stop.
Yes.
What does it mean to titrate something?
To slowly increase the amount.
What do you tell patients when they're on an SSRI as to weaning them off the SSRIs?
Depends what the dose is. If it's a high dose, you need to slowly decrease the dose, so kind of the opposite of titration. But if it's a low dose to begin with, you can stop it.
Are you supposed to tell a person that's on an SSRI to stop immediately or to slowly withdraw from it?
At 50 milligrams, it is perfectly fine to stop it immediately.
So you didn't have any concerns at all about telling her to immediately stop taking the Zoloft. And what did you do? Put her on another drug?
Not immediately.
Okay. So did she relate to you on that October 28th meeting that you had? Was it the 28th or the 26th?
I met with her the 21st and then the 26th.
Okay. Now, on the 26th of October, what did she tell you her condition was?
So she was feeling back to how she was before the Zoloft, which is not great still, and that she was considering a new medication.
So she was considering it. Did she do research on medication as to what medication she wanted to take? Is that what you were telling this jury?
She didn't specify exactly what medication she wanted to take, but that she wanted to try something else because she was still having significant anxiety.
So when you say she wanted to try something else, I'm just asking, did you tell her what you recommended she try, or is that something that she decided she'd do on her own?
No, I gave her my recommendation.
Okay. The only reason why I ask that is that, a lot of times people might think that she's a psychopharmacologist, that she's a heart surgeon, that she's a vascular surgeon, that she knows everything about medicine. That's not true, is it?
No.
Would you agree with me that prior to telling her to stop the Zoloft, that one of the concerns that you had is that Zoloft affects anxiety and affects sleep, and you hope that it treats the underlying anxiety by balancing brain chemistry and increasing serotonin, right?
Yes.
Is that fair? And you'd agree with me that it does, as a side effect, have an impact on a person's falling asleep or staying asleep. That's a common side effect, right?
It can happen. It doesn't happen to everyone, but it certainly happens to some. But it is temporary. That's the important distinction. Is that there are many side effects that disappear entirely, and then the medicine is quite helpful for those certain conditions.
So
Yes.
she had problems sleeping, didn't she?
Yes.
Even after the Zoloft, right?
Yes.
So you, not her, you recommended a particular drug that she should take, right?
Yes.
And again, as it relates to what one would expect a young woman who's a labor and delivery nurse to know about psychiatric medication. What is methazine? Do you know?
I'm sorry?
Methazine.
I'm not sure.
How about hermababate? B-A-T-E. Hermabate. How about that? You ever heard of that?
I'm not familiar with that.
That's what's used to administer to a woman who's going through birth. You don't have an obligation to know that, do you?
No.
You have an obligation to know about psychiatric medications, though, right?
Yes.
There's a difference between what's known as nescience, which is not knowing what you had no duty to know, and ignorance, which is you don't know what you should know. Is that fair?
Yes.
So, did you ever gauge Lindsay's knowledge or ability to judge what medication would be good for her?
So that was my role.
Right.
I didn't expect her to know significantly the details about different psychiatric medications.
Is it important to know that a woman that's coming to you because of postpartum issues, shall we say, had prior problems in prior deliveries?
Yes.
And you'd agree with me that you're on the front line of healthcare for pregnant women when someone comes to see you, either pregnant or after having a baby, right?
They're usually referred by a therapist or an OB, but yes.
Okay. So being on the front line and dealing with these people, and you advertise that you deal with pregnant people before they have babies, right?
Yes.
And after, correct?
Yes.
Did she have any prior issues with her prior babies?
I knew that she had some anxiety symptoms with her prior, after her second child was born.
And that would be Dawson?
Yes.
And when she saw you after having Callum, how old was Dawson? Did you know?
A few years old, maybe 2 or 3.
Did she tell you what the side effects were after she had Dawson?
She did. I did not list them because.
Excuse me, that means you didn't write it down?
Yes.
So what is it, your memory? Then we'll go by that, right?
Sorry?
We'll go by your memory?
Go by memory about what? I don't recall exactly which side effects she said, but I recall that they were some of the very common ones, the ones that are temporary.
Hold on. You're telling this jury that you don't recall what the side effects were that she told you, but your memory is that they were general, common? Is that what you said?
Yes, because if they were anything else, I would have documented it.
Well, how about she took Zoloft? Did she take Zoloft, SSRI, after having Dawson?
I think she took it for about a week.
You think? Or she did?
She did.
So isn't that something that would be indicative of the fact that there was some psychiatric issues after she had her second child?
Yes, but she did not describe them as being severe.
Well, as a psychiatrist, can you ask her whether or not they're severe, or do you just wait for them to tell you?
Based on her description, they did not sound severe.
Tell me about bipolar. What's bipolar?
Bipolar is a mood disorder that has both depressive episodes as well as episodes of mania.
And is it your understanding that if a person has a difficult birth and in fact has some psychiatric attributes as a result of that difficult birth, that you should not prescribe SSRIs to that person because they could be bipolar?
Having a difficult birth does not, it's not a contraindication to an SSRI.
So after she had her second child, she took Zoloft, and you did not detail any side effects, and you don't remember any side effects. Do you agree that Lindsay had, at this point, a history of mental problems during postpartum?
She had a history of anxiety postpartum.
Anxiety to the point that it was prescribed an SSRI?
Yes.
And she also had mental problems when she came to see you, right?
Yes.
So she had mental problems after she had the second child, mental problems after she had the third child, correct?
Yes.
And you'd agree with me that this is not easy stuff for somebody to be talking about. People get embarrassed in our society if they had mental problems, don't they?
Some do.
She did, didn't she?
I'm not sure.
So, not documenting any of the side effects, did you think it would be important to document the side effects of the drug before you prescribed Zoloft a second time? She's telling you that she had. You don't know, but she had side effects with Zoloft. Was it important for you to document the second time that you're giving a Zoloft?
I did not feel that it was necessary to document the specific side effects.
So if someone comes to you as a person who is in postpartum and is all the symptomology that she had related to you, that if she told you that she was on Zoloft after her second child and had side effects, you don't think it's important to document the side effects, number one, right?
It depends what the side effects are.
Which we don't know because you didn't write them down, you don't remember it.
I would have written them down if
No,
they
not
were.
what you would have done. What did you do?
No, go ahead.
I would have written them down if
What did you do?
I wrote that she had side effects.
What are they?
I'm not sure.
And then you prescribed Zoloft again, didn't you, in 2022?
Yes.
Do you recall in the period of September of 22, October of 22, into November of 22, that she used the word overwhelmed, told you that she was overwhelmed? Is that correct?
Sorry, which visit are we looking at?
Well, the period of time, September, October, November, she used the terminology that she was overwhelmed.
Yes.
Okay. And when you were treating her, you didn't think that she was just merely overwhelmed with 3 children. You knew she was really struggling, didn't you?
I did.
And it was at that point that you diagnosed her with a psychiatric condition, and you prescribed psychiatric meds. Isn't that right?
I prescribed psychiatric medications. Yes.
So when you prescribed the Zoloft and told her to increase it, she told you that she was having all these difficulties. You told her to stop. Did you give her therapy when you saw her?
Yes.
What did you do?
I think that I
No,
provided
again, I
reassurance.
apologize, but not what you think. I want to know what you did. And that's why you write stuff down. So take your time and look at your notes. What did you do with this young woman for therapy?
On which day?
On what?
Which day are we talking about
When
specifically?
she came to you and told you that she was overwhelmed, and you diagnosed her with a mental illness and prescribed psychiatric condition for psychiatric meds, what therapy did you give her? Because you told us that when you're on the television, you still give them therapy too, right?
I do.
What did you do?
Well, I'm having trouble identifying exactly when she said the words overwhelmed.
Okay.
So it's hard to pinpoint exactly what I said in a span of, a number of different visits.
Did you indicate that there's information on the website that if a person has an emergency that they should do something?
I did, and I advised her the same.
So basically, if one of your patients becomes suicidal, and on that note, did she tell you at that point, up to November of 22, that she was dwelling on suicidal thoughts?
It was a while before she mentioned anything about suicidal thoughts.
Tell us when.
I might need to look through the records
right
to see
ahead.
when she first did. December 1st.
So on December 1st, what did she tell you?
That she denied feeling suicidal, but that she was close to feeling suicidal.
That's kind of like being a fisherman out in the ocean who's worried about the possibility of a storm and is thinking about the storm and is dwelling on the storm, almost in fear of the storm, right?
Objection.
No.
Is it?
I guess.
So when she tells you that she's, and I don't want to put words in your mouth, what did she say? She's having suicidal thoughts, or what did she say? How close to it?
She denied having suicidal thoughts, but felt that she was getting close to it.
Okay. So she was dwelling on it or thinking about it, right? Is that fair?
She was fearful of eventually having those kinds of thoughts.
To kill herself.
Yes.
And how frequently were the thoughts?
I'm not sure exactly how frequent they were.
Did you ask her?
It's
Sorry?
very likely that I did ask her the frequency.
Would that be in your medical records? When you see some patients, you have some patients other than Lindsay Clancy at that point, right?
Yes.
And you document when a patient, my God, when a patient comes in and tells you that she's in postpartum distress and she's close to having suicide thoughts to kill herself, that's important, isn't it?
It's important that I am aware that she's having these thoughts,
What thoughts?
that she is fearful she could become suicidal.
And she told you, I imagine, or you asked, how frequently these thoughts were.
I don't have it documented how frequently they were, but that is a question that I usually ask when we're talking about suicidal
So when we're
thoughts.
usually testifying in a murder case, we usually have facts that we can tell the jury, not speculation.
Objection.
Yeah. Sustained.
Did she tell you, or did you ask about suicidal thoughts?
Yes.
What did she tell you? If you don't know, tell us.
No, I know. Sorry, but it's what I said before, that that she denied having them, and she wasn't having them. We were meeting, but she felt close to it, close to having those thoughts.
Okay. So would you agree with me that many times patients, especially psychiatric patients, may minimize their symptomology?
Patients sometimes do.
And sometimes when a woman has just had a child and has other little kids at home, that they're worried about the government taking kids away from them, because you're a mandated reporter, aren't you?
Objection.
You're a mandated reporter, aren't you?
I am.
And if she told you, I'm having suicidal thoughts and close to it, and homicidal thoughts, you'd report that, wouldn't you?
Not necessarily. I think it really depends on the context. But having suicidal thoughts alone is not a reportable condition.
All right. So basically, we know that she was close to having suicidal thoughts to kill herself, whatever that means. We don't know how frequently she was having them. Yeah?
Today, I don't know how frequently, but at that point, I believe I did know how frequently they were.
Okay. So as a result of that, you then gave her therapy, I imagine, right? Through the television.
Yes.
And what therapy did you give her in November of 22?
I gave her supportive psychotherapy.
And what does that mean? It sounds great. What do you do?
It's listening to the patient and providing.
Sorry. Listening to the patient, like when they say they're having.
Hold on. Good. Sustained. Next question.
So,
She could finish the answer.
Right. Next question.
thank you, Ben. Listening to the patient, that would be when, for example, one of your patients tells you, after all the treatment that you had provided prior to that, all the symptomology that she had, insomnia, anxiety, all of that, that she's close to having suicidal thoughts, that would, I imagine, impact on you.
Yes.
So what did you do with this psychotherapy?
So I provided emotional support and validation
What
and
does that mean? Validation.
encouragement.
What does that mean?
Something like, I understand this is a very difficult time. It really, it varies on the individual.
Sure. How about Lindsay?
I don't remember the exact therapeutic words that I used.
Okay. How long did you give the therapy? Validation and all that stuff.
I don't remember exactly the duration.
Be about 10 minutes.
Maybe.
Through the television, right?
Through the computer.
So, as we pointed out, you tell the people that come to see you, when I say you, I mean collectively Astor Medical, that you would expect that if a person is in crisis, as you guys say, or is suicidal, that they would have to go to a computer or their cell phone, right? They would have to punch in your office, right? Look up the number.
We advise them to call 911 or go to the emergency room as quickly as possible.
How about suicide hotlines? Do you give them advice to call them?
That's an option as well, yes.
Sure. Did she call suicide hotlines?
I was not aware that she did.
Did you ever ask her?
I don't think I specifically asked that question.
Not specifically. Did you ask her anything? Did you beat around the bush maybe? You ask her anything about suicide hotlines?
I don't think I asked her about suicide hotlines.
Would it surprise you to know that she called suicide hotline in that time frame, not once, but twice, and was turned away? You guys were in the front line of this, aren't you?
No, overall.
It does surprise me, yes.
It does what?
It surprises me that she called them twice.
And you never asked her if she had ever called the suicide hotline, did you?
I don't think that I did.
Well, I understand. You're a doctor. You were trying to do the right thing. You obviously, this is just horrible, isn't it?
Yes.
She continued on with her treatment with you, correct?
Yes.
What was the next medication that you put her on? Let's say we're up to, I guess it would be the October 26th date. Is that right?
October 26th.
Is that when you prescribed Ativan?
I prescribed that on the 21st.
Sorry?
I prescribed the Ativan on the 21st.
All right. Did you prescribe anything on the October 26th appointment?
Yes.
And what was that?
Buspirone.
Buspirone. And would you agree with me that, is that also Vanspar?
Buspar or Buspirone are the common names for it.
Okay. You ever heard of Vanspar? V-A-N, V as in Victor, A-N-S-P-A-R? You ever heard of that?
No, I haven't.
Okay. And would you agree with me that there are a number of side effects of Buspirone?
Every medication has side effects, but
Okay, so my question is pretty simple. Buspirone, you mentioned it. I'm asking, any side effects?
yes.
What are the side effects?
They could be tiredness or dizziness or rarely some upset stomach, but it's generally a very, very well tolerated mild medicine.
And do you recall, was she taking any other medication at that point, if you know?
Yeah, she was taking some of the Ativan.
Some Ativan, right? Did you prescribe that to her?
Yes,
When did you prescribe the Ativan to her?
the 21st.
And she was compliant with your recommendations, right?
Yes.
Was she also reporting to you that she was taking Benadryl, like over-the-counter stuff?
It was being used as needed, yes.
So that's PRN, on the record is PRN or whatever, you take it as required, right?
Yes.
And she reported to you that she was taking Benadryl, right?
She reported that, yes.
And you didn't document how much she was taking, right?
It's only available as one dose over the counter.
Okay. Did she re-up the dose over the counter? Do you know?
She didn't tell me that she did.
Did you ask her?
I don't remember asking her about if she increased it. I think she was just taking one of them.
You think? Did you know that Ativan and Benadryl are contraindicated, that they can have a serious impact to the central nervous system and depressant effects?
Yes, but can I explain that when they say depressant?
Excuse me. The answer is yes, right? Is the answer yes?
Yeah, if the answer is yes, if that's the question, the Commonwealth may be able to ask you further questions if you'd
Okay.
like.
Well, I can't say yes to that entire statement.
All right. Next
Did
question.
you discuss anything about Benadryl combined with Ativan on October 26th?
I don't recall.
On October 26th, was she still worried about suicidal thoughts?
She denied that.
And on October 26th, how did she deny that? Do you have that noted in your record?
I do.
And what does it say?
Patient denies suicidal ideation.
Okay. So there's a huge difference between suicidal ideation and somebody having thoughts of suicide or being close to it, right?
Not exactly.
Well, you knew that the last time you spoke to the woman, she told you that she was close to having thoughts of killing herself, right?
Yes.
And you're her doctor, right? So what do? You just say, do you have, and check the box and say, do you have any suicidal ideation? And she says no, and you check the box?
No, it's not that simple.
Do you ask her, like, well, gee, the last time I spoke to you, you told me that you were close to having suicidal thoughts of killing yourself. Did you pursue that on the 26th of October?
Yes.
And what did she say?
That she wasn't.
Now, how long was that appointment, if you recall? Would you agree it was 17 minutes and then there was some therapy?
The entire appointment was something between 25 and 30 minutes.
And that was again through the television, right?
The computer, yes.
Computer. Did you also add a drug called hydroxyzine?
Yes.
When was that?
So that was the same visit as an alternative to the Benadryl.
Okay, so on October 26th, when she told you that she was taking over-the-counter Benadryl, I asked you what you prescribed to her, and you said Ativan, right? Right?
Yes.
And then I asked you about the contraindication of Ativan and Benadryl, right?
You asked me about that, yes.
And then you, on October 26th, started her on Buspar, correct?
Yes.
And what is the purpose of Buspar? Is that for anxiety?
Yes.
And what kind of drug is Buspar?
It doesn't really fall into a class, but it does act on serotonin.
So it's another similar to an SSRI, right?
It's kind of like a more mild version of an SSRI.
Okay. So she's on Benadryl over the counter, Ativan, which is a benzodiazepine, Buspar, which is an SSRI, and then you prescribe hydroxyzine on the same day, right?
They weren't all to be taken at the same time.
What's hydroxyzine?
Hydroxyzine is an antihistamine.
Okay. Is that over the counter, or is that, can you just buy that over the counter, or do you have to go to the back where the pharmacist is?
You have to go to the pharmacist.
Okay. And as far as you're concerned, she was taking the medications as she was required, right?
That's what I was told.
I'm sorry?
Yes, that's what I was told.
Did you, by her?
Yes.
And did you at any time tell her that she should keep a diary of her medications and keep a diary of any side effects that she has?
I didn't instruct her to do that.
You don't have to instruct somebody to do anything, but did you recommend it? Like say, hey, if you're on all these meds, if you're having an effect, you should write it down. When, time, date, anything like that?
I didn't tell her to do that.
Would that be helpful?
Maybe, but usually we go through all of that in the appointments, and we met very frequently.
Now, you'd agree with me that at this point, prior to the next appointment, which was November 2nd, she had gotten significantly worse, even after all this medication that you had been prescribing, right? Did you make a note that she was telling you that she had depression and that she was crying, had more anxiety, insomnia had increased, brain fog, and worrying about suicide?
In the couple weeks after starting those medicines, I don't recall that the symptoms were significantly exacerbated.
Okay. Friday afternoon, you answered the DA and you said that you recall that she used the word brain fog, right?
She used that at some point. I don't recall when.
Okay. What is brain fog?
It's a very subjective feeling that someone might have where maybe it's hard to think of a word that you're trying to think of, or maybe it feels like maybe you're thinking of things a little bit more slowly than you normally would.
And how often was she dwelling on suicide?
At what point?
At the point she told you that she had anxiety, insomnia, brain fog, crying inconsolably.
Objection, if we could have a date.
I think he's going to get to that.
Good. October 26th, heading into November 2nd. Do you recall, I'll rephrase it, do you recall going into the November month, meeting with her, and she told you that she had brain fog?
It was mentioned at some point.
Okay.
I don't see that on the 26th specifically.
All right, so let's talk about brain fog. Did you ask her what that meant? Because when you say subjective, that means that's her interpretation. That's in her head. She's telling you, right?
Yes.
As opposed to objective, which would be what people in general would think, right?
Yes.
So when she's telling you, in addition to the anxiety, in addition to the crying, in addition to the stress that she was undergoing, she was worrying about suicide, she talked about brain fog. So you must have asked her, what does that mean? Subjectively, what does that mean?
Subjectively means in the patient's, own opinion, that's what their experience is.
Okay, so she's the one that's inside her head, right?
Yes.
So what were the symptoms? What is it? When a patient tells you that they have brain fog, is that something you would consider as being a potential side effect of the medications that you would put her on?
It depends.
On what?
I mean, sometimes it could be, and sometimes it could be unrelated. It's a symptom of depression as well. So sometimes it's hard to tell what it's attributed to.
So at this point, heading into November, your answer was to prescribe more medication, 3 more drugs, right? You prescribed Ativan, or increased the Ativan. What was her load for Ativan at this point? Do you remember?
Sorry?
What was her milligrams, if that's right, or nanograms, whatever it is, on the Ativan, on the script that you had provided her?
Objection, if we could just have a date.
I think she said, no, if you can answer that, go ahead.
Which date are we referring to for the Ativan? Because there were there. I'm sorry.
She already objected. He already said you can answer it. When did you increase her Ativan and to what level?
So she was prescribed Ativan 0.5 milligrams.
Right.
And then when I next saw her, she said it was a little bit helpful. So I said you could increase it and see if 1 milligram is more helpful.
Did she increase it?
Yes.
And when was the next time you saw her to talk to her on the television or on the computer?
Well, I saw her on the 26th, and then I saw her on the 31st. I'm sorry.
How was she on the 31st? Halloween.
Sorry.
How was she?
That's not my note. That's her therapy note.
Okay. So how about this November 2nd? Was that the next time you saw her?
I saw her on November 2nd.
And she told you that she was hesitant to use the medications, the Buspar and the hydroxyzine, right?
She said she was hesitant to try the Buspar.
She was scared of the drug. She was scared of the drugs, right?
She was afraid to take a medication.
She wasn't doctor shopping and asking you to give her drugs so she could get high. She was asking you for help. Isn't that right?
Yes.
And she was afraid to take the drugs and told you that she was afraid to take the drugs, right?
She told me she was afraid to take the Buspar.
Did you advise her or counsel her or give her therapy about that? Validations?
Yes.
And what did you tell her?
Well, I advised her of, the risks.
What were the risks?
Well, the risks of medicine, like we had said, sedation or dizziness.
Okay. How about interfering with sleep?
Buspar doesn't usually interfere with sleep.
Not usually? Did you ask her about any thoughts of suicide or being close to having thoughts of suicide?
Yes.
Did she indicate to you that she had any thoughts of suicide at all?
Not at that date.
Did she use those words, or is that a box that you checked off?
I don't remember her exact words, but we talked about suicide or, thoughts of hurting yourself.
Right. And there's a distinction between, in your records and the notation, between suicidal ideation and I quote, worrying about, thinking about suicide. Would you agree with that?
Yes.
And what did she mean when she told you, as her doctor, that she was worrying about, thinking about suicide?
You mean in the prior appointment?
I'm talking about a woman that's sitting in front of you on your television or your computer telling you that she was worried about thinking about suicide.
Well, on the 2nd, she didn't say that.
Okay. When was the next time that she told you that she was worried about or thinking about or suicidal ideation?
That was the December 1st visit.
Okay. So go back to the November 2nd visit. Would you agree with me that she, after you talked with her for that period, however long it was, that you then brought up 4 medications to her, recommending that they might be safer, and I quote, safer alternatives? Would you agree with that?
I see the word alternatives, not safer alternatives.
Do you remember talking to her about Remeron?
Yes.
Did you recommend that she take Remeron?
No.
Did you ever prescribe Remeron?
No.
And is that mirtazapine, as far as its generic name?
Yes.
And Remeron is an antidepressant, isn't that right?
Yes.
And you did not feel that would be an appropriate medication for her to take at that time?
It was a very reasonable option, but we didn't decide to start it.
So is this a collaboration? In other words, you and the patient, you would both make a decision as to when to start a drug? Or is it your decision and advice to the patient?
Well, it's ultimately my decision, but the patient's thoughts about the matter are very important. At the end of the day, the patient has to go home and take it themselves. I'm not there to ensure that that is happening or not.
So you had a November 22nd appointment, right?
Yes.
And it was at that time that she told you that she had been to see South Shore Perinatal Clinic, right?
Yes.
And did she tell you why she was seeing someone from the South Shore Perinatal Clinic?
I think she told me that it was because they were exclusively focused on treating perinatal conditions.
Yeah, but so were you, right?
Not exclusively. I'm a general
I
psychiatrist.
see. And did she mention the name of any doctor or nurse practitioner that she was seeing at the South Shore Perinatal Clinic?
Yes.
Who'd she mention?
I think she said something about Julie.
Paul?
Yes.
Okay. And a woman by the name of Nurse Gelada?
I heard her name a little bit later, but
Okay.
yes.
Did she advise that, in fact, by script, she was using Ativan and Benadryl, and you told her to taper off the Ativan at that appointment, right? Had she tapered off the Ativan?
I think I told her I gave her a prescribed taper prior to that appointment.
What does that mean? What does that mean? You gave her a prescribed taper?
So I told her that she should reduce her dose by 0.25 milligrams every 2 weeks until the medication was stopped.
Did she do that?
I mean, I don't believe that she completely stopped it, no.
No? You don't believe, or she didn't?
Well,
Trying to give the jury facts.
Yeah, she said she was taking Ativan, so no, she didn't completely stop it.
Had she tapered?
I'm not sure how much she had reduced the dose because I wasn't prescribing it again.
Right. So, did you know that she had been, or had she been, to any emergency wards between that period of time that you last saw her and when you were seeing her on this meeting?
I know she went to the ER, but I think it was after that.
Okay, which ER did she go to? Do you know?
I think she went to Mass General.
Do you know why she went to the ER?
Because of depression.
So, was she treated at the ER? Did they make any, to your knowledge, as her doctor, make any recommendations?
I'm not sure what they told her, but they ultimately
Go ahead.
discharged her. They didn't admit her.
Go ahead.
Sorry.
That's all right. Was she put on any medication?
Not from the ER.
When you looked at the records from South Shore Perinatal Clinic, what did they indicate about suicidal ideation, worrying about suicide, close to suicide, anything?
I didn't have access to those records.
You're going to keep your voice up so everybody can hear you. You what?
I did not have access to those records
None.
because we're a completely separate clinic.
Seriously?
Objection.
She's visiting with you as a patient and you can't access her medical records? Is what you're telling this jury?
I did not have access to them, no.
Could she have signed a release, a HIPAA form?
Yes, she could have.
And you could have got the records.
Yes.
But you didn't.
I did not feel like it was necessary because she provided all the relevant information about her treatment there.
How do you know? She's got a mental disease and she's suing you and she's on all this cocktail of drugs. How do you know that she is an accurate historian at this point in her life?
It's felt very accurate when she was able to recall the names of the medicines, doses of the medicines, specific days. She provided a lot of incredibly detailed information. So it showed me she was capable of doing that.
So when you talked to her husband, Pat, how many times did you talk to her husband, Pat?
I think
The guy was living with her.
I think it was once.
And he came to your office, right? No, he didn't. He got on the television or on the computer screen, right?
Yes.
And when was that?
I think it was the December 16th visit.
So let's.
Before we get to that,
Okay.
it's probably a good spot to stop. We're going to take the morning recess, and then we'll come right back. Okay?
Court, all right. Sure, please close the notebooks based on your chest. Wait, please. Exit outside, please. Plug back in on the phone back.
Yeah. Hello, thank
Hello.
you so much for being here. Our Maggie showed up and she was supposed to take today off, so I'm a little surprised.
Well, I did send you a message in the back chat just to let you know what has happened because you know it never goes all right for me. So I'm sitting eating orange peel now.
Oh, that's disgusting. You guys, just to let you know, Maggie absolutely eats the whole orange, the peel and all, just like an apple. It's disgusting to watch, but I still watch her because she fascinates me. All right, we're going to get right into this, guys, because we know that these little side breaks are only like 15 to 20 minutes. And I feel like
Come
there's a
on,
couple
Lee.
things
Let's hear it.
that I feel like there's a couple things that we need to talk about and consider for this. Thank you all, first of all, for being here. We appreciate you so much. Will you double tap your screen? Magic happens for you and for us when you do that. Please hit the like. That's all we ever ask of you guys. That's it. I don't even ask you guys to sub up. If you want to, you can. If you don't, you don't. I'm good with it. I never ask for any money. I never, we will never, ever, ever accept money on someone else's tragedy. I'm not into it. Look, if other people want to do it and their conscience is okay with doing that, then go right ahead. But no, I don't monetize none of this. I don't ask for any money. Don't drop anything like that. I appreciate the little jewels that are given, but the only thing I ever ask of anybody is just to give me a like, because I really do believe that is how the people who like what we do here will end up finding us. I just really, really do. All right, so we're going to get into this real quick. Over the weekend, Maggie and I were working on this case. Y'all, I just happened to sign on to one of my Facebook things, channels that I follow. I follow a whole bunch of them in true crime and things like that, because a lot of times families are in there and stuff like that, you know. Anyways, I signed on to one of my Facebook things in time to get the second round of the crime scene photos before it was taken down. The first time somebody posted them, it was taken down, and I was like, dadgummit. So I was like watching like crazy, right? And we did get the crime scene photos. Maggie is editing for me, just taking out the stuff, and I have yet to be able to put them in a file so we can see them. But we will have those by lunchtime tomorrow for all of us, and we will go through that little by little. The second thing I want to address is this weekend I did a lot of research and a lot of talking about this case with different people that don't know the case. And there's a reason why I do that. The ones of us that get invested in this and we just get like so tied up in it, it's easy to find someone who can validate your feelings on it and things like that, right? Especially if they haven't watched from the beginning, so they're only getting part of the story. I like to talk to people sometimes that don't even know this person and never heard of this case or whatever, and I like to give them a overview real quick of it and things like that and how they feel. And I ask the questions. I'm like, have you ever dealt with this? Have you ever dealt with postpartum depression? Have you ever dealt with a psychosis? Have you ever dealt with different kind of psych meds and things like that? What was your reaction? Y'all, listen, I get into everybody's business. I really, really do. And the big theory that's going on right now, and everybody's picking up on it. Look, I'm not saying you're wrong or nothing, but I think I can prove that it is wrong. Is that Patrick Clancy, the father of these children, the ex-husband of Lindsay, is now the newest theory running right now is that he either threw Lindsay out the window after finding the children, or he actually killed his children, threw Lindsay out the window, and then made her take the blame for it, or any little thing that is on those kind of lives, uh, along those lines, should I say? And I think it's really easy to discredit that. And I'm going to go ahead and do it real quick. Listen, you don't have to agree with me. You're not going to hurt my feelings whatsoever. Not at all. Do your own research, figure it out for yourself, but never, 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 I can tell you, never, never, never take anything from this channel or anybody else's channel and just go with it. Do your own research, use your own God-given brain. You don't need a medical degree to know when things are right or wrong. Okay, just use that, use some common sense, you'll come up with it. Okay, so one of the things I went and I really did some work on was CPR. Okay, we know how the kids were found according to um, Patrick Clancy and according to the EMS that showed up that day. And we do know that Dawson, God rest his soul, was already completely gone. And that when he untied Cora, she was also dead as well. Callan, the baby, 8.5 months old. Now they have already given us who went first and who went last. So the order of death went Dawson, then Cora, then Callan, the 8-month-old. So I researched like CPR. Not that I haven't given that before, you guys. I am certified CPR because I did work in the that field for a while. I still keep up with my certification, so you never know when you're going to need it. It's a good thing to have. Anyway, so I researched how long it takes for the brain to stop once blood quits pumping to the brain. But I had to not only just look at it as a whole, I wanted to see it in an adult, maybe a teenage size, and then an infant. Okay. In an infant, in the time that it takes, and I pulled this from Medline Plus, you guys, that's my source that I'm given now. I looked everywhere and was given about the same thing. And I want you to know that the review date on this, I got it as close as I could, was February the 10th of this year is when this came out. So I got this from Medline, and I wanted to tell you that it's different in all cases, you guys. It's different when the heart stops beating because, the heart stops beating because of loss to blood to the brain. There's a couple of different reasons, and I'm going to give you some of the causes. Okay, choking, drowning, electrical shock, excessive bleeding, head trauma or other serious injuries, lung disease, poison, and suffocation. Okay, it takes a baby. Now we're talking about a baby from 1 month to or newborn to 1 year old. Okay, that's what I looked up on this one. And it says permanent brain damage or death can occur in as little as 4 minutes if if a baby's blood flow stops. Therefore, you must continue, CPR. Okay, until the infant's heartbeat and breathing return. Okay, so if the brain is not getting any, if the blood is not supplying any sorry, if the heart is not supplying blood to the brain, then automatically within 4 minutes, that child can automatically start severe, not just a little bit, but severe brain damage. So brain damage is already happening as the blood flow slows down, but once the blood flow stops, 4 minutes tops, you're already dealing with severe brain damage. Okay. Then I put in, I researched on how long a person can, how long can a heartbeat have stopped supplying blood to the brain before it's too late to do CPR on a baby this age. And it says 4 to 6 minutes. Okay. So the reason why I brought that up, you guys, is because of the new things that are going around right now about how Patrick is responsible for killing his children, and he's letting Lindsay take the fall for this. We have got the timeline exactly when the food was called in, right? We've got the timeline of when Patrick showed up to the CVS, to the food, and then you guys don't think he doesn't have GPS on his phone and stuff. That's already all been done too. So the police and forensics have already gone through that, and they've got second by second down of where Patrick was probably all that day. Your phone has all that data with you. We know he had his phone with him because he talked to Lindsay prior to him coming home, right? So I think it's pretty safe to say that with the data that they were able to get from his cell phone, from Lindsay's cell phone, there is and the GPS on it, I think it's safe to say that they could tell when exactly he was in that home, whereas he could have committed these crimes. And there wasn't enough time from the time that the GPS shows him back at his house to the time of his 911 call for Callan, the 8-year-old baby, to even be revived. So the whole theory of him killing the kids and throwing his wife out the window or making her, that I think forensics has already squashed that one. People are just looking for different different reasons. And my name is my name is Blair. Sorry. Why would she not tell them? I think she would tell them. I think she would. Look, let's just go off on a let's just go off really quick into the wild blue yonder and say that Lindsay was in some way being abused by her husband, whether it's mentally, physically, emotionally, that could have pushed her over the edge to do this or whatever. Listen, I don't feel like talking about my own situation, but once a person who has been abused, whether it's a child or a woman or a man, has abused and they're scared, if they're scared of their abusers, once they start feeling comfortable that the abuser can't get to them, that's when they start talking. Now they won't tell everything at once, they're not going to, it comes in increments, and it comes out little by little. The safer you feel, the more time that you're healing through that process. So uh Yeah, I think that I think the forensics using the cell phones, both cell phones, using uh, the cameras in both establishments that he was at, and then how long Callan actually lived, because remember he did not have a heartbeat at all when he was found. Okay, therefore he would have only lived for 4 minutes, 4 to 6 minutes. Okay, I do believe he was already brain dead. That's why I think they couldn't bring him back. Yes, they were able to establish a heartbeat, but other than that, I think he was already brain dead. And within 6 minutes uh, from the time that the blood cut off from his heart to his brain, he would have been completely dead, and they would not have been able to bring him back. Believe me, I've done a lot of it, a lot of the research. I have found out, and I've got to cover this. Golly, I got to find time to cover all this new Koberger stuff that I've been researching. Listen, it is absolutely possible, and I can prove it to you on my own phone. I have got my kids' GPS, right? I am this OCD person. Before I go to sleep at night, I'm like looking at all my family who has
She
allowed me
does.
to have my their GPS, and I could tell you,
Hmm.
I zoom in, I could tell you exactly what room in their house they're in. Did you guys know that?
No.
Yes. So
Oh my God.
if you have an Apple phone, okay, Apple Watch, Apple phone, and you are following someone like 360 Live, or you're following their location. So like let's just say I pull up my daughter's location. I can What you see there is I see her address. Okay, she's at home. If you zoom in, just zoom in, you could see, and you know how the house is laid out, you could see exactly what room they're in if you know how the house is laid
Well,
out.
I'd feel comfort through that because I'd think if I ever go missing, I'm not going to go missing for long. But is that because of an Apple Watch or the
I know
phone?
that one of my kids does not have an Apple device, they have an Android, so I
Hmm.
cannot follow her GPS, but her daughter, who lives at home with her, has an Apple device because her mammy, that would be me, um, bought her one
So,
so that I
so
could
it can
keep
be
track of
either a
someone in that
phone
freaking house.
or a watch.
Oh yeah, because your Apple Watch is basically your phone, just on
So,
your
okay,
on
I'm
your
just
arm.
thinking
Yeah.
that if you're going to
Hmm.
kill someone, wouldn't you take the watch off them? Did she have a watch on her?
It didn't say. I haven't heard anything about that, so I
That'd be
can't answer.
interesting, wouldn't it?
Yes, I can't answer yes or no on that, but I will tell you, wherever, I mean, you can zoom into the house. If you know the layout of the house, you could tell what room they're in. Now, does that mean that they're carrying their phone in their pocket? No, that just means that that's
Hmm.
where that phone is in that house.
Well, hers was
Believe
on the
me,
bed.
I have freaked out my kids many, many times, calling them and asking them what's for dinner because I know they're in the kitchen, things like that. And then sometimes they laugh at me and they're like, "Mom, my phone's upstairs." Now that's one thing you can't tell. If there's stairs involved, upstairs, downstairs, or there's a basement, it's gonna still put their phone, like they could be in the living room, or exactly where the living room is upstairs, or exactly where the living room is downstairs. It's not gonna tell you where on that where in the do you see what I'm saying? Like,
Apparently,
yeah, it
her
doesn't tell
watch
you
was
that.
on the dresser.
Oh, okay. See, I did not even remember that or
They're
even
saying
know
that
it.
the phone was in the drawer, but I'm sure I seen a phone on the bed,
Okay. The
but I
phone
could be
is on
wrong.
the bed. We do have that. That's in one of the crime scene
Yeah,
photos.
I thought so. Yeah,
You're right. You're right. So, yeah, I didn't even know about a Apple Watch. So thank you for giving that to me. I appreciate it so much.
yeah, me
But
too.
I just think you guys look. I know we want to I know a lot of this doesn't make sense. We get it. We get that there's a lot of holes, there's a lot of stuff that's not being told to us because um maybe it's too painful, maybe they think it's irrelevant, maybe they don't want to put Lindsay through it, don't want to put Patrick through it. Um they think they've got enough of what they're giving us to get either a conviction of her, or the defense thinks that what he's got is enough to get her just sentenced to a sanatorium for the rest of her life, right? Because that's the plan. She's not getting out, you guys. It's not like she's going to walk amongst anybody else for a while. She's still got to pay for that crime. If she didn't do it by malice, then she did it because she's very, very sick. And that kind of a person does not need to be walking the streets. So all I'm saying is if you guys can do, instead of just believing the new theories that people are coming up with, because they don't look like the looks of Patrick, they don't like what he's done. Listen, I'm right there with you guys. I don't like Patrick at all. I want to punch him in the fucking face. I'm not kidding you. I do.
Don't start it.
But that doesn't mean that he killed his kids. Was he a terrible father to his children? Yeah. And I only say that because he should have got them kids out of that house. He neglected his
100%.
children. He neglected his children. He
Yeah.
neglected his responsibility as of a dad. He did not protect them, and I think he also failed his wife. That's what I
I'm
think.
shocked at
So
how many people think he's not he should be unaccountable for what he did. I mean,
yeah, he's not.
he
He's
should
going
have
on with
some
his life.
accountability.
Absolutely, absolutely. And like I said before, I'll probably keep saying it until this is all over with. Maggie, is that what should the accountability be? I don't know, maybe stand up in court and say, "Yes, I
I
failed my
should have
kids.
got my kids out.
Yes,
Yeah,
yes." Maybe just the shame is enough. But
yeah,
when you go on and you marry and you have a new family, you're living your best life. You couldn't even wait. You couldn't even tell your wife before she became your wife, "Hey, we're having a great time here, right? I mean, we're living
mm.
together, we're
I
doing
don't
the
know how
deed,
we
we're
even got,
no, yeah,
but
he
ready
failed
for
his kid.
hanky panky,
Yeah,
knowing that he should have
I
got his kids
mean,
out and he never.
to each their own, you know what I mean? As far as sex goes, sex is sex to me. But making a commitment to another woman and to more
So,
children when you have not even put the memory and everything of your children, their dignity, their justice to rest yet, like you just are like,
yeah,
all right, we've got them buried now. Love you guys. Hey, listen, Pops is out of here. I'm going to a deluxe apartment in the sky over here in New York. I'll be back, guys. I'll come and visit.
I
And
couldn't
I'm
be in my
sorry,
baby's grave. I
that's the
couldn't.
way I see it.
Me
So
too.
I don't know what the punishment should be. And it's not just him. I blame both sets of parents. I blame her family. Listen, we are all responsible in some way. If you are close enough to your family or a person in your family that is going through some kind of crisis, to protect at least the children in it.
Yeah,
He didn't grieve at all,
definitely.
QB
I
says.
mean, he's got to be struggling now with that. Surely that's got to be his punishment. I mean, there wouldn't be a day that went by that I'd be questioning myself and torturing myself over the fact that I was told I'd hear a voice in my brain saying I've got thoughts of harming the children.
Hmm.
That'd be playing over and over in my head and me not getting them kids out.
Maggie, I know I'm cynical sometimes. I mean, I really do try to play defense for both sides. You know what I mean? And I do. I really do. But
Hmm.
I'm just sorry. I don't think he feels bad. I don't think
You
he
don't?
feels bad. No. No, I don't think he felt bad 4 months after he put his babies in the ground that he moved to go be with the girlfriend in the deluxe
I mean,
apartment
I
in the
don't know how
sky
he did
in
that.
Manhattan, and then had
No, I
another
don't know how he
child
left them.
before he
See,
was able to
like,
you know
sorry, Lee.
no, go ahead.
No, I just think they said there was no problem in the marriage. They were very happy. They loved the children. They had pictures and everything everywhere. Showed her she loved the kids. Everyone that's got up and said they loved the kids. So I don't understand. All right, she's admitted to murdering them, but Annie's there supporting her now. How you can leave within 4 months your baby's graves, your wife, divorce her, and then move on and live
Hmm.
somewhere else, and then you're married the following year. No, sorry, it wasn't the 2 years, but you don't even put off getting married until this trial is over, and then starting afresh. Like, if that was me, I'd be like, no, you see to your children, you've got to get them justice, whatever. And we'll marry next year. That year will be ours. This is your babies. Not even that.
Yeah, I don't know. I got no sympathy. I don't think, let me just say this. I want to show what, hold on. Lily says it right here. She says, men are like that. They move on quickly, especially if he needs to create some normalcy to not completely fall apart. I don't think all men are like that, because I tell you what, if something happened to my husband's kids, even right now as grown adults, he would fold. He would fold. He would.
Yeah.
So I don't think all men are like that. I think he's like that. And I think, and this is just my opinion, you take it for what it's worth, believe what you want to believe, but the timeline of events in Patrick's life tells me that he was having an affair with the woman that he married. And the only reason that is not going to be brought up as a defense is because of this. Because at first I was like, oh man, I just hope the defense goes ahead and just reams him and makes him say when he started that relationship with his wife, right? And if he was truthful, he'd have to tell the truth. I'm sorry, I'm sitting back. So the reason why I think the defense is not bringing that up, you guys, is because it will paint a different picture of Lindsay than what they're trying to show. They're trying to show that Lindsay was in postpartum psychosis state, given too much medication, right? But if Patrick goes and says, yeah, I was having an affair, Lindsay found out, then all of a sudden the prosecution can come in with, oh, so you killed the kids to get back at Patrick. You're still guilty, right? So it just, I don't know how true that is, but listen, I'm a woman, okay? We feel things, men feel things too. And I just think timeline wise, listen, if that kind of timeline came out with my husband, I'd be like, you dirty fucker, you better go ahead and sit down, tell me what you did right now. Cause I'm gonna find out anyways. I got ways. I'm gonna find out, and then I'm gonna go find your girlfriend and I'm gonna bring her here. And then all of us are gonna have a talk, but you're gonna shut your mouth and she's gonna tell me, let's just see if it all adds up, okay? You dickhead. Listen to me being mad at my husband. He hasn't done anything wrong. That poor guy can't get away with nothing.
Gets it every time.
Maggie, I have dreams about him. I wake up, I'm so pissed off at him. And he's like, what did I do in the dream?
Yeah,
I do it all the time. He's like, what did I do in the
dream
dream this time? And I'll stay mad at him all day. I won't even cook dinner. I'm like,
it's a horrible
fuck
feeling.
you. Do you know what you did to my heart in that dream? Like, don't talk to me right now. No, I'm serious. I am crazy. Poor guy. I have a great husband too. I love him to death. To death.
Oh, see the way she says that, guys? We could be following a trial soon.
Till death do us part, believe you
dun,
me.
Dun, dun.
BP.
Well,
all
guys,
right.
I read, now how true it is
know.
I read up that the week after the murders, Lindsay called Patrick, said she loved him. He was asked, did she mention the kids? He said no. So I'm just letting you know that. But I want to know, it's still ticking in my head. Now, I don't know whether I've missed it, but I want to know the first time she mentioned her children after waking up, what she said and what she said to admit to the murders. Does anybody know? And if you do know, can you tell us where you read it, please? Thank you.
Now, I do know this part of it. I know Maggie struggles with that part of them, the first thing she says when she wakes up is, do I need a lawyer? Maybe she said hello prior to that, but the major statement about the crime was, do I need a lawyer? And Maggie says, what do you say, Mag? I don't need to speak for you, but
I say, why would that be a first words? Because if I wake up obviously she's realised what she's done because she's asking for a lawyer, or does she need one? Whatever. My first words, if I woke up, I'm going to go hysterical. If I've remembered, I am going to be
Me too.
hysterical. I'm not going to ask about a lawyer. I'm going to say, what have I done? What the fuck have I done? Oh my God, my babies, please tell me this. I would not be asking for a lawyer because I wouldn't be bothered if I got a lawyer or not. I'm not going to be here. I'm going to do anything to take myself out. It wouldn't be, do I need a lawyer? I'm struggling with that.
You guys, I have to comment on this real quick from Lunchy because it cracks me up. Only because I know this girl like the back of my hand, y'all. She said that she's got to run off into, she's got to run off into the doctors, you guys, to the hospital, and then back to her home. It's a whole thing with her, you guys. She's a caretaker for her family, all generations. And then she said, I'll be listening. Don't make me pull over. Listen, if I could tell y'all how many times she's taken her mother-in-law or sister-in-law, she's taken them somewhere. She lives in the back hills underneath a rock in the mountains, you guys. You have to pump sunlight into her when you get her off the mountain. Listen, she's country pride, but homegirl will pull over her car just like that. Get in here and say, knock it off. Like, I'm watching and I'm listening. Knock it off. Or she'll just block people, pull on the side of the road. Oh, you got to go. You're out of here. I mean, she's not kidding when she says, don't make me pull over. She's that girl. She is that girl. Cracks me up. Cracks me up. There was something in here somebody said, Maggie, and I wanted to wanted to respond to it. I turned everything blue. I don't know how to do that. Is why she did. Okay, so did you guys hear? I just heard this. Remember when the husband took the stand and you guys we showed that part over again, and then we just showed Lindsay again, and how how most of this trial we've had no reaction, not like a twitch in her mouth, not not nothing. We see her turn her head away so that she can't be filmed maybe crying or being upset or whatever. But when Patrick went on that stand, we saw real emotion in her face. What the emotion was, I'm not sure. I've got my own thoughts. I think it's pain too. But we don't know. So that's one time that we did see some real emotion with it as well. When I forgot where I was going with it. Damn it. Freaking menopause. I hate it. It was going to be good. Listen, I'm professional.
Well, think about it. Let me read one of these out while you're thinking.
Okay.
So, okay, where am I? Let me scroll up a bit. On Facebook, as a minister came on, and he was in there to give her last rites when she came to, and she was screaming where her family was. True or not true, I don't know. Now, I did hear she did ask about her family, but it never, I mean, I know a family, her kids and her husband, but it just made me think, a family, I'd just be saying kids. That'd be my first thought. So I don't know. I haven't, but it hasn't been on here, has it? No one's mentioned on here. They did mention when she woke up, she asked about a lawyer, but no one said how she admitted to the killings. What was her actual words?
Yeah. And hopefully that's going to come up. Hopefully that's going to come up.
I hope so. Yeah. I'm just hoping that I haven't missed it. That's what I mean.
Well, surely out of both of us and everybody that's been in this chat every day, somebody would have been able to say. So, but so now I know this is what I was going to say. How do you speak with the crushed thyroid coming from someone who survived thyroid cancer? And I know they were talking about that. That's what he was trying to get to. Listen, that's another way that, in my view, that they failed her, because a lot of what she's going through, it reminds just this is stuff with the meds and with the trying to understand what's wrong with you and going to the doctors. I was at the doctors every freaking day. Like, I just knew I was dying. It was terrible. I was having 6 or 7 panic attacks a day, and it was my thyroid, you guys. And I am still pissed. I will forever be pissed that they didn't do a metabolic panel on her. I will always be pissed off about that. I don't understand. I heard about the minister as well too. But do remember, you guys, do remember this. How long? So when I was listening to Vinny, I think it was Vinny Politan this weekend. There was he was interviewing somebody who's been in the courtroom every day. And remember when Patrick first came up, we were all like, oh God, look at her face. She looks so sad and confused and everything, like just really painful. I wonder how long it's been since she's seen him face to face. And that man that has been in the courtroom said that was the first time she had seen Patrick Clancy since that night.
Wow.
Now,
So couldn't he go and see her at any point?
yeah, of
Because
course
I
he
just
could.
want to go and see her. I just want to grab her by her neck, but I don't understand. He hasn't been in to see her.
Yeah. Yeah. So he hasn't. Now, I'm not saying they didn't talk on the phone, but that man said that was the first time he had seen her since the 24th of January,
Wow.
the year that they passed away. But do you remember? So when I thought about that, I sat back and I went, And when exactly did Lindsay talk about wanting to immediately? It was before she ever went to this went it was actually before she went to be charged. Remember when she was laying in her traction in the bed, and you could only see her eyes because she was wearing a mask and she was in the
Yeah.
hospital bed and she was being charged with the crime. It was before then that she was already changing all her stuff to take care out of Patrick's hands of her and put it into
Yeah.
her parents. Why? That's another reason why I think Patrick was having an affair. She knew
Yeah. I too.
immediately when she woke up to get him off of all of her paperwork that says he's next of kin,
He
that her
went to New
family,
York, didn't he, Leanie?
4 months later.
No, he went
Oh,
to New
yeah, he
York
went to you're
before.
right. Yep, you're
Yeah.
right. 4 months is when he moved, but he, yes, made at least one trip that we know of. There's so much
That's where
we
the
don't
other
know,
woman
though.
lives, guys.
And that's where they live now. A deluxe apartment in the sky,
Yeah,
y'all.
so he
I
was
can't help
going
but
there.
say,
She was a runner. I think when they've been running in these 5Ks, she's been there. That's how they'd known each other. And then before you know it, she's a shoulder to cry on because he's having a shit time with his wife, going through all this mental health stuff. And I think that's what's happened. And he's been there. He's been over to New York before the kids' murders, and then 4 months after to live there. Wow.
Lisa, yeah, yeah, if we go with that theory, or if it could be proved, maybe she did want to punish him, and that's why she took the kid's life, and maybe she was not
Or
intentions of killing her own self.
maybe she was going to take her life and she wanted to take the kids because she always thought no one could look after the kids like her. I
Right.
mean, maybe that was what's going on in her head. If I'm going, they're coming with me. But surely to God, I mean, obviously, any way you kill your children is horrific. But
hmm
I'd have had to do it where they went asleep. I'd have had to put them asleep, give them too much, whatever, where they just went asleep and didn't have that struggle, didn't go through that. That was horrific.
All right, guys,
I'm
we are going
struggling
right
with
back.
that as well.
We're going right back in the courtroom, y'all. Let's see what's going on here. Erica says, I got thyroid problems, and when I'm feeling some type of way, I ask for help. Believe me, I feel some type of way all the time with this stupid thyroid I've got. All right, let's go, you guys. Let's go. Thank you all for being here. We're going right back in the courtroom now.
Is the sound on, Lee? I can't hear a thing.
Where you have, I believe it's called.
Is
Thank
it on
you.
now?
Yeah, it's on now.
It was showing
I
on
had
my. I
trouble
don't know
hearing the
what
date. Can you
happened.
repeat that?
Sure, October 20th? Sorry.
Okay.
So looking at the interview history, that's when that you decided to start Zoloft. It says a week ago, right?
That's when the patient started it, yes.
Okay. And she then increased the dose, and it says last night, right?
Yes.
And what was she telling you on the computer screen when you were talking to her? What did she say about increasing the dose of the Zoloft?
That she felt awful. She couldn't sleep. Had insomnia, which became worse when she increased the dose. She didn't want to eat. She was having diarrhea. Food felt really unappealing. She was more depressed on it, crying all day yesterday, which is not normal for her. She had some mental fog and was terrified to start something new.
Did she also tell you about her anxiety level?
Anxiety was really bad even before med. Now, hard to differentiate. Overnight, racing thoughts, paranoid of getting suicidal thoughts, something bad happening, doesn't want to be alone.
That must have given you concern that you had a pretty sick patient on your hands at that point, right?
I was concerned, yes.
So you gave her some therapy, did you?
I gave her some therapy in conjunction with discussing all of her symptoms and assessing her and managing the medication.
Okay, and again, I apologize. You have to keep your voice up so people can hear you way down here. So when you say you were talking about the symptoms, and what did you do? Just talk about the same thing that we've just gone over, the symptoms?
There were a number of them to discuss in more detail. That's the summary of them.
Okay. So did she discuss it in detail?
Yes.
Did she tell you that her symptomology at this point on October 20th was so bad that she had to have her mother come and stay with her?
Her mom was coming to provide support, yes.
She wasn't coming to provide support. She was coming to stay with them, to live with them, wasn't she?
Yes, I don't know for how long, but yes.
Did you bother to ask her? Why is her mother having to stay with her?
Because she needed some help.
Do you know how long her mother stayed with her?
I don't.
Do you know that she ended up sleeping in the basement?
I don't.
Do you know that she ended up sleeping with her mother?
I don't.
So you decided that you'd stop the Zoloft and you would monitor closely, right?
Yes.
What does that mean, monitor closely?
Well, I saw her the next day, so that's monitoring, an example of monitoring closely.
So this would be on October 21st that you saw her the next day, is that correct?
Yes.
Now, on the 20th, you made reference to the fact that you also recommended that she try fish oil and things of that nature, natural remedies.
Yes.
Okay. You also wanted to look into what's called Zulresso, Zuliresso.
Yes.
What's Zulresso?
It is a treatment for postpartum depression.
And when you say that you were looking into it, what did you do? Did you find out if it was available and if she could participate in the program?
I did some digging online to see where it is done and how to do it. I hadn't officially recommended it, so I had not started that for her. It's not really an easy medicine that I can just start because
what? I'm sorry.
Sorry, it's not a medication I could start on my own. It is it's infused through an IV in a hospital, so it's a bit difficult to coordinate.
It's a 60-hour infusion, right?
It's a long infusion. That sounds right.
And it's about 2.5 days of infusion, and it has to be under hospital circumstance. And the only hospital around here is in Rhode Island, right?
Yes.
And did you ever recommend that she do that?
It was something to consider. I couldn't make the official recommendation because that's not something I prescribe.
Why?
Because you can't pick that up at the pharmacy.
Well, no, obviously you have to go to a hospital setting and basically have an infusion through your veins for 60 hours or 2.5 days. But why didn't you look into it or recommend that she do that?
Well, I did look into it.
So what happened?
She ended up actually going to a partial hospitalization program at the hospital that does it. I don't believe the program was completed, but she went, and I advised her to discuss it with them because they have access to that medicine. I don't have access to it.
Of course not. Is this Women and Infants Hospital in Rhode Island that you're talking about?
Yes.
So when you looked at the medical records for Women and Infants Hospital, did they make reference to your inquiry for Zulresso?
I never received records from Women and Infants.
Did you ever look at them or even online?
Online?
Yeah, like online, like you do when you talk to patients.
No, I never had access to them.
Why?
It's similar to South Shore. It's a completely separate hospital that I don't have access to. I don't work there.
Well, of course you don't work there, but you're a doctor and you're treating a patient who's got medical records that you could access through a HIPAA release, right?
Yes.
Why didn't you do that?
Well, she didn't ultimately end up having any treatment there, so it didn't seem necessary.
She didn't end up having any treatment there, so it didn't seem necessary. You can't just walk into that place and say, hey, I'd like some Zulresso, can you?
I don't exactly know how it works.
And then again, on that date, which would be October 20, New Jersey looking at the records, you checked off the boxes again on objective findings, mental status exam, appearance, speech, things of that nature, correct?
Yes.
Excuse me for 1 minute, Judge. So when she was telling you on that date that she was in quoting your records, paranoid of getting suicidal thoughts and something bad happening, doesn't want to be alone. What did she mean by that?
Well, those were a lot of her words.
Right. Isn't that a concern? If your patient is telling you she doesn't want to be alone, why didn't she want to be alone?
Because she was very anxious and had the feeling like something bad might happen.
Okay. Did her mother ultimately and dad come to stay with them?
Yes.
How long did they stay with them?
I don't know.
When you talked to the mother and the father, did you say to them, what is she doing? How does she appear? Is she in bed all day? What did they tell you?
They never called my office, so I never spoke with them.
They never called your office?
They never called me or sent a message, so I did not have communication with them.
So that's their fault that they didn't call you, the doctor, right?
Sustain. Next question.
So, do you think maybe it would be reasonable if you're the doctor and you're investigating your patient's symptomology that you might, when you know that the parents are staying with her, that you would make a phone call yourself?
It's not typical when you have an adult who is able to advocate for themselves to speak with their parents.
So while she is telling you about her symptomology and tearfulness and crying and unable to get up and anxiety and the medications and the mental illness that she had, you felt that she could advocate for herself?
Yes.
Okay, on the television, on the computer.
Yes.
The next time you saw her was on October 26th, is that correct? And you can pull up your record.
Yes.
Now, and if you look again at the interval history where you put down what's going on in the patient's life that time, this is when she indicated that she's back to where she felt that she was before Zoloft, which was not great, and that you guys were considering a new medication. Is that right?
Yes.
And then you started her on that again, as we talked about, right?
Yes.
And then you started her on the buspirone, right?
Well, she had already been started on the Ativan, and then we added the buspirone.
So my question was, you started her on buspirone, right?
Yes.
Okay. And also you added hydroxyline as needed, right?
Yes.
And you continued the Ativan, correct?
Yes.
Did you discuss side effects with her at that point?
Yes.
Did you also discuss starting Remeron or pregabalin?
Yes.
What did you tell her about Remeron and pregabalin?
I don't think I went into any detail about those medicines, just that those might be things to consider in the future.
And then you saw her on October 31st, right?
That was her. I think that was just a therapy appointment with a different provider.
Would that be Jennifer McAllister?
Yes.
So it's a different provider in the sense that she works for Astor, right?
Well, yes, it just wasn't myself.
Right. So on October 31st, they did a suicide assessment, or she did, right, McAllister?
I wasn't there.
Well, I know you weren't there, but these are medical records that have been introduced into evidence that the jury's going to have in the jury room.
Objection, is that a question?
No, good. Next question.
McAllister did a suicide assessment, apparently, right?
I'm sure she assessed for suicide.
Look at the record, please.
Mm-hmm. Where do you see it? Sorry.
Where it says suicide assessment. There's only 4 pages for October 31st.
Yeah.
Well, actually, there would be 8 because it's 2 sides.
So that is the assessment that you go through. If somebody reports any thoughts of suicide, then you ask those questions, which go into a lot more detail about them.
So here you have a patient who's already reported to you as a psychiatrist that she's got suicidal ideation, worried about suicide, worried about killing herself days before October 31st, and a suicide assessment was done by McAllister, right?
I wasn't there. You would have to ask her.
Well, maybe I will if she comes in.
Okay.
Why don't you tell me what the record shows? Did they do a suicide assessment? Did she check off the little boxes?
I'm looking for that section. It says that patient denies suicidal or homicidal ideation at this time.
Okay, so again, this is on October 31st, right?
Yes.
The patient, within a period of a couple of days and meetings with you, that McAllister has access to because the records are within your business, right?
It's not my business, but yes.
Has reported suicidal ideation and fear and dwelling about killing herself and afraid of those thoughts, right?
Let's see. I just want to be absolutely clear. So yes, a little while earlier, she had voiced those concerns.
Right. So as a result of voicing those concerns, is it your understanding that McAllister did not do any of the suicide assessment questions because Lindsay reported that she wasn't suicidal?
It appears that she asked about
Right, you
suicidality.
already told us that. I'm asking you about, excuse me.
Hold on. Ask the next question. Go ahead.
Thank you. I'm not asking you, you told us 3 times now that she said she was not suicidal when she spoke to McAllister. I'm asking you about the suicide assessment for the 3rd time. You see it in front of you?
Yes.
Okay. Can you tell me, did Lindsay answer any of the questions that were asked over the 2 pages, possibly 3, of the suicide assessment? Yeah, 3, done by McAllister.
I don't see anything written here.
So was there a suicide assessment?
I don't know because I wasn't there. I don't know what the
And
conversation
you don't know from
was.
looking at the records, right?
From looking at the records, I don't see evidence of additional suicidal questions beyond asking if it was there or not.
So, a suicidal assessment, doctor, is in the medical records. It consumes almost 4 pages, does it not? Yes?
Yes.
Okay. And all of the questions, like asking, have you felt life is not worth living? Is that something you thought about recently? Are you dwelling on that? What leads up to the thoughts? What are the thoughts? All those questions, right? For 4 pages, right?
Yes.
And there is not one notation indicating that that test was ever administered to her on October 31st, correct?
Correct. But it looks like it was asked in other ways.
Okay. November 2nd. Oh, it was asked in other ways? Is that what the little checkbox where it says denied suicidal ideation?
Can I read something that she wrote in the
You have
note?
indicated repeatedly that she denied suicidal ideation, right?
Yes.
Okay. The suicidal assessment was not administered according to the record that's in front of you by McAllister, yes?
The additional suicidal assessment, yes.
November 2nd. By the way, as a psychiatrist, not a psychologist, you have the ability to prescribe medication, obviously, right?
Yes.
And that's what we talked about, the DEA number and all of that, correct, which you had for about a month, other than when you were a resident, right?
Yes.
So you're prescribing these SSRIs and antipsychotics and antitropics or whatever they are. And it's important as to the metabolism of your patient with those drugs, isn't it?
Yes.
Okay, keep your voice up. What does metabolism mean?
The body breaking down the medication.
So how is it that you can determine how the body of your patient is breaking down the medication that is in their brain and they're complaining about all of these symptoms? How, as a doctor, do you determine how the body's breaking it down?
We don't typically have any specific testing that we do to understand that.
How about a blood test?
It's not done for that.
It's not done for that, meaning the blood test is not done to determine the metabolism of your patient, of your medication.
Y'all, I never stop. Never do I stop court TV for anything, but I'm stopping it for this because, oh my God, I've been waiting on this damn question to be asked. What about a damn blood test? Why haven't we done that already? Why hasn't anybody done that before anybody's prescribing pills? Thank you for saying that, and thank you for allowing me to do that. Won't happen again.
Are you referring to genetic testing?
No, I'm asking about the metabolism.
Okay.
I'm not talking about genetics. I'm talking about the metabolism of the SSRIs in her body.
Okay.
You can tell that metabolism rate through blood testing, right?
Not in the way that you're describing.
Okay, what way would it be?
There is genetic testing that can give information about metabolism.
Like what?
It can talk about different enzymes that a person might have to suggest it provides information about the enzymes that a person might have the genes for.
Okay, so it provides the enzymes that a person might have the genes for. Forgive me, I'm having difficulty with that. What does that mean?
It's a little complicated.
Yeah, you don't expect a patient that's going through what she was going through to understand that, would you?
No.
Did you guys do the enzyme test?
They are not typically done.
Why?
Because, again, it's genetics.
Does
and
insurance cover it?
It's just in the middle of answering.
Good. You finish that answer and I'll allow a follow-up. Go ahead, Doc.
So it's not as simple as testing for an enzyme or not. You can test someone's genome, like we have the ability to test the entire human genome now, but which is great, but the clinical use of that is not there yet. So while we can test these things, it does not yield meaningful clinical information. So it is not commonly done.
What is the Cytopro P4-50 system?
That's one of the enzymes that I'm talking about.
So the Cytopro P450 system talks about and tests for the breakdown of psychiatric meds in the blood, right?
It's not in the way that you're describing. It doesn't tell you what medicines to take.
Again, one at a time. Finish the answer and then you can ask follow-up. Go ahead, Doc. Yes, this is a test that is done, but it doesn't tell you what medications a patient will do better on. It's not useful in that way.
So what's it useful for?
I mean, I don't find it terribly useful.
How long has the Cytopro P450 system been in use in your field?
I'm sorry?
How long has the Cytopro P450 system been in use in your field, psychiatry?
Well, it's an enzyme in the body.
Well, I know what it is. I'm asking you about the system, the testing. How long have they been using that?
The genetic testing, maybe a few years. It's very new.
Very new. Does insurance cover it?
Sometimes.
Sometimes. So it is nevertheless a legitimate test to determine the breakdown of psychiatric meds in a patient's blood, correct?
It exists, yes.
It exists. Well, it exists, but you didn't use it, right?
It would not have made a difference.
In what? In your opinion?
In her treatment.
Because you go by the checks in the checkbox and what she self-reports, right?
No, not just the checks in the checkbox.
Well, in any event, tell me about the thyroid.
The thyroid?
The thyroid.
It's an organ in the human body that regulates hormones.
And what, if any, import and impact do thyroid levels have on your evaluation of a woman who is in the throes of postpartum depression?
They don't.
What is the purpose of a test to determine the thyroid levels?
Well, you can test something like the TSH.
Well, I don't know what a TSH is. I'm sorry. What is a TSH?
Thyroid stimulating hormone.
Okay, thank you.
That's something that can be tested typically by maybe a PCP, primary care, or endocrinologist if they have concerns about someone's thyroid function.
Were you aware of a study that was a major study that was peer-reviewed? What does peer-reviewed mean in your business?
That it was reviewed by other researchers in a similar field.
And the report or the article or whatever it may be has to be approved by the peers that are reviewing it before it can be published, right?
Yes. Yes.
And you'd agree with me that in the medical field, it's a big deal to have publishing articles on your resume, right?
Yes.
And how many articles have you published about postpartum depression, postpartum psychosis, anything?
I have published something, but it's not a full article. It's just a small thing.
Okay. Are you aware of the psychiatry magazine article dealing with, in 2021, thyroid function in postpartum psychosis, an exploratory study? Have you ever heard of anything about that, let alone read an article about it?
No.
Are you aware that there are studies that have compared thyroid function between psychosis with postpartum onset, PPO, psychosis without postpartum onset, PWPO, and normal postpartum? You aware of that?
No.
Well, you're supposed to be an expert, or you specialize, or you have an interest in treating women that have suffered from postpartum, correct?
Yes.
Have you written any articles at all about postpartum depression, anxiety, psychosis?
No, I'm not a researcher. I'm a clinician.
Have you read any of the articles, such as thyroid function in postpartum psychosis?
I've read many articles. There are thousands. I have not read that specific article.
Thousands? Thousands of articles on postpartum psychosis and the thyroid?
No, not on that specific topic.
So, when the Astor doctors are treating a person like Lindsay, it's your testimony to this jury that testing, whether it's blood testing or whether it's the Cytopro P4 testing, is not necessary because Jennifer Tufts doesn't think it's necessary, right?
It does not yield information that would influence treatment.
Really? So if there was elevation in the thyroid, that wouldn't impact on your treatment at all, your evaluation, your investigation?
Sorry, I thought you had mentioned the cytochrome issue. Are we talking about that one, or are we talking about the thyroid?
Talking about the thyroid.
Okay.
Yeah. So
Can
there
you
were
repeat?
tests that revealed elevation in the thyroid level. Is it your testimony that you wouldn't care?
If I somehow found out that a patient had elevated thyroid levels, I would advise them to talk to their primary care or maybe get an endocrinologist to discuss it.
Did you ever recommend that Lindsay get an endocrinologist?
No, she did not.
The answer is no. And you basically did not have any information that you could use to even realize that there might have been a thyroid issue with this woman that was postpartum, right? Because you didn't do any blood tests.
There was no clinical reason to obtain a blood test.
All right. So you continue on with your meetings by the computer, correct?
Yes.
November 2nd. You can get November 2nd though. You got it?
November 22nd?
No, it looks like November 2nd. I apologize. That's what I'm looking at. Tufts, Jennifer, MD, Clancy, Lindsay. Follow-up note, November 2nd.
Yes.
And you're still diagnosing her with generalized anxiety disorder, GAD, right?
Yes.
You add in there an adjustment disorder with depressed mood, I guess, because of what she had been telling you, right?
Yes.
Okay. Looking at the psychiatric condition, you note that it's improving. Right?
Yes.
And then you determined that you will decrease the Ativan to 0.75 milligrams for 2 weeks, and then decrease it to 0.5 milligrams for 2 weeks, and consider alternatives for sleep anxiety. Is that correct?
Yes.
And then you note if she's having urges to harm herself or others, to go to the nearest emergency room and call 911 and things of that nature, correct?
Yes.
So is that a form that you basically press a button, because it seems to be kind of like a generic advice, call 911 if you're feeling suicidal and things of that nature?
Well, that's advice that we provide for every single patient.
Okay. And then you note that half the encounter was on counseling or coordination of care on November 2nd, right?
Yes, that's a typical statement. It's just a part of documentation that doctors use.
All right. Now, on November 2nd, you were suggesting the 4 drugs that she would start would be Remeron, Trazodone, Pregabalin, and hydroxyzine, right?
Those are just things we were considering.
Oh.
I wasn't starting all of those medicines.
I see. On November 22nd, now that would be almost 3 weeks later, right? You saw her, right? And did you ask her about whether or not she was still having suicidal thoughts or worrying about suicidal thoughts, for example? Did you ask her that?
Yes.
And how do you know that? Because the box is checked?
It's written in my note.
What does it say?
Patient denies SI.
Okay. What did you ask her about that?
I don't remember the exact words, but I know that I asked about that.
Did you ask her about how things were going at home with the mother and father staying there?
That I don't remember. I didn't document how her parents were doing.
Okay. Well, I don't really care about how her parents were doing. I'm asking about whether or not you asked her how it was working out while the parents were there helping out. If you did, fine. If you didn't, that's fine too.
I don't think that I did. In this appointment,
Okay. That's all. That's fine. December 1st was the next appointment, correct? And you can look at the interval history.
Yes.
Now, on that December 1st appointment, this is after she had transferred to South Shore?
Yes.
She disclosed to you that she had been seeing South Shore, right?
Yes.
We already talked about the fact that you never got the records from South Shore, so you don't know, other than what Lindsay reported to you, what medications she was on, right?
Right. I knew what she was telling me.
Right, and she told you that she was doing the Ativan taper, right?
Well, she said she had tried doing that, but that then she was having worse sleep.
Having difficulty sleeping is what she indicated to you, right?
Yes.
And she tried other meds that you had suggested, but stated that she was having difficulty with those meds, including trazodone, right?
Well, the trazodone she didn't have a problem with. It just didn't seem like it was particularly helpful.
Okay. Did you prescribe the trazodone or somebody else?
This was somebody else.
So, do you know what the milligrams were that she was on?
It says she tried between 50 and 150 milligrams.
All right. Now, did she at some point try Remeron?
She said that she did.
Did you suggest in your discussions that she tried Remeron?
No, I did not.
Did she indicate to you that she had rebound anxiety and intrusive thoughts, that she was going to die? Do you recall that?
Well, she said worse depression and intrusive thoughts.
Okay. Did she tell you what the intrusive thoughts were?
It was the feeling like I'm going to die.
Did she then have a script for Prozac, 10 milligrams?
That's what she said.
And she said that she couldn't sleep and had worse sleep, so that had to be stopped, right?
Yes.
Then she was on Klonopin, right?
Yes.
And what is Klonopin?
It's a benzodiazepine.
And on December 1st is when she told you, again, that she was close to having suicidal ideation, feeling hopeless. Do you recall that?
Yes.
Now, on the interval history, on that date, you indicated that she can't sleep, She's panicking. She had worse depression, intrusive thoughts. She was numb. Nothing mattered. I feel like I'm going to die. Denies suicidal ideation, but, quote, yesterday, close to it. Feeling hopeless. Did you give her therapy and validations after she told you that?
I believe that I did.
What did you do? You got a woman that's telling you that she's hopeless. She doesn't care if she dies. Can't sleep. What did you do to validate on your therapy?
Well, I told her that this was something that we could address, that there was hope, that there were treatments, and there are different types of treatment programs that are more supportive, like partial hospitalization programs. So she knew that she still had options and a reason to hope.
Did you ever suggest to her that maybe you ought to come in and see me rather than talk on the computer?
Talking with her over the video did not seem like an issue. It didn't seem like there was anything that I was missing or that there was any need to see her in person.
Now, you'd agree with me that in December of 2022, COVID was all done, right?
It wasn't completely all done.
Were you still nervous about dealing with people and wearing masks and stuff, or were you able to sit down and talk to somebody face to face?
We were definitely feeling more comfortable about being face to face with people, but I think, it was still something that we thought about.
You discussed trying Seroquel with her at that point, right?
I didn't really discuss it. She had told me that was something that she had discussed with her other provider.
So, looking at your notes, does it say also discussed trying Seroquel alone tonight? Did your notes say that?
It says yes, but I wasn't making a recommendation about the Seroquel. It was just a medicine I was providing her more information on.
So you were telling her about the Seroquel? You're providing information?
Yes, we were talking about the Seroquel.
Right. Why?
Because her other provider had recommended that she started it.
What is Seroquel?
It's an antipsychotic.
You also discussed with her the possibility of undiagnosed bipolar disorder, did you not?
It was discussed.
And undiagnosed bipolar disorder was, in your opinion, as a result of not a reaction, but extreme reaction to the SSRIs, right?
Not as a result of the SSRIs, but that
Does your note say, and I quote, also discussed possibility of undiagnosed bipolar disorder given extreme reaction to SSRIs and insomnia, period. Does it say that?
Yes.
Those are your notes, right?
Yes, the way you were saying it made it sound a little bit different before, but that's exactly what I wrote.
I read it directly from your note, right? How did I make it sound different?
I don't know. It sounded different the first time you said it than the second.
So did she have bipolar?
No.
Did you make that decision that night? That day?
I assessed that with her pretty much every time that I saw her, and she never had mania.
What about mood stabilizer like Lamictal? Did you discuss that with her?
Yes.
What is Lamictal?
It's an anticonvulsant, but it's used in treating mood disorders.
So what was the end result of your meeting with her on December 1st? What did you guys do? Did you give any recommendations, advice, anything?
Yeah, well, so at this time, I was not prescribing her medications, but I was still concerned, not concerned enough that she was at imminent risk of hurting herself or anybody else, given what she said. But we had a plan for her to pursue a partial hospitalization program.
Where was that?
Well, the one that I had recommended was HRI.
What is that, HRI?
It's a hospital in Brookline.
And did she ultimately go to another hospital?
She ultimately went to the Women and Infants Hospital for one day.
And those are the records that you didn't get, right?
Correct.
Okay. And you decided that she did not have bipolar disorder because, in your opinion, she did not meet, and I quote, the criteria, right? That would be the criteria in the DSM, right?
Yes.
And the DSM, of course, is the Diagnostic Statistical Manual, Roman numeral 5R, meaning text revision, right?
Yes.
Is that what you were using back then? Would be this thing here, DSM-5, TR. This is the DSM, right? It's like a cookbook, right?
It's more of a guideline that we use to to help us in our treatment, but it's not the psychiatry Bible that people sometimes think that it is.
Right. Hypomanic bipolar disorder. How many days does that require under the DSM?
A hypomanic episode lasts for at least 4 days.
And is that per the DSM?
Yes.
Remember on Friday you said that the most important criteria is 7 days with continued high energy levels?
Yes.
So is it 7 days or is it 4 days? And who says?
Well, mania is 7 days. Hypomania is 4.
Discussed again, Monday does occur on December 1st, and that would be the Lamont sheet, right?
Yes.
And do you know in your records that she indicated that she was really struggling? And it was as a result of that you recommended that hospital program, correct?
Yes.
You agree that she had, in your opinion, a severe mental disturbance at that point that was manifesting itself?
She had a maybe moderate heading towards severe.
Moderate heading towards severe mental issue. Okay. You agree with me that she had increased anxiety, right?
Yes.
She had very, very increased depression, right?
Well, she did. She said
Okay, so
since the Ramadan.
Just answer yes or no.
I'm sorry, I was just trying to check the record.
Okay, you can check the record all you want, but if I ask you a question, respectfully, can you just not go on and ramble? Answer yes or no, that's all.
It's sometimes impossible to do that.
Here, if you can't answer yes or no, just say you can't answer yes or no. If you can answer yes or no, answer yes or no. That's how we do it, all right?
Okay.
Thank you. Now, mental issues like anxiety that was diagnosed, the depression that was diagnosed, and the fact that she indicated yet again that she was close to suicidal ideation, quote, worried about suicidal thoughts, but you indicated that she wasn't suffering from suicidal ideation on that day. Is that fair?
She denied it.
But she told you that she was worried about suicidal ideation and having suicidal thoughts, right?
Well, this was the time she said she was worried that she was close to having suicidal thoughts.
So did you ask her, what does that mean? Does that mean she's standing at the edge of the stairs and she's thinking about falling down the stairs, or what? What does that mean, close to suicidal ideation?
So I asked about that, and that's when she said she described it further as using the word hopeless.
So did you prescribe the lamotrigine on that occasion or no?
No.
On December 16th, that's the next appointment she had, right?
Yes.
That's 2 weeks later, right?
Yes.
She was still not well, correct? She told you she was having a really rough time.
She was sleeping, but she was still feeling very poorly.
In your notes, does it say that she was having a really rough time?
Yes.
So when I asked you, if your notes reflected that she said she was having a really rough time, why do you feel compelled to say she was sleeping?
Objection.
No,
It's an important detail.
Yeah, I guess. How about the rough time? What did that mean? What were the symptoms of having a really rough time for this kid?
Do you want me to?
Yeah, I'd like you to answer that.
So finally works, referring to the Valium, but very depressed during the day. No motivation, some SI. Do you want me to continue?
Sure.
Went to MGH emergency room for SI, declined inpatient, feeling hopeless, no intent or plan, and feels like depression related to Seroquel.
Okay. Now that's the question on Friday that, well, strike that. So what was the SI, suicidal ideation?
Yes.
And can you read that back to me again? What did she say about SI?
So that when she went to the hospital, she went because she had no motivation, some SI.
Some SI meaning that she had some suicidal ideation, right?
Yes, in her words, yes.
Yeah, in her words. As opposed to thinking about having suicidal ideation or worrying about suicidal ideation. She actually indicated that she had suicidal ideation, right?
I can't answer that as a yes or no.
Well, it's in your notes that she said that, right? Yes?
What is in my note?
Do you understand my question?
I'm a little bit confused right now. Can you repeat what your question is?
Sure, of course. We'll spend some time talking about thinking about suicidal ideation, worrying about suicidal ideation. Now, saying she had suicidal ideation, right?
She said it, yes.
Yeah. Well, this is the only source of information that you're getting, apparently, is what she's telling you, right?
Yes.
So what suicidal ideation did she have? Was she thinking of cutting her throat? Was she thinking of throwing herself off a building, running up in front of the car? What?
No.
What was she thinking of?
So I asked her those important follow-up questions, and
Like
that's so what do you mean when you say I'm feeling suicidal?
Okay.
And that's when she said it means I'm feeling hopeless. And then I asked you, do you have intention of hurting yourself? Do you have a plan for hurting yourself? And she denied those.
And that's where you left it?
I'm sure more was said, but that's the most important part of that clinical encounter.
And did you give a therapy by the computer on that date too?
Yes.
What did you do for therapy about her suicidal ideation and saying she wanted to kill herself?
Well, we explored what that meant, and what to do if you're feeling that way.
To do what? Call 911?
To go to the emergency room.
Did you discuss prescribing Seroquel to her, or was she getting Seroquel? Did Seroquel enter into your discussion at all?
We talked about it. I was not prescribing it for her.
What is Seroquel?
That's an antipsychotic.
So, at the conclusion of your meeting on December 16th, basically what you took away is that she had now increased the suicidal ideation, was feeling hopeless, all the rest of the things that we've talked about, and then she just moved on, went home?
Well, she was assessed in the emergency room and was not admitted. And I assessed her on that day again, and while she was certainly struggling, she did not require hospitalization at that moment. So she was planning on going to the Women and Infants program, and I supported that.
Did you know that around that time, she confessed to her husband that she was having now thoughts of harming children?
No.
Would that have been something you were concerned about?
If I heard that, I would have been very concerned.
You would have called DCF, right?
I might have.
And when you spoke to Pat, did you ever ask him what his observations were of her spiraling into November and December? Not that one time that he stuck his face on the computer and talked to you. Did you ever talk to him?
He never called me again. Or he never called at all. I never spoke with him again.
So he is a husband of a woman, just had a baby. He's postpartum with all of these symptoms that we talked about, all of the drugs that you were prescribing to that. She was dealing with trying to get help. You never talked to her husband about what he observed? Because he didn't call him?
Well, we did speak on that visit.
Which visit?
The 16th. Or I think that that's the one that he was at.
You think it was? It's not noted in your record?
It's not noted, but I remember some of what we talked about. And so in reading that record, it seems like that's the likely one that he was at.
December 16th, on your objective findings, you note that her mood was depressed, right?
Yes.
And what does that mean? Did she just say, I'm depressed, or did she give you symptoms? I mean, you check the little box.
Yeah. Yeah, it means she's saying that she's depressed.
Okay, so you're the doctor. You check the little box. What did your patient tell you about her symptoms that she was depressed on that date? Was she crying? Was she able to get out of bed? Was she worshiping at the porcelain god? What was going on in her life?
She said she was having a really tough time.
Her affect was flat, right?
Yes.
And again, depressed, you check it off twice. One under mood and one under affect, right?
Yes.
And then the next page it says recent lab work. That wouldn't be blood testing, would it? Does Asta do blood testing?
We don't have a phlebotomist or a lab, no.
Well, why does it say recent lab work typed into your form when you check off the little boxes?
And that's something that auto-populates. It's a template that, many different, it's a template. The whole node is something that psychiatrists or probably all across the country use.
Probably. You can't diagnose someone's illness by a template, can you?
No.
You filled in, no lab results were found, right?
There were none in the computer. Yes, I didn't type that in though. It auto-populated. It was auto-populated.
So on the next page where it talks about symptom goals, treatment goals, I'm sorry, symptom reduction and improved functioning. What does that mean?
Symptom reduction is to have fewer mental health symptoms, and improved functioning means improved day-to-day life functioning, things that she's doing in her daily life.
Really? Did you tell her all that? You get a young woman that's obviously mentally ill, very sick. She's deteriorated, whether you like that word or it's automatically imported. What, on that date, did you do? Never mind all those words you just said. What did you tell her on the television or the computer?
I told her to go to the partial hospitalization program, and if she was having more suicidal thoughts again, or felt like she was at risk of hurting herself or anybody else, that she should go immediately to the emergency room.
How long did that meeting take?
Probably about 30 minutes.
And was that the therapy that you provided, telling her to go to the emergency room?
That was probably a component.
So the plan excuse me, on December 16th was to follow up with women and infants, right?
Yes.
Did she?
Yes.
Do you know when?
I don't know exactly the day. Shortly after.
Then you were considering a brexanolone infusion, right?
That's the Zulresso.
That's the same thing in Rhode Island.
Yeah.
Okay. And that didn't go anywhere, right? That's
No.
It says start Lamictal, 25 milligrams daily, right?
Yes.
Continue Seroquel, right? What was the milligram for the Seroquel up to at this point?
Well, she had told me it was 200.
Well,
That was that. I did not write that prescription, so that's what her provider had prescribed her.
Okay, so you can ask somebody to show me the pill bottle. You can ask somebody to show me the CVS receipt. You can ask somebody who you can call to verify, right?
I could.
Yeah. But anyway, she said that she was on Seroquel 200 milligrams, right, and had stopped with the Valium, right?
Yes.
And then you go on with that form thing saying if you have urges to harm yourself or others, you got to call 911, crisis hotlines, and everything else, right? That's the next two paragraphs that are in that report, right?
Yes.
Was her mother and father still staying with her on December 16th, if you know, with Pat and the kids?
I'm not sure.
Did you ever ask anybody other than her how she was doing?
I asked her husband when he was at the appointment.
Yeah, that's the other appointment. How about now, talking December 16th into the month of December? Did you ever ask anyone how she was doing?
Well, I think he was at that visit.
You think he was at the visit? How did he tell? What did he say to you about how she was doing?
He said she wasn't doing well.
She's got an objection, Judge.
Right.
Objection.
Overruled.
Go ahead.
He said she wasn't doing well.
Anything else?
Yeah. He felt that what might have been, his opinion was that it was related to when she started the Seroquel.
He basically said you guys are turning her into a zombie.
Objection.
Those are words?
Overruled.
I don't have that written. He may have said that.
Does that kind of hit you, though? You might remember that. You might have been, as some people worry about suicide, you might be thinking in your brain that he did say, you're turning her into a zombie. Possible?
It's very possible.
Okay. Next meeting, after the December 16th, was it? Is it
Yes.
December 16th? Is that what we just done?
Yes.
Okay. The next meeting was January 6th.
Yes.
Okay. And how does this happen? Does the patient call? I know you don't set up these appointments. Somebody has to deal with somebody in administration or whatever. But do you, like on December 16th, say to Lindsay, call me or set up an appointment for January 6th, or do they have to do it themselves?
So at the end of an appointment, I typically will schedule their next appointment.
So did you schedule January 6th?
I think that one she scheduled herself.
Yeah, that was the day after she got out of McLean, right?
Yeah, usually the hospital coordinates the discharge appointment.
Well, if I tell you that, in fact, the hospital told her to set up the appointment, and that within an hour, she set up the appointment. Is that in your notes?
It's not in my notes, no.
Do you remember that? That was a pretty big deal that she was in McLean, locked wards for 4.5 days, right?
Yes.
And she's your patient, and she's really gone downhill bad, right?
No, she wasn't doing well.
And she admitted herself to the locked wards at McLean, right?
Yes.
And what was the diagnosis at McLean?
I believe they diagnosed her with major depression.
Did they recommend any medication?
They took her off of the Seroquel.
They took her
Off of it.
off. Okay. So did you look at the McLean records?
Yes, definitely.
And those were imported easily because you're part of the same structure or whatever?
No, but after someone is hospitalized, the hospital usually faxes it to their doctor.
All right, so if I tell you that the McLean records are really pretty voluminous, that's not what they fax. They fax you like a 2-page discharge summary, right?
Yes.
You didn't get that by fax, right?
No.
So what did McLean tell you? Look at the notes.
Which part do you want me to read?
Did you ever have her sign a release from McLean? Did you ever get access to the McLean records?
I had access to the discharge summary.
Okay, so put the discharge summary aside because that's what they faxed in a couple of pages. What about the records?
No, but that's typically not
No,
done.
never mind typically. The answer is no. You never got the records, right?
A discharge summary is a record.
Did you talk to the doctor that discharged her?
No, no one called me.
No what?
No one called me. I wasn't notified about the hospitalization until she was discharged.
So you just sit there behind your computer and wait for people, Patrick, wait for the doctor from McLean, wait for the sick person who's the patient to call you? And if these people don't call you, it doesn't exist apparently, right?
No, not exactly. I had no way of knowing she was even at McLean.
Well, you did once she got discharged, right?
Yeah, but that was after the fact.
Right. So did you care why she was in McLean?
Of course.
And why was she in McLean?
Because she was depressed.
And what was the, does your record indicate that she was discharged yesterday? Under interval history?
Yes.
And discharged from where?
Well, I said MGH.
Is that Mass General Hospital?
Yes.
And she was currently on trazodone?
Yes.
And she indicated that the goal was to come off Seroquel?
Yes.
And she described herself as still being very numb?
Yes.
She couldn't sleep, right?
That's not entirely true.
Am I lying? I'm reading the medical records here. Sleep, taking Ativan and trazodone, slept 5 hours broken, wondering about increasing trazodone and switching to Valium. What does that mean?
Well, it means she was having trouble sleeping. It wasn't that she wasn't sleeping at all.
I see. Okay. So was the trazodone increased at that point?
Yes. Yes.
How about on January 9th? Did you see her through the computer or whatever then?
Yes.
And did you prescribe medication to her on that date?
Yes.
And was that diazepam?
Yes.
14 count, 1 milligram? No, I'm sorry. 14 count, 5 milligrams.
That sounds right.
Okay. Did you also, on January 12th, 3 days after January 9th meeting, prescribe additional medication to her?
I'm not sure. I don't have a record from January 12th.
Do you recall on January 12th that in fact you prescribed trazodone 150 milligrams, 30 count.
Yes.
3 days later, or a couple of days later, January 16th, you recall prescribing amitriptyline.
Yes.
What is amitriptyline?
It's a tricyclic antidepressant.
What does a tricyclic antidepressant mean?
Well, it's an older antidepressant. It's called a tricyclic because it has 3 rings. If you look at the chemical itself, like a tricycle, but it's an older but efficacious medicine for depression and anxiety as well as insomnia.
On January 16th, look at your interval history. She indicated to you that her mood was very low, no motivation,
Yes.
numb,
Yes.
able to force herself out of bed, taking care of basics, eating, concentration, fine, caring for baby, bonding feels forced. Is that what she told you?
Yes.
Through the computer, right?
Yes.
What did that tell you? Were you concerned about this woman postpartum well within a year from the CDC at that point with these symptoms that she's telling you about?
I was concerned that she was depressed.
And in all of the times that you spoke to her, you'd agree with me that she appeared to be honest and forthright, telling you what she felt, right?
That's what I thought she was, yes.
Do you have any reason to think that she was lying to you?
No.
Diazepam taper on January 16th, 5 milligrams last 2 nights, slept for 4 hours, and then a light sleep, maybe 2 hours, stretches. Did she express that she was still having concerns about side effects from medications?
Not at that point.
So what does ROS mean under interval history that we're looking at?
Review of symptoms.
Okay. And then it says patient denies SIHI, that'd be suicidal ideation, homicidal ideation, correct?
Yes.
Denies other questions or concerns, and you recommend a low dose of amitriptyline for depression, correct?
Yes.
Patient agrees with the treatment, and you guys were also going to explore ketamine treatment. Is that right? Esketamine.
Yes.
Now, did you know that she was on her computer looking up medication after medication after medication after medication, treatments, ketamine treatments, and all that? Did you know that?
No.
Did you ever ask her whether or not she was looking up the symptomology of pharmacology and having interactions between drugs?
No.
January 23rd, you had that meeting, correct, with her?
Yes.
And this is after, obviously, excuse me, the January 16th appointment. And in the January 16th appointment, she told you that her mood was very low, and that's the worst that she ever reported her mood to you. Isn't that right?
On the 16th?
Yeah.
I don't know if that was the worst it was ever reported, but it was certainly bad.
And you didn't recommend that she have a hospital evaluation, did you? This is the day before she killed the kids, right?
The 23rd?
Yeah.
It was the day before.
You didn't recommend a hospital evaluation, did you?
No, there were no.
The answer is no?
No.
Don't ask you all the questions there.
Okay.
The answer is no. January 23rd, Friday, you testified that she said her mood was depressed, and you noted that her affect was depressed and flat, right?
Yes.
She also reported that her back was very She had no motivation, is what she told you, right?
Yes.
She told you that she had been feeling numb and no emotion for 17 days straight, is what she told you, right?
I'm not sure about 17 days straight, but that's how she was feeling.
You didn't reach out to her mother and father at that point? They didn't call you, I guess, right?
No.
And Patrick didn't call you at that point, right?
No.
So she's sitting in front of her computer getting help from her doctor on January 23rd. And what did you do?
Well, I thought about how I could best help her, the medicines that she'd tried and what her current symptoms were. And it made sense to slowly titrate the amitriptyline so that we could get her to a dose that reduced her depression so that she would feel better.
But you increased the amitriptyline.
Yes.
That pushed her over the edge, didn't it?
I don't think so.
All right. That's the truth. We're going to take the afternoon recess at this time. All right?
Court, all right. Jurors, please kindly close the notebook. This way.
The court is closed in session.
Doc, you may take off from the stand. Counsel, anything we need to discuss before the break?
No, Your Honor, thank you.
All right, so we'll be recessed on this matter.
Holy cow, you guys, that was the perfect way to end.
Lee, how long's the
Yes,
break?
for
How
an
long's
hour.
the break?
For an hour. This is gonna be their lunch break. So they'll
Oh,
resume, I
okay.
think, at 2. But he did say in the beginning that this may be an early day. Something else is going on behind the scenes. So it wouldn't surprise me if they came back and if the prosecution doesn't have a rebuttal or whatever they call it, a redirect, then I don't know. Then it could be the end of the day. We don't know. A good night. See you
Good
later.
night,
Thank you for
Mel.
coming in.
We
Mel,
love
love
you.
you so much. Thank you for being.
Good
Honey,
night,
thank you
girl.
so much. Why is she in a wheelchair? Denise wants to know. She's a
paralyzed.
paraplegic. She's a paraplegic from the waist down from jumping out the window. But wasn't that so good, you guys? The way he just ended that he asked her about that medication. Oh, he asked her about
Can
the
you tell me I'm up to my eyes in wool? I've had to drag the blanket out. It's all over my head and everywhere, Leeds. Can you tell me?
Hold on just a second. Hold on. I'll just rewind it to that part and then I'll stop it.
Thank you.
It was a perfect way to end it. Perfect way.
Sorry, guys. I missed this. And I'm weighing myself too.
Can you guys hear it?
No sounds.
It was the day before.
Yeah.
You didn't recommend the hospital evaluation, did you?
No, there were no.
The answer is no?
No.
Don't ask me all the questions there.
Okay.
The answer is no. January 23rd, Friday, you testified and she said her mood was depressed. And you noted that her affect was depressed and flat, right?
Oh, this is too far back. Hold on.
I can't understand them.
She also reported that her heart was racing, right?
Her hat was
Yes.
racing.
She had no motivation.
Hold
so
on
she
just a minute. Let me get it a little bit forward there because I just want to play the ending to what he says.
Well, I
Gonna get sacked.
thought about how I could best help her, the medicines that she'd tried, and what her current symptoms were. And it made sense to slowly titrate the amitriptyline so that we could get her to a dose that reduced her depression so that she would feel better.
But you increased the amitriptyline.
Yes.
That pushed her over the edge, didn't it?
I don't think so.
I think that says it all right there, you guys. And that's where they ended it. That's where he says.
What did he say?
So, he just
Sorry,
roasted
Lee.
her there.
I just
It's
couldn't
okay.
make it out.
Can you guys hear this anymore? I think let me, hold on. Let me get this all the way to where it needs to go. Get back to there. Okay. All right. Let me just put this in back chat. We'll watch it from back chat real quick. Put some media up here. And then we'll talk about it. She talked about decreasing the amitriptyline so they could get her on a therapeutic dose. Basically, I'm using my own words. And they said, but can you guys hear me or can you still hear the courtroom?
No, we can hear you.
Okay. And then he said, but you up the that word's really hard for me to say, but I'm going to try to say it right. Thank you. He said, but didn't you up that? And she just looked at him and said, yeah. Or she looked at her notes and realized that, yes, at that point they did raise it up instead of dropping it down. And then he said, and it pushed her over the edge, didn't it? And she just stared at him for a minute and she said, I don't think so. That was a perfect way to end that. If you ask me, I mean, what's there left to say, right? What is there left to say? After you say clearly that you're going to try to lower the dose to find a dose that would be therapeutic. And then he said, but you raised the dose. And then she looks at her notes and she said, yes. And then he said, and it pushed her over the edge, didn't it? Y'all, that's some good defense right there.
I'm going to ask you right at this point. You know what I'm going to ask you? Where are you? Where are you guys in chat? Where are you? What are you thinking? We're at this point in time. What are you thinking? Now, we've been here right through this trial. We've all changed our minds. Some have stayed the same. I've changed my mind again. And now I'm asking Leanie where she is.
Why don't we hold our thoughts, Maggie, and let's just read chat and see what they have to say, because that way people don't feel like they have to agree with us. You know what I mean?
Oh God, no one has to agree.
No,
please,
not at all.
Anyone in chat, you have your own opinions. You'll never be bashed for it.
No,
we're just asking as a talking point. That's all it is. Just honestly give your opinion if you want to. If you don't want to, you don't have to say.
We lost you, love bug.
Am I back?
Yeah, you're back.
Yeah, you don't even have to say. Just don't answer me. But honestly, feel comfortable here because you're not going to get bashed at all.
No,
and while I'm talking, please hit the like. And if you would subscribe to our little channel, we'll be made up. Thank you.
Thank you so much. Yeah, I want to hold mine because Maggie and I have been pretty vocal. Now, you guys know, especially me, Maggie's doing better this time and not bouncing around as much. I am just all over the place, but I don't want to say where I am right now at this moment, because y'all don't have to agree with us at all. Listen, I love a good debate, but I'm not going to, if we're not getting anywhere, trying to discuss our differences, then we're just going to move on. We're not going to argue about it. And I'm definitely
No.
not going to let anybody attack anybody for the way that they think. So we want to hear from you guys. So let's see. Maggie is having her dinner. She is 5 hours ahead of
How
us,
do you know?
ahead of me. I could hear you eating, girlfriend. Go ahead, slam that
No,
food.
I'm not eating. It's just being put down to me. I swear on my life on a
Oh,
plane. I'm
okay.
sorting this wall. I can't move. Go on, carry on.
All right. Well, let me read in chat really quick for those that don't mind sharing with us. All right, mic drop. Yeah, you guys got that too. Okay, Stephanie says she's screwed as a clinician. So quite a few of them I've noticed, Maggie, in chat have said she should lose her license after this, or she just will lose her license after this.
I think she
Lisa
will.
says, then her body language at the time, she glanced down, she knew. Jillian says, I'm still hooked on the Chris Watts theory, which is that that's what started going around a lot this weekend, which is that the husband, Chris Watts, blamed his wife, and come to find out he's the one that did it. I think if you go back, I'm not going to redo it because I sound like a broken record, but I think I have proved the point that there was no way he could have been the one to do this. So if you want to rewind an hour back to when they had their break an hour ago, I explained all of that, and then do your own research on what I explained. But I think I've proved that this is not a Chris Watts situation. Wonder if she's even paid off her student loans. Good question. Misty said, I'm still at the same point because she was drugged. It made her psychotic. Wild Angel, good to see you. Maybe her husband had a lot more to do with them than what you think. If you go through the timeline, it's just too convenient how it all went down. Dolores says, I'm the same here. Doctors screwed her up. Stephanie says, probably not at Lisa. Meaning she doesn't think that she's paid off her student loans yet. Wild Angel says 2 weeks before the murders, he was in New York and she was telling him during that weekend that she was feeling suicidal to hurt the kids, and he just leaves her alone. Listen, he's not getting husband or father of the year or father of the month or father of the day for me at all. Misty Blue says, unless I see some other evidence that hubby did it. Okay. Lisa says, you all are so sweet. You're sweet, Lisa. You're the one who's sweet. Jillian says, I think he was hoping she would do it, and then he'd be financially free to remarry. Sar, her screen name is From Survive to Thrive, and her name is Sar. She is from the UK as well. She says, I don't think she did it in her right mind with malicious intent. Jillian says, but I think she didn't and he did. Okay. Wild Angel says, why else would she be jumping out a window? Maybe she was running for her life because she was being attacked. Well, I think tomorrow, when we go into our lunch break, you guys, a little bit more of that will all make sense to you.
But wouldn't she have said that he was after her? She's admitted she killed them, and wouldn't she have said it was him?
Well, yeah. Not only that, like I said, we do have quite a few of the crime scene photos. We will be showing them during our lunch
Oh,
break
yeah.
tomorrow. And when you realize how big the weapon was that she used to cut herself,
Yeah.
I do believe she was just trying to do it as quickly as she could to kill herself. That's what I believe right now. That's where I'm sitting right now. And if he was the one had did it, then I don't know. I did see some things online this weekend that said, look at the way the knife is sitting. It looks like a left-handed person put it down. I was like, come on, you guys. That kind of made me laugh. And to think the husband was more complicit than we think. My name Blair says, I cannot express enough Doctors get into a comfort zone of ignorance, especially in psychology treatment. I experienced it and I was hopeless until I found a good psych. I'm so glad you're better, honey. I'm right there with you. Right there with you. Lisa says, husband had no clue. My name is Blair says, that took several tries. Blair says, and I thought I was running out of time to get better. Me too. I'm right there with you. Charlotte, hello, says, I want the husband to answer in more detail. Hold on. That deserves a round of applause because I'm telling you what, Maggie, I think every one of us want that.
Yeah.
Every one of us want that. We want the husband to answer more
It's
in
not going to
detail.
happen, is it, Lee? It won't
No,
happen. Because
no,
that's it now.
no. Lisa says his heart was broken. Stephanie says, I find that Dr. Tufts did in fact harm her client, and by law, we have to preamble of do no harm. Boy, could I talk to you all about that one right there. Denise Harris, hello, says, I still don't have enough info to judge one way or the other, but it does sound like the doctor overprescribed meds. Thank you for that. Listen, I appreciate you guys sharing with us. I really do. Del Ray, darling, says, the system failed her. She was told, she was told if she was suicidal to go to the ER. She did several times. See, I could hear how Del Ray's talking about it. She's like, the system failed her, y'all. She was told if she was suicidal to go to the ER, but she did several times and they did nothing. Absolutely nothing. I felt hopeless just hearing about her struggles. I'm right there with you, Del Rey. That's exactly how I would have said it too. Blair says, Steph agreed. Grammy Way is here and says, then why did he move on so quickly? I don't think it was a quick thing at all. I think he was having an affair the whole time. So this is big going on. But yeah, he moved out of there rather quickly, didn't he? Dolores says yes, but how many others has she done this to? Oh, that's scary. That's scary to think about right there. Lisa Nagel says the poor husband is brokenhearted. Yeah, he really acts like it. I said that facetiously because I don't think he's broken. Listen, I don't know if he's brokenhearted over his children or his divorce or whatever that is or whatever, or if it's actually guilt that we're seeing in his eyes. I don't think that either. Um, I everything that we know about the timeline, everything that we know about what all went up leading to this, everything that we know after what happened leading to this in the husband's life alone says to me there's a lot we don't know about in that marriage that at first, when that was brought up, remember, Maggie, I said, I don't think we need to know what was in their marriage. That was none of our business. But the more I hear about this and the more that
Yeah.
comes out about Patrick, I'm like, hold on a second. Maybe we do need to hear about the marriage because that could be, that could be the hit or miss in Lindsay, you guys being guilty of malice murder or that she was psychotic and overdrugged. Listen, there may be a reason why the defense will not bring up their marriage because it'll look like, okay, Lindsay found out about what was going on. She knew he was unhappy. She knew he wanted to get a divorce. She was driving him crazy. Because listen, I have been a nutcase before, and I know I drove my ex-husband crazy for a while because he even said it to me, and he wasn't very nice about it, but it's okay. So I understand caretakers get like that, but that's what respite's for. I could go into a whole thing. There's a whole bunch I could break down on this, but it's neither here nor there. No, I think he's living his best life. I really do. That's my opinion. But you're welcome to yours, and I won't beat you up for it. Doesn't matter. Hurt children. Wood chipper. Possum says, Possum, I didn't even know you were here. Hello, love bug. Good to see you. Diana says she was trying to get her kids in the basement. Mm-hmm. Yeah, you see, my problem is I'm sitting on a fence, right? And I swing my legs over to this side and I swing my legs over to that side. And because I'm wishy-washy, unstable as water, y'all. But the reason is because they're hiding so much from us. So much from us. Even the prosecution, look, if I was the prosecution, now they could be lying to him, you know. Patrick, Lindsay, the whole crew could be lying to him, right? Maybe they won't admit to problems in the marriage. But if I was the prosecution, I'd be digging deep into that stuff. I would be like AT&T. I'm getting a search warrant. I want their phones. I want all the records of all the text messages, because I mean that would be a great case for the prosecution, that yeah, Lindsay found out that her husband was having an affair and she was done, and she wanted to hurt him any way she could, so she was going to kill herself and she was taking the kids with her. Who knows? I'm just saying that's a variable in this. And right now, you guys, truth is, the truth is, we don't know, right? We don't know. Um, anything is Everything's not off the table. Anything is still on the table because we don't have enough evidence. Will we ever have enough evidence? How many of you guys really think that this is going to end in a mistrial, or that it's going to be a mistrial, or it's going to um, be a locked jury where they can't figure it out? I think it's very possible. Somebody in chat said that earlier, and I was like, yup. Um, Blair says, "This was my first time engaging live. Such a brilliant, supportive group. Thank you." Oh my goodness, Blair. Nobody would know it, honey. You was right in here with us, and we're so grateful for you. You have no idea. It means so much to Maggie and I when you guys are just in here chit-chatting or whatever, because even if like we think something different, I'm willing to think of a theory that you're putting out because maybe I didn't think that way. You know what I mean? Maybe my brain's just not capable of thinking that way. So I'm willing to listen to anybody. I'm just saying. So thank you, Blair. I hope you come back. I'm glad you enjoyed it. You're welcome here anytime. It was so nice chatting with you. Hope you'll stick around. I do have a video that we're going to play uh, before they go back to court. I just want to finish out, get to where we need to be in chat. But if you're in psychosis and you're on all these medications and on and off, I'm trying them all, seeing if these people, and she was completely confused, and that she said she was anything could have happened to her. There happened all over this time. I'm lost and all that. What, Andrew? You stone girl. um. Okay. Sound effects cooling. Oh, we got some great sound effects, you guys. We really, really do. It's just funny, right? You have to listen. Sometimes it gets too heavy and too deep. Maggie and I really do try not to end things on a sad note, even if we're covering things. Like, we don't want to leave here with everybody in the dumps. Now, when Brian Koberger pleaded guilty, you guys, we couldn't help it. There was no way to lighten the mood. We all just signed off, and we were all defeated, went and crawled underneath the covers. It was terrible. But for the most part, we try to, if it starts getting really heavy and really intense, we'll throw in some humor just to, ground us again and let us keep going with it. Because there's some really sad things in this world. It's terrible, y'all. Yes, she was to go to the ER, and she did, but Dr. Tufts did not create proper safety plan, so her psych failed her. Agreed. I think they all failed her. Jillian said maybe he's just a narcissist and hated Lindsay and liked seeing her struggle and didn't want any responsibility to her or their kids. I mean, that's possible. That it's so possible. I can't say, "Oh, no, that didn't happen." The only thing that I think I can prove, and unless you could show me different, is that he did not kill these kids or harm his wife that night that all that happened, in the time that it happened. I think I can prove that. If you can disprove it, come on, let's go. No arguing, no fighting, but let's just research it together. But I think I can prove that he's not the one that did it, as far as killing his kids and trying to kill his wife. Maliciousness, that's the biggest thing for me. How to Barbie, hello, good to see you, honey. Just joining this morning. Was she ever instructed to also seek out talk therapy? Well, Dr. Tufts, who's on the stand right now, says that she did tell her to do it. But if you guys remember, when Dr. Tufts first took the stand, I forget which side asked her, which attorney asked her, but somebody asked her, even though Lindsay had like an ER doctor and a doctor that she was in the hospital with, and maybe a therapist, and then are you who is in charge of her overall health? Who would be the leader in that? Or do you all just do your own thing and hopefully someone's talking to each other? And she said, I am her psychologist, so I would be her overall. I would she's taking, she's most responsible. But then I think he just blew her out of the water when he said, okay, you're the one that's responsible. You're the one that's you're the one that's getting the calls from the ER saying, look, she's saying she's suicidal, but she doesn't have a plan. She's saying this, she doesn't feel good, la la la. So that doctor is the one that says, okay, prescribe her this, give her this. That's how that's supposed to work. But did it always work that way? No. And the reason why we know that is because when she was in the hospital, she didn't get nothing from that hospital until it was discharged. And did she get a treatment like how they treated her in the hospital? Like, we gave her this at this time. Somebody came in and talked to her at this time. These are the notes that no, she just got discharge papers. It is her responsibility to get them papers. It is, if she didn't get those papers, absolutely, she should have Lindsay sign a form saying, she should have had Lindsay sign a form saying that she could get medical records from any one of her doctors, including her medical doctor, including that. And the medical doctor should have some of the forms, not all of the forms, meaning any therapy or anything like that, but medicine forms and things like that. Her regular GP should have the rights to all that as well. And they should kind of work together. That's not how this happened, you guys. This woman did not know about what was going on with Lindsay on a day-to-day basis and who all she was seeing and how they treated her to be doing anything of value for her. Anything. She was playing a guessing game with Lindsay's life and the lives of everybody around her. The basement thing for me is that she already lost her mind theoretically. So yes, it would have been malicious. Stop the crying, stop the stress. She couldn't take anymore and wanted to hurt them. Again, theoretically. That's fine with me. That's fine with me. That's your theory. And listen, I won't be the one that's calling you wrong because I don't know. Del Rey says there is no respite with 3 little ones, just fatigue, even for healthy minded moms. Well, in her case, there was. She had a nanny. Even when the kids were at school, the 2 oldest ones were at school all day, not just half day, all day, 3 times a week. There was a nanny there watching the baby. So yeah, she did have respite. She did have that. She also had a mother who I guess she could call at any given time and she'd come on down. Yeah, there was that. So yeah, she did have it. Now for people maybe like you and me, like, no, we didn't have people to give us respite. No. Um, so there's that. Yeah, absolutely. One was enough for me. Couldn't do all that over and over again. Know thyself. That's what Blair says. Stephanie says, I think she will be guilty, but she should be institutionalized. Right. Listen, I don't think she's ever going to walk, you guys. I just don't. She's going to be institutionalized at the very least. And listen, they're not trying to get her off of murdering her children. They know that. They're just trying to get her, make sure that she is not accused of malice murder, right? And then, because even if she's listen, even if she's accused of malice murder, so let's just go the distance. Let's just say that the jury finds her, yes, you knew exactly what you were doing, princess. You did it. You killed your babies. Congratulations. There are 3 babies that are in the ground right now, and it's all your fault. The chances of her doing any prison time is very slim. She will stay institutionalized. So what is this? What are we doing this for? In name only?
But Lee, if it was malice, what would be the reason? Would they have to say malice because you're doing it for a reason, aren't you?
Well, they have to prove, so they don't have to prove a reason. That's never in our court cases. You
Right, okay.
can give the reason, like, we know this, she did it because of this right here. This proves she did it, right? But you don't have to prove a reason. You just have to prove that they did it.
Yeah,
Do you see what
okay.
I'm saying? And
How can you
sometimes
come up with that though? Because she hasn't proved anything malice. She's always proved to be a loving woman. That's how where would
well,
that
yeah, they
come
haven't proved anything yet. But I'm still sitting on the fence back and forth. Hi, Gemma.
Yeah.
Gemma says,
Hi,
been
Jem.
listening in the background whilst I got done with work, but that truly was a mic drop on the end. Yeah, I think it was brilliant. It was brilliant what he did. And the look she gave him, man, y'all, that spoke 1,000 words right there. The look, she was not expecting that ending. Possum says, number 1, ER wouldn't help her. If not bleeding all over the floor, you're going home. Number 2, they closed down all the asylums years ago, hence the huge numbers of homeless crazies. Right, but they do have like what there's a couple moms that have killed their kids that are living in Andrea Yates, she's institutionalized. We do have some institutionalized places, just not like insane asylums. Y'all get my teeth in 1 month. I'm gonna sound like a different person. Then I'm getting my eyes fixed. I'm gonna get my blephs done. I'm gonna get my lips blown up to here. I'm gonna be fabulous. I'm gonna be fabulous, and I'm
Oh,
gonna
I've got a
sound good
picture of you.
again
How you
without a.
gonna look?
Ah,
You're gonna,
I'm gonna
oh,
sound
you're
like
gonna look hot.
I'm gonna look like Hollywood and sound like Hollywood again, y'all. This is not normalini. I just had a brief discussion with a dentist who came to his senses that he was pulling all my teeth instead of just 4. Yeah, that's what we did. If she signed a release, it's legal, Lisa Dodson says. Jillian said, if Lindsay gave them permission to see the therapy notes, would that still be possible or against the law? Therapy notes, she can give permission, but there is a law, patient client. So it would be hard. I mean, they would have to really submit in court, like have a really, really, really good reason for getting any therapy notes. But like medication, what she was feeling, the doctor's notes, those aren't as hard to get. But to get patient client, did you guys know? I found this out too. Y'all, I'm always researching stuff. And I did not know this. Do you guys remember a lot of cases we go over? I'm just like, How in the world can a defense attorney even try to defend this person that, like Brian Koberger? I was just like, how can that effing Ann Taylor even just sit next to him and defend him, knowing what that man did and why he did it, blah, blah, blah. Then, just this weekend when I'm out researching and doing my thing, y'all, I found out that did you guys know that most attorneys don't even ask that question? They don't even ask them, are you guilty? Because I was wondering how defense attorneys can, like, feel like they've got any sort of integrity or compassion for the victims if they know the crime. They know that that son of a bitch sitting next to him committed crimes against children, all these different crimes. I was like, there's no way I do it. I'd be like, screw all of you. I'm out. I don't need a job. I'll go live in a box. You know what I mean? But I found out this weekend that most attorneys who are defense attorneys will not ask their client that question. I didn't know that. I thought all of them do. Because y'all would be nosy. I'd want to not be like, listen, if I'm going to defend you, asshole, tell me what you did and how you did it. Don't play me because I'm going to find out anyways. And then I'm going to mess you all up. I'm going to be like, Your Honor, sir, judge, person, hey, over here. According to Leanie, nice to meet you. He told me he did it. That would be me. I'd be fucking up the whole court case. I'd be put under the jail for messing up. But I'm nosy, y'all. I'd want to know. Tiffany says, I believe the doctor said titrate this word is so hard for me to say, Maggie. Amitriptyline to treat her depression.
That was it. Amitriptyline.
Yeah, okay, thank you. It's just so hard for me to say. If I do it slow like that, I can say it. That can mean titrate up. Titrating for depression typically means titrating up to a therapeutic level. Jillian says, is the live going to start at 1 again? I'm going to make lunch. It's at my time. I'm Eastern Standard Time. It's going to start at 2. So whatever time you are, it's 2 Eastern Standard Time. Lisa says, Lena, shocking, huh? Defense doesn't want to know. Nope, they don't want to know. SAR says, I asked one of them and they said they see their job as facilitating the client's right to a fair trial rather than defending the guilty. I still couldn't do it. Y'all just couldn't do it. I'd be like, you're a fucking liar, you dickhead. You know what you did? Especially when it comes to children's crimes, you guys. I think I'd kill them and I'd pay someone to kill them in a cell. Jillian, too, if you are on Eastern Time. Thank you, Miss Dolores. Misty Blue says, Tiffany, he asked her for about amitriptyline and said she was to decrease the dose to a therapeutic level. She said yes, and he said, yet you increased it, and she said yes. Gemma says, I remember from Primal Fear, they didn't ask they're guilty as it can cause bias in their ability to provide a defense in a fair trial. Well, I never even knew, as much as trials as I watch and stuff like that, I just thought they automatically all knew because I'd want to know. Jillian says, okay, so half hour, I'll be back. Thanks, guys. All right, Maggie, I'm going to play this really quick because none of us, have any of you guys ever really paid attention to Lindsay and see how she really talks and who she is? Like, we've seen pictures of her smiling and carrying on with her kids and all that.
One new notification from Amazon Shopping.
Alexa, stop. Sorry, guys.
Let me pull this up really quick, you guys. I found a video of her before she was ever married, right after she was given right after she had got her nursing degree, license, whatever y'all call it. And I thought it was really, really important to see this because they talk about how she has no real affect in this whole situation when she's seeing the psychiatrist, the emergency people, all the everybody talks about like she's just plain like nothing's there, right? So this is her. I'm going to show it to you guys. This is her when she wasn't married because she was still using her maiden name, which was Musgrove. And this is her talking. Let me stop it real quick. Right after she comes out of nursing school, you guys. So I just want you to see uh, that to me when I found this and I was watching it, I was like, way back then, before she had children and she was married, she still has no affect. There's nothing there. I mean, don't know. You guys tell me what you think. Watch your ears, guys. I cannot control your volume. I can only control mine. Here we go. Can you see it okay, guys? Can you see it okay, Matt? Okay,
Yeah,
good.
we can see it. We can see it. The writing at the sides is small, and the picture's
Okay,
only small, but we can see it.
that's as well. Let me see. Hold on. All right, that's as big as I can make it. Here we go, guys. Listen to her talk. Pay attention to her face and her mannerisms, things like that, and tell me what you think.
Graduate nurse, and I recently did a lot of research about couplet care and rooming in, and I've found that all of the leading pediatric and obstetric foundations support this practice. So there are a lot of benefits for both mother and baby. For the mother, you can start forming a routine with your baby. You learn to sleep in chunks as your baby naps. You have less anxiety about your baby being out of your sight, so you actually are able to sleep better and deeper than when you send your baby to the nursery. This is a great way to have successful breastfeeding.
Yes.
I'm just thinking it's not going with the mouth. You know the
Okay,
words.
yeah,
So
I'll
I
try
don't know
to
whether
start it.
okay.
I'll try to start it over. Okay.
Yeah.
Listen, guys, remember, she was a labor and delivery nurse who ended up with, I believe, severe postpartum depression. I don't know if the psychosis was brought on with that or with the medications or what was brought on with it. But listen to how she's talking about how knowledgeable she is after giving birth and how you can learn to relax and get enough sleep and stuff like this. It's just amazing to me.
And I'm Lindsay Musgrove. I'm a new graduate nurse, and I recently did a lot of research about couplet care and rooming in, and I've found that all of the leading pediatric and obstetric foundations support this practice. So there are a lot of benefits for both mother and baby. For the mother, you can start forming a routine with your baby. You learn to sleep in chunks as your baby naps. You have less anxiety about your baby being out of your sight, so you actually are able to sleep better and deeper than when you send your baby to the nursery. This is a great way to have successful breastfeeding. You're always there with your baby. You can learn your baby's cues and needs when they need to feed, when they need diapering, when they need rest. And I'm Lindsay Musgrove.
So let me stop it right there, you guys. What do you think?
She knows it. She knows it all that, doesn't she? She knows very. I mean, to me, she's just a normal average girl. She's like, she knows her shit, what she's talking about. Well,
Yeah,
what do you
and
think?
listen, I understand that illness, like obviously she doesn't have children here. But I mean, working labor and delivery, you understand postpartum depression. They teach you about all that. They teach you the signs to look for. But my thing is like she's talking about a new, I don't know. I know we're all different. I don't want to be so judgmental, but I would say, for me, if I worked in this, I'd be like, oh, you guys are gonna love being a mother, and you know, it's okay if you send the baby to the nursery if you're too tired. And I mean, I personally wouldn't do that, but you know what I mean? Like I struggle with people that don't give any kind of emotion, no matter what they're talking about. I could talk about the damn fly hanging on the wall, y'all, and you're gonna get some emotion out of me.
Do you think she's got no emotion? Do you think it's because she's talking to a camera? So there's no one there. She's probably just got a phone sitting there, or a laptop. So
Well,
she's looking at it.
well, Lisa Dodson says, looks like a hospital educational tool for new mommies. And I believe that. I believe that's what it is. But there is
You went off there,
nothing.
like, but
Can y'all still hear me? Can you
yeah, I
still
can
hear
hear you.
me? Okay.
Yep.
I believe that, listen, I know at first her husband was asked, have you ever known her to be on any kind of psych meds before you had children? And he said no. And then he said, Wellbutrin, only a Wellbutrin. I don't remember what the other one was, you guys. Well, guess what? Those are psych medicines, dumbass. So quit. It's like he was trying to make things bigger, and then he would try to minimize them. Just
Yeah,
like when
yeah.
when they asked,
Shh.
just like, are you telling me?
I was thinking you tell. I know I went to say she, but I went and then I knew you were talking, so I stopped. Now,
Oh,
what I was going to say is, I would never tell you to well, I do, but she's very straight faced. That's one thing. I understand where you're saying about no emotion. But I just get it because of the way she's talking to that.
yeah. I mean, it could be. I could be reading it all wrong, but that's the way that it hit me. Stephanie says,
Yeah,
"I get what you're saying. Even her facial expression, there is no emotional connection. Yeah, it's a
yeah, yeah,
disconnect from what she's talking about.
yeah,
I could understand if she was an undertaker. Yeah, this is the most
yeah.
appropriate look for an undertaker describing, you know, things. But
But
this
maybe
is
she has
supposed
to keep it professional.
listen, if I'm in there overjoyed about your baby, you're gonna love me and think I am professional.
I know, and I'd be the same, but maybe she has to keep this. She has to do this professionally because maybe it's going to go somewhere, be seen somewhere. But I
I
get what
mean,
you're saying. I'd be like, oh, it's a lovely time, and don't forget, you when your baby sleeps, you have a sleep as well. It's okay, putting a bit of emotion, but it's just it might maybe she can't do that. She has to be professional, and
I
she
mean,
has to
and
put it out there.
oh my God, can everybody look who just came into chat?
Let's have a look.
You're
Oh
not gonna
my
believe
God.
it.
We've been talking about you, Sean.
Sean, you're
Where have
in
you been?
trouble. You're in more trouble with every mod that's here and everybody that knows you. Bend over, Sean. You're getting a whipping. I don't know who the hell you think you are not coming in and seeing us. We talk about you constantly. I just oh, Sean, seriously, we've been worried about you. We've been worried about you. There's probably at least 3, 4 times a week somebody says, anybody heard from Sean? Anybody? And I know I have your contact information, but I'm not that girl. I am never going to jump into somebody's business.
She said
I
that to
mean,
me.
I
I
mean,
said, go
even
and see how he is. She went, no, I wouldn't do that in case
no, no, not at all. Because
I would.
sometimes you may not feel like you want to hang out with us anymore, but it might be too
Shouldn't have,
uncomfortable to
yeah.
talk about. So you just disappear. You have that right. So I don't ever want it to look like I'm checking in on you because I want you in my channel. You know what I mean? I think about people that aren't here all the time, but I'm not going to reach out because y'all have the same way to get in touch with me as I get in touch with you guys. So I figure if they want me to know, they'll let me know. But we have missed you so, so much. So, so much. Yes, you guys will love Sean. Love Sean. He's a darling. He is from Hawaii and he's taught us very much, so much about his beautiful island. And he was a big part of the channel for a long time. Misty Blue wants to know where the hell you've been. MJ wants to know where the hell you've been. I know Lunch Lady's sitting in the background going, where the heck has Sean been? I mean, everybody asks about you all the time. We love you, Sean. We've missed you. Okay, so let me get back to this real quick because I don't want to take up much more time. We got about 13 minutes before we come back. They come back. Maggie, do you have anything to say about this? Does anybody else in chat? I mean, maybe I'm reading this wrong, but when I saw it on top of, I just firmly believe that there has been depression going on before she even met her husband. There's some kind of psych stuff going on there that she has dealt with, I think, but maybe just never talked about. And it just started manifesting.
I just think she's straight-faced. Some people are like that. That's just emotionless, aren't they? But you see all the pictures with the kids and she's smiling with them all. She has a big smile, not like a little smile.
Yeah,
She's
but
like
when have you ever seen someone take a picture and they're like, "Oh, fuck me, take the picture." You know what I mean?
I
Like,
know,
you're
but
smiling.
I really think this. I don't know if anyone agrees with me that she's trying to be professional and she's
Okay.
not putting her emotions into it. That's all I'm thinking.
Okay. I mean, listen, I could be completely reading it wrong. I appreciate your
And I
take
could
on it.
be, yeah.
Sean says, I've been kind of busy working with movies being filmed in Hawaii as a
Oh
cultural
my God.
advisor. Sean, look at you becoming big time without us.
And we
Listen,
want to part in it.
And we want to part in it for the love of God. You're supposed to be filming for me and getting on panel. What the hell's wrong with you? Sorry, you guys. I just have to fuss at Sean for a minute. I love him so much.
Dolores, yeah, she agrees with me. Thank you.
All right. So, Maggie, if you will hold this down a minute, I'm going to let me take this off, you guys. And believe me, I've been looking for other videos of her that's out there, but unfortunately they've taken down. That was found through the hospital,
I'm
you guys.
surprised you found that, yeah.
Actually,
Oh,
I was
what?
just
So
kept
you went to the
typing in
hospital
stuff.
to get it?
No. I just kept typing in stuff and then going from this page to that link that they send you to that link that
Yeah.
somebody else sent you to. That one's been deleted, so you have to start over at this link, and then so just doing that until I
And she
stumbled on
won't
it.
have a Facebook page still, will she? That'll
No,
be
they took
taken down.
everything down. Everything's gone. So that's not there. All right, let me entertain you.
So you guys, you think it's the same, that she is just being professional and she's not putting any emotion into it, her own emotions, because that's what I see anyway. If she's talking, I'd be the same if I was talking into a camera. It'd be all up the wall. I'd be thinking, if I start talking about my kids, do you know what I mean? I'm going to start getting really emotional then and shit like that, making it more about me than what I'm trying to tell you. So yeah, I just think it was that. I think she's very straight faced by the looks of it. But that could again just been for that video, because she's not putting any emotion. Lisa
You
says,
could be.
"Oh, I see you, Sean." I say, "Wait, you're a warrior. My daughter is in Hawaii, getting granddaughter settled. Hello, oh, we are, Sean."
So I put it back on screen, guys, so we will be able to see exactly when they're coming back. Maggie, I got to go take some medicine. I've got to pee, and I think
I'm glad you remembered.
I know. I just now remembered. So I'm gonna take my medicine. I'm gonna pee, and I gotta find something to eat because I'm starting to get that weird
Go
feeling.
and get something then.
All right, I'll be
Off
back.
you go. So smiles at the start when she's introducing herself. Yeah, I don't see anything in that at all, but it's good to get things like that up, isn't it? Because you don't get to know that side of it. But I just think from everything I've seen about her, I think she's been a really good mum. A really good mum. And for her to do what she did, she had to be out of her mind, to me. That's where I am right now. But listen, I could tell you something different in 10 minutes' time. It all goes on the evidence I see. It makes me start thinking, and everyone's the same, aren't they? But I think she's just tipped over the edge. She's been tipped. She's just gone. She absolutely adores them kids from what you see. Now I know pictures can lie, but every picture you see from when they're first born to they're older, she's glowing with them. she's glowing. So, and I mean, these pictures that Leanie's going to show you tomorrow was a bit shocking to me, because when you see the pictures of the house and all that, well, the pictures that Leanie's got tomorrow of the house, it looks like a bomb's gone off in there. So I don't know what the hell's gone on, but you're going to see them tomorrow. I'd have to put a trigger warning up and, graphic content warning up, because you're all going to see stuff. And it's just, you just can't make head nor tails of it from someone. It was like Chris Watts. It's like he adored his kids, absolutely adored his kids. Yeah, look what happened there. And the way he did it. And the same as her, the way she did it. I mean, you don't want to even think about taking your kids' lives, but if you have to, I'm not taking my kids' life where they're going to suffer. I'm just making them go asleep. And whatever happens after that will happen. I just can't even come to think how you could do that. So she's really snapped. She's gone. She's not there. She's just acting. She's just going by this voice in her brain that's tipped it over the edge. That's what I think. So I'm just going to read some of the chats. Okay. Any woman that kills children is purely evil. But Sean, you haven't heard the case, have you? Have you been listening to the case? This is to she's admitted she murdered her kids, but this is to see if there was postpartum, which I don't know whether you call it the same. We call it postnatal depression in the UK, and they just prove it if it was done intentionally with malice, it was premeditated, or the mental health, a postpartum, because she was given, Sean, you want to see the medication that girl was given, you want to see the cries for help. She told her husband she was having thoughts of hurting her children. Why didn't he get them out of her way as soon as that was said? So don't you think he's got a role to play in this? Because I think he should be accountable for that alone. Because, he should have been looking after his kids. If she'd have said that, I'd have dropped dead about myself as well. I'd have thought, hang on a minute, she's going to do us all in. And I'd have had to get her sectioned. As soon as I heard those words, I'd have had to get her sectioned. Hang on, he's asking Lisa, does she go to college? Does she go to college, Lisa? He's asking. Gemma Butler says, I do agree, Mags. I believe it was a promotional or educational video and was maintaining that manner. Yeah. Dolores said, her mind just blanked out. She wasn't there in her head. Agreed. What about man? What do you mean, what about man? Do you mean a husband, Patrick? Well, nothing's happening to him. He left 4 months after the murders, met someone else. He got married in April and he's got a baby. Charlotte Tweedy said, but if she was struggling, the last thing you'd want to do is housework. That's what I'm saying. That's what I mean, Charlotte. When you see it on the pictures, they're showing us it's all lovely and everything's in its place. But when you see this, you think, oh my God, it looks like a bomb. How could he not see that? Do you know what I mean? If your home is all spick and spam and it's all tidy and, you get your kids' stuff everywhere, I get that. That's always like that if you've got kids. But to see that she's going down, she's not getting out of bed, she's not doing the cleaning, blah, get her help. Actually, go with her, not just on one appointment. Do you know what I mean? And to go away and have left her with the kids. Where does that make sense? Let me scroll up. I hope you can all understand me as well.
Maggie, I do want to just remind us as well. remember, she was a labor and delivery nurse, and the reason why I bring that up is because, okay, we've all been parents, pretty much all of us, right? We've all gotten overwhelmed. Okay, listen, I'll admit, I
God,
listen.
yeah, tell me
My
about
kids
it.
are all grown and moved out of my house. I'm more overwhelmed than I ever was when they were living at
She
home.
is.
They drive me
Yes.
crazy. You guys, seriously, they hate me. They want to kill me. But anyways, no, they love me too much. There is such a thing. Anyways, but we've all been overwhelmed, right? So sometimes having a job, your kids go to school, you get a break from home because you go to work, right? And then you're sick of work, so you can go back home. So you're happy to be home, happy to see your family again. So I think that that is a good world to be in. It usually helps. It really does. But we have to think of her profession. I'm sorry. Hey, new. Sorry, guys. New. We have. Uh, we have to remember her profession, you guys. She never got away from kids. She never got away from, going to work, doing something different, being accountable for other things, and then going home and then doing something different and being accountable for that. Her whole life involved children. So I can imagine being all of us moms, if we were working moms, we struggled leaving our babies. That's just a struggle that it was for all of us. I know it was. And so when she was saying, I don't want to go back to work, I'm worried about leaving Cal, and um I understand that. That's not something that happened. That's something that happens to all of us women as mothers. But could you imagine her? I know. I'm sorry. I think. Yep, beefcake is home. That's what all that was about. I just think going from you're doing the same kind of work as you do at home. Then how does that feel? I couldn't imagine. I just could not imagine. Keep going, Maggie.
Sorry, I'm just having a domestic. Um, yeah, so I just think obviously he's seeing everything in front of him, and at no point did he take her somewhere and ask for it to be sectioned. I mean, I know I'm repeating myself, especially after he's told her she's told him she's got thoughts of harming the kids. So I don't understand how. I really don't understand. I'm struggling that he's got not been made to take any accountability for this at all. I mean, I can sit here and say, okay, he's got to live with it and it must be bad. And then people are saying, but he's moved on quick. And then I start thinking, well, yeah, because I couldn't bear to think of another baby. You know, I just have to find myself again first. It'd be years before I got my head. I've lost my 3 children through murder. I'd be destroyed. Absolutely destroyed.
I'm right there with you, Maggie. I mean, I understand people handle grief and stuff like that different all the time. But I'm sorry, 4 months later, and we know that he was in
Yeah.
New York prior to that. Something was going on there.
And before. Why
Yeah,
was he in New York before? What reason
yeah,
did he say, Lee? Do you know?
right. So I, I don't know what I was going to say, but it was going to be really, really, really good. I promise.
We keep doing this all the
I
time. It's
know.
terrible,
I think
guys. Honest to
it's
God. So when you get
you're.
to our age and you're going
Oh, it
through this and you
sucks.
think it's never going to happen to you because
Oh,
I
it's going
did.
to happen.
I don't
It's
remember who I am when I wake up.
it's
It's
really
going to
going to
happen.
really happen.
You keep
It.
forgetting. I keep
Mhm.
forgetting.
God, y'all, it was gonna be so good too.
And
Hi,
you know what,
Julie.
guys? We always try to make it really professional between us. We really have a go, and we
We
balls it up
try.
somewhere along.
Balls it up.
We
We just balls it
I've
up,
got
you
Lainey
guys.
saying balls it up. She's saying so many things like me. It's so funny. From Survive said, and it's not like he's just started dating again. It's a marriage. It's madness. That's exactly it. Do you know what I mean? I mean, couldn't he, even for the sake of his children, get this case over
Yes. And
and
that
put
is,
them to rest,
yes,
and then
that
live if he
is,
wants?
do what you want to do, right? Go live your best life.
Even the
Listen,
girl, wouldn't that be what you'd say, Lee? I'd
yeah,
say, listen, no, not now. I wouldn't want
no,
it.
we need
Same
to
year.
see
I
this
really
through.
wouldn't. Yeah.
See this through. How can you, listen, like I said, I know everybody agrees differently, but 4 months later, there was already a relationship established and he needed to go where his comfort zone was, and that was to her. So what else? But, and listen, if
I
it's
don't know
about
if this will
sex,
hold on.
have your sex. If it's about companionship and that's where you are getting the most comfort from, then I can understand that too. I don't understand getting married, nor do I understand starting another family. And we don't even know for sure if they don't have another child besides the one that was just born, what, last month? The little boy who was just born. They haven't told us what all the family dynamic is. So I'm just saying, for me, it's hard for me to understand that kind of humanity where you cannot see this through for your children who were murdered. Just see it through. Live with your comfort. Have your relationship or whatever, but don't bring any more kids into it until you see this through for your babies. That they didn't die with cancer, you guys. They didn't die by the hand of God anywhere. They died by the hand of their mother. And I want to answer to this. Joe Marsh said he was making sure she got therapy. Was he? Okay, let's just go there. Let's just see that. Let me jump on your bandwagon. Um, hold on. Let me just read this because this is totally horrible thing to plop onto the father. So it's his fault, and that she had a mental illness would have been his fault if she had gotten cancer. Ever think of his pain? My first question to you, Joe, is this your first time in our chat? Is this the first time you have visited here? And so you're just getting this form because we've been doing this since court started and even before. Maggie's been here every day. Most of the people that are in chat have been here every day. And the people who come in here and say stuff like this to us uh, usually have not been here to listen to all of the different arguments that we all give each other. And not arguments meaning fighting against each other, meaning going back and forth, playing devil's advocate with both of it. Right now, you happen to walk in at a time where you just think that we are bashing the husband completely and he's one that's responsible solely for the murders of his children. Nobody said that here. We totally believe, I think everybody totally believes that Lindsay Clancy told the truth when she said, I murdered the kids. Okay. But yes, if you cannot see in any point of this that that husband needs to take some type of responsibility for neglecting the well-being of his children, I don't know what to say for you. So, Joe, I don't know if you are a man or woman, but if your significant other comes to you and says, hey, yeah, I'm struggling. You already know I'm struggling, but I'm having suicidal thoughts. And there's times that I think about hurting our kids. What would be your responsibility in that? Just answer me that. I'm going to wait for your answer. What would your responsibility as the partner, man or woman, whichever one, says those words to you? I am suicidal. I think about committing suicide a lot, and more than once tells you, sometimes I think about hurting the kids. Where is your responsibility now? Just answer that one. Second time I saw him on the witness stand. So you've been here since then, and you've never heard us talk about anything else? He could have taken her to therapy because it looks like the right thing to do, Lisa says. I'm just horrified as a nurse, a mom, and a grandmother to hear what came out of your own mouths. And listen, I stand by everything that comes out of my mouth, even when it's wrong, and I'll apologize. She had all those scripts, but didn't take the meds. 30 tabs, 7 gone after 2 months. So can you, no, I'm not asking you, your answer to my question is you do whatever it takes. I'm asking you if your spouse or partner comes to you and says, I'm feeling very suicidal, and there are times that I feel like hurting our kids, and she's told you that at least twice. What is your, not everybody else's, I'm just talking about your responsibility to your children? Of course, but whatever the hell was she telling him? Okay, just answer that. Just can you answer that question? What is your responsibility to your children at that point? It would naturally be to do, well, what would it take? What would it take if you
Yeah.
knew? See, you're playing games with me now. The same thing that people are doing on the stand. You don't want to admit it. You don't want to admit it. What is your response? Do you know what it takes to protect the kids? What is it that it would take to protect those children from your? Okay, then just answer that question. Don't give me whatever it takes. What does it take? You're a nurse. You just said you're a nurse, a mother, and a grandmother. So, what is your responsibility as those roles for your children to protect them?
Listen, it's fine to have a different opinion, you know, absolutely fine. Honestly, no one's going to bash you for having a different opinion. You're just asking because we've asked everyone else the same question.
Okay, I guess for me, I think differently because
What's that
immediately
mean? 3 OTTs? I don't understand that.
it's the same thing as the Baker's Act or 5150. Listen, for me, I'll tell you what it is for me. Okay, since you don't want to come out and say it for whatever reason, and you do have a dog in the fight because you're the one that came in here and said this stuff to us. Okay, so that you positioned yourself where you're at. My responsibility to my children, if my husband said that to me, would be pick up the phone and call their grandparents. Call my sister. Call that nanny who used to be employed by them. Call anybody to remove my kids from a dangerous situation. My next responsibility in all of this would be to help my spouse, whether that meant to have her Baker Act or take her to the emergency room and say, you guys got to do something right now because she just admitted to me she is suicidal and she's thinking of harming my kids, and that's not happening.
But Joe, it's not about what he was put through. We're talking about his kids. It must have been hell for him having to deal with it. We've all said that. But she's asking, as a father, you've just been told by the mother of your children she's had thoughts of harming them. As a parent, what is your responsibility to do at that point? That's all we're asking. What would you do if that was you? It's not about what he got put through. That was never even mentioned. But if you're all for Patrick, that's absolutely fine. But we just want to know. We're in here to discuss and chat about it. And no one's being bashed in here. There's loads of different opinions. Moji says he never thought she would harm the kids. But wouldn't you if you seen your wife going down being really depressed and you know people do snap, would you take the chance? I'm not taking the chance. I'm sorry.
No, you don't take a
No
chance
way.
on
I'm
kids'
taking the
lives.
chance. My kids
No.
has been out of there the same night. These are never being left alone without me. Whoever says he went out to cheat and abandon his kids. Well, we don't know that. We can't say that for sure. It's something we can't prove. But we've all got a feeling.
He never thought that she would harm the kids. Yeah, neither did the suicide hotline and neither did the emergency room. You're right. Because she didn't have a plan. It doesn't matter. Listen, you have to take seriously people's words.
Yeah, especially with mental health.
Yeah, even if they're crying wolf. But she wasn't crying wolf. He said that their life was hell in that house with her. Then get your kids out of the way the minute that their life is being threatened, whether you believe it or not. Wouldn't you rather err on the side of wrongness? You know, like, oops, I was wrong, or I didn't have to take the kids out. Oops. Or, oh, shit. Shit. I mean, she told me that she felt like harming the kids sometimes.
She probably thinks at this minute she never thought Patrick would move on after 4 months, get married and have another baby. She probably thought that wasn't the type of man he was. But he's doing it. He's done it. Never underestimate anyone. The person you think won't do something.
That's right.
Will do it.
And especially if they voice it to you, listen.
Oh my God, yeah.
If somebody, especially when we're dealing with any kind of mental illness, if they are voicing it to you, take it for real. My God, she was told by her husband, she was told by the suicide hotline, and she was told in the emergency room, because she didn't have an exact plan how to kill herself, that she didn't meet the criteria in order to get put in a hospital somewhere and get the help that she needed. I would think calling a suicide hotline is a cry for help, and is reaching out and driving yourself to the emergency room and asking for help, putting yourself in a hospital. The girl did everything she could do. Look, I'm not blaming the husband for the actual murders that taken the lives of the kids. She did that. But he was warned. He did nothing to protect his children. And if you could sit here and say, oh, he did everything he
we
could
are blaming the
protect his
medicines.
Kids, if you could sit here and say, nope, he did everything he could to protect his kids, I don't know what to say for you. And yes, the doctors need to take responsibility. They failed her. Absolutely.
Oh, yeah.
They've got blood on their hands today, too. So do the grandparents who knew she had said that as well and did not go in and take those kids. They've all got blood on their hands today. That's the way that I believe it.
Yeah.
And if you just want to, if you want to cut slack, cut slack. That's on you. Stop blaming him for not doing something. It's not fair. Oh, well, is it fair that there are 3 kids in the ground? Why don't you blame the medicines? We do. And the mismanagement of those meds. Absolutely, we do. We think they should be punished. And their license taken away. See, that's what I'm saying. You guys haven't been here. If you've been here long enough, you would know exactly who all I'm blaming. And it is every person that had anything to do with Lindsay.
For the purpose of the record, we return back to the trial of Commonwealth versus Lindsay Clancy. All parties are present, including the defendant and including the 18 jurors.
All right, thank you, Madam Clerk. Commonwealth, redirect.
Thank you. Good afternoon, doctor. I apologize for my voice. If you can't hear me, just let me know. Okay. You were asked on cross-examination about your residency. At that point, you were already a doctor, correct?
Yes.
And during your residency, that was a 4-year period, correct?
Yes.
And you were saying that you treated patients during that time. Is that correct?
Yes.
Was there someone with you while you treated these patients telling you what to do and how to handle them?
No.
Were you alone responsible for the evaluation, diagnosis, and treatment of your patients?
For the most part, but if I had questions or, needed to talk it through, I had help.
And approximately how many patients did you treat during those 4 years?
Thousands?
And those were all psychiatric patients, correct?
Yes.
You said approximately 50 of those patients were patients dealing with postpartum depression or some postpartum issues. Is that correct?
Yes.
You also said you had some specialized or specific training in that area. Can you describe that for us?
Yes, I did a specialized elective with a specifically perinatal psychiatrist where I worked in an obstetrics clinic and I saw patients who were pregnant and postpartum.
And how long was that clinic for?
It was for about a year.
And so for a year, you were evaluating and diagnosing and treating women with postpartum issues?
Yes.
And that's separate and apart from your residency?
It's a part of the residency. It's an elective.
So for 1 year out of the 4, that was specifically designated to postpartum issues?
Yes, it wasn't every single day, but it was continuing the same patients for about a year.
So you would follow those same patients throughout the year? Is that what you're saying?
Yes.
And you were asked about postpartum psychosis, and you said it was rare. How rare is it?
I'm not sure of the statistic, but low.
Low. Have you dealt with patients in your 4 years of residency that had other types of psychosis?
Yes, many.
And psychosis, whether it's from postpartum or some other mental illness, does it present the same, or does it matter what the underlying illness is?
I mean, it can present different based on the individual, but it's the same general disorder.
And so what are the symptoms or signs that you look for to determine whether someone has psychosis?
So you look at them, you assess their appearance, are they disheveled, and then you look at how cooperative they are, how they're engaging in your interview, are they answering your questions or maybe refusing to answer your questions, maybe being very aggressive. You look at their speech, whether they're speaking very fast, very loud, or the opposite, like maybe not really even speaking much at all. You look at what their thoughts are like, and we assess thoughts by what they're saying. That's how we know what people are thinking, and whether what they say makes sense linearly, or whether someone's jumping around and you can't follow them. We also assess the thoughts for their content. If someone is speaking about things that are very bizarre, things that are very paranoid, if someone is talking or making noises, or it seems like they're communicating with somebody that's not in the room, those are all things, behaviors that we assess for.
So although you'd never treated someone with postpartum psychosis, you had evaluated, diagnosed, and treated people with other types of psychosis. Is that correct?
Yes.
Did you see any signs of psychosis in any of your interactions with Lindsay Clancy?
No.
Defense counsel mentioned that part of your residency was during COVID. Did mental health issues just stop during COVID?
Of course not. They often got worse.
And so it's fair to say you still kept busy seeing patients on a daily basis?
Yes.
You also mentioned that some of the patients you saw in your residency, it was outpatient care. Is that correct?
Yes.
Is that similar to the care you were providing to Lindsay Clancy?
Yes.
And was that all 4 years you were providing outpatient care to psychiatric patients?
For 3 of the 4.
You were also asked about telehealth. Is telehealth appointments in psychiatric care standard in the industry?
Yes.
And how long has that been standard?
Since COVID.
And is it a fairly common and accepted practice at this point?
Yes.
Most of the session, for a psychiatric session, you're talking to someone, right?
Yes.
Does looking at someone through a computer screen somehow inhibit how you hear the answers?
No, it does not.
Or inhibit the way you ask your questions?
No.
And defense counsel asked you about, not being able to see below the waist someone's shaking or moving, but if someone's sitting and they're bouncing, can you see it elsewhere? Can you see other movement?
Yeah, sometimes it can reverberate in different parts of the body.
You were also asked about the Edinburgh scale. You said you don't use it, right?
Yes.
You said you used the PHQ-9. Why do you use that instead of the Edinburgh scale?
It's not my choice. That's the practice at Astor of what we use.
And the PHQ-9, what does that look for?
It assesses various symptoms of depression.
And postpartum depression, are there questions on the PHQ-9 that look for the signs and symptoms of postpartum depression?
Not specifically postpartum depression, but the symptoms of postpartum depression are symptoms of depression that occur during postpartum. It's the same symptoms.
So the PHQ-9 is asking the patient questions that would reveal whether or not they might be depressed, but not whether or not they just had a baby.
Correct.
And then with your interaction with the patient, you're able to know whether or not they are in the postpartum phase.
Yes.
And so would it be fair to say that you take the PHQ-9 plus the information you learn from the patient, put it together and come up with a diagnosis?
Yes.
When you take a history from a patient, you were asked about taking history from Ms. Clancy. How important is it that the patient give you accurate information?
It's very important.
And why is that?
Well, that information is being used to make treatment decisions, and a lot of things can be assessed. You know, the things that I described before. That's very helpful, but we can't see what someone else's thoughts exactly are. So the person does have to tell them to us.
And would you agree that people in the medical field, such as nurses, are acutely aware of the necessity of an accurate medical history and symptom presentation?
Yes.
You mentioned that the defendant was able to advocate for herself. In what ways did she show you that?
In scheduling her own appointments, in presenting herself to the emergency room when things were really not going well, in communicating her concerns to myself, and sharing about a lot of detailed information about all of the different medications, doses, times they were tried, what the reactions were, all of that information.
If a patient is clearly advocating for themselves and can communicate in that way, would you typically reach out to family and friends to let them know, hi, I'm her psychiatrist and I'd like to talk to you about her treatment?
No, in fact, we don't have HIPAA permission to do that.
Now, you mentioned, or you were asked about therapy in your sessions. Do you keep a recording or a transcript of everything you say in your therapy sessions?
No.
Is your therapy conversation or what you say to a patient the same for every patient?
No.
Is it a script or a conversation?
It's a conversation.
So if I'm your patient and I'm telling you certain things, is your response dependent on what I'm telling you?
Yes.
And so when you're providing therapy to someone like Ms. Clancy, is that dependent on what she's telling you and then how she's responding to what you're saying, basically a conversation?
Yes. Therapy is a lot of listening.
Would you say it's more important in therapy for the psychiatrist or therapist to talk or listen?
Listen.
And why is that?
Because that's how you really understand what a person is feeling.
Now, is it accurate to state that in every one of your sessions with Ms. Clancy, you told her about individual therapy and encouraged her to attend individual therapy?
And that was the treatment recommendation each time. I'm not sure if I explicitly mentioned it each time, but I did many times.
And you, in fact, wrote it on the work form that we talked about previously on page 104 of the records. It lists, was the patient referred to other healthcare providers for evaluation or treatment? It says yes. If yes, state the nature of such treatments and expected duration of treatment. And it says individual weekly therapy, correct?
Yes.
And this is the form that the defendant asked you to fill out, correct?
Yes.
And you sent it back to her. And the first version, she wanted you to make some corrections on, correct?
Yes.
But she didn't ask you to change that portion, correct?
No.
And in fact, on the second version, on page 107 of the record, it still says individual weekly therapy recommended, correct, for follow-up?
Yes.
Would it be accurate to state that the defendant only saw Jennifer McAllister twice the entire time that she was with your practice for therapy?
Yes.
You were asked about Zoloft being used for general anxiety disorder. Is that a common drug used for general anxiety disorder?
Yes.
And why is that?
Because it's effective and it's safe.
You were also asked about the suicide warning on it, that there is a suicide warning. Is that for all ages?
No.
What ages or groups is that suicide warning for?
It's really for children and adolescents. They do say up to 24 years, but it's really children and adolescents.
Would it be accurate to state that the defendant was 32 years old when she saw you?
That sounds right.
Well, if you want to check the records,
I can check.
to be sure.
Yes.
Is that correct?
Yes.
Okay, so 32 years old is not 3 to 4 years older than 24, correct?
No.
Why didn't you have to titrate the 50 milligrams of Zoloft?
You mean to stop it?
Yes.
Because it's still a very low dose, so it can be stopped right away.
So it wasn't necessary?
Not necessary.
The defendant waited about a month after receiving the prescription before taking the medication, correct?
Yes.
And she only took the medication when she decided she was ready to take it, correct?
Yes.
So she was taking in the information you gave her, correct?
Yes.
She was making her own decisions, correct?
Yes.
She was not forced to, correct?
Yes.
She actually had an appointment in between when you first prescribed it and when she started taking it, where she was still discussing with you whether or not she wanted to take it. Is that correct?
Yes.
Is that part of the advocating for herself that you were talking about?
Yes.
Is that part of the medical sophistication that she possessed that you were talking about?
Yes.
Your Honor, at some point, in light of the fact this is direct, I have to object.
Sure. Yeah, if you could just not ask the leading question.
Sure. I want to direct your attention to the September 12th, 2022 form that the defendant filled out. On page 16 of the record, we have different page numbers,
We
right?
do, but if you just tell me what you're looking at, I can find it.
The past psychiatric history.
Okay.
What did she tell you, Ms. Clancy, tell you about the, where it says, if yes, list the reason and dates? What did she tell you?
She said anxiety, September 2013 to September 2014, postpartum anxiety, May 2020.
And on the following page, under the past or current psychiatric medications, which ones did she list?
Prozac, 50 milligrams, and Wellbutrin, 100 milligrams.
Is there a column there that says effective, yes or no?
Yes.
What was the defendant's answer with whether or not Prozac was effective?
Yes.
What was her answer as to whether or not Wellbutrin was effective?
Yes.
Is there another column there that said experienced side effects?
Yes.
Did she check off any side effects experienced for Prozac?
No.
Did she check off any side effects experienced for Wellbutrin?
No.
Going to the October 20th, 2022 appointment. You were asked about this on cross-examination about documenting side effects in your notes. Did you document the side effects that the defendant reported from the Zoloft on October 20th, 2022?
Yes.
And what did you document?
Well, I checked the box for GI. But I also talked about the side effects in the interval history.
And so what does GI mean?
Gastrointestinal.
So would that mean stomach issues?
Yeah.
And what did you put in your notes?
Couldn't sleep, insomnia, worse on increased dose, doesn't want to eat, diarrhea, food really unappealing, was more depressed on it, crying all day, yesterday, not normal, mental fog, terrified to start something new.
And so you did document the side effects that she reported to you, correct?
Yes.
You also documented in the interval history, paranoid of getting suicidal thoughts. Was that the defendant's phrasing?
Yes.
And is there a difference between someone being worried about having suicidal thoughts and someone actually having suicidal thoughts?
Yes.
And what's the difference in terms of how a psychiatrist sees it?
So that's the difference between what a patient might answer and then what the psychiatrist actually assesses. So say a patient might say they're having suicidal thoughts, but when they describe them, they're not actual suicidal thoughts. They're fears of suicidal thoughts. So that's the difference there. And I'm sorry, I think I forgot exactly what your question was.
So what's the difference in your training and experience between someone having fears of suicidal thoughts and actually having suicidal thoughts?
Well, so if it's a fear, then it means that they're not actually having suicidal thoughts. It's a negative.
And does that affect the way you proceed with treatment?
Yes, in some ways, yes.
How?
Well, you still proceed with treatment. It's still concerning, but it is a level of concern that can be managed on an outpatient basis, not requiring hospitalization.
And so, according to the defendant, she was not yet having suicidal thoughts at that time.
Yes.
So when defense counsel asked you repeatedly why you didn't document how many times she had those thoughts, she hadn't had those actual thoughts yet, correct?
Correct.
That was later in December, is that right?
Yes.
Now, she also told you that she was worried about that something bad might happen, so she arranged for her mother to stay. Is that correct?
Well, she arranged for her mother to stay. I'm not sure if that was because she was afraid something bad was happening, or it just seemed like they needed more help.
Okay. So you don't recall the two being together as a thought?
Correct.
And the fact that she was struggling and arranged to have her mother stay, got support, advocated for herself, would those be protective factors?
Yes.
How so?
So if someone demonstrates that they can advocate for themselves, that they can seek help if symptoms worsen, then that shows that they have good judgment. They can be trusted to present for care if serious safety concerns were to arise.
So based on your training and experience with Ms. Clancy, where she says she's worried about getting suicidal thoughts and she has her mom come stay with her, do you see that as a positive decision?
Yes.
You were asked about not asking the defendant if she had called the suicide hotline. If a patient denies suicidal ideation, would you typically ask them if they had called a suicide hotline?
No.
And why not?
Because I wouldn't think that they would have. If a patient were to call a suicide hotline, I would think that they would be telling me they're having suicidal thoughts as well.
You were asked about prescribing hydroxyzine, Ativan, and Buspar. Did you tell the defendant how to take those medications?
Yes.
What were your instructions?
So the Ativan was to take as needed for severe anxiety. The Buspar was to be an everyday medicine. And the hydroxyzine, we had started that to see if she could use that as an alternative to the Ativan. So to take it instead of the Ativan. But if the Ativan if the hydroxyzine wasn't working, she still had the Ativan to use, it's stronger.
So was there ever an instruction for her to take all three at the same time?
No.
And you were asked about the contraindications of Ativan and Benadryl. Do you recall that?
Yes.
Are there contraindications for taking the two together?
It's not an absolute contraindication. You have to be careful that the person is not excessively sedated, meaning like they're so sleepy that it's hard for them to, engage in normal activities because they're so sleepy, or maybe they might feel a little bit dizzy. But it's not an absolute contraindication. You just have to monitor them.
And is that one of the reasons that you prescribed the hydroxyzine?
Sorry, is what one of the reasons?
Is the fact that the two of them together, Ativan and Benadryl. Well, let me strike that question. Why did you prescribe the hydroxyzine?
So she had been taking Benadryl, which is not a prescription medication. It's not classically within the scope of psychiatry, but it's very similar to hydroxyzine. So I thought that, hydroxyzine might be a better alternative than the Benadryl.
Okay, and I'm just going to direct you to your November 2nd, 2022 interval history. Now, would it be fair to say that on the November 2nd date, the defendant reported she was fine all day, evenings, bedtime, get anxious, Ativan helps, sleeping great on it, afraid to try something else, but knows it's not a long-term solution. Is that correct?
Yes.
And what part of that did the defendant tell you was not a long-term solution?
Taking the Ativan.
And why is that?
Because it was indicated for short-term use only. The people can struggle more with dependence if they're taking it for a very long period of time.
And was there a plan developed based on that concern?
Yes, there was.
What was the plan?
To reduce the dose by 0.25 milligrams every 2 weeks until she was off it.
So the defendant was able to express to you a concern she had about the medication. You had a conversation about it, and you addressed that with her and came up with a plan. Is that right?
Yes.
She also told you that day that she was in therapy and exercising daily, correct?
Yes.
Did the defendant ever tell you that she went to the South Shore Hospital Emergency Department on November 16th, 2022?
I don't recall that.
Did she tell you that they had prescribed trazodone to her at that time?
I don't recall that.
Did she ever tell you that she was trying some alternative methods like weed gummies?
No.
Do you have any way of knowing these things if the patient doesn't tell you?
No.
Now, on December 1st, 2022, defense asked you about that date. That's the date that she, again, said she had the fear of thoughts of suicide. Is that correct?
Yes.
Up until that point, had she consistently denied suicidal ideation or intent or a plan?
Yes.
Had she consistently denied homicidal ideation, intent, or a plan?
Yes.
What's the difference? Let me ask you this. When you talk to a patient, do you ask them, do you have suicidal ideation?
Not usually. Not in that way.
How do you get that information from them? What types of questions do you ask?
It depends how the course of the conversation is going. I might ask if they're having thoughts of hurting themselves, if they, sometimes wish that they weren't alive. It can be a lot of different words, and sometimes I use, the patient's own words, but things like that.
And is there a difference between having thoughts of suicide versus having the intent and a plan to do it?
Yes.
And are there different types of treatment or things that you would do if someone has intent or plan to do it?
Yes, that would generally require hospitalization.
And so if Ms. Clancy had told you she had thoughts of hurting herself, or actually, straight that, if she told you that she had a plan to hurt herself or a plan to hurt her children, would you have moved to commit her?
Yes.
And that would be a Section 12?
Yes.
You were asked about the October 31st therapy session with Jennifer McAllister. And I know you weren't present from that. You're just going from the records. But you did say that in that session, the defendant denied suicidal ideation and homicidal ideation, correct?
Yeah, that's what's documented.
Would there be any reason, based on your training and experience, to do that further suicidal intent assessment?
No.
Why not?
Because if someone is denying suicidal ideation, they're just going to deny every other detail about suicide.
But that further evaluation, is that very specific questions about planning for suicide, how you do it, all of those things?
Yes.
You were also asked about evaluating the defendant for bipolar, and you said that she, based on your conversations with her, there were no signs of mania, correct?
Correct.
What are the types of questions you ask a patient to determine if they've experienced an episode of mania?
Well, a lot of it is what I can see in the session. I might also ask about some of those symptoms, like decreased need for sleep, or racing thoughts, or increased risk-taking activities. But even if they're reporting those things, I would have to really see it for myself to diagnose that.
And what would you see physically?
So I might see that the person is talking very fast, and it's almost impossible to interrupt their rate of speech. And it might also be very loud. They might be hyperactive, not able to sit still. They might be yelling and jumping from one thought to another without any linear connection between the thoughts. They might, I guess that's probably what I would observe in terms of behaviors.
Did you observe any of those behaviors with Lindsay Clancy?
No, it was the opposite.
What do you mean it was the opposite?
So, the opposite of euphoria is dysphoria or depression. The opposite of hyperactivity is tiredness and fatigue. So, in a way, it was the opposite of mania that I observed.
And in terms of the questions you asked about her past behavior, were any of the answers that she gave indicative of mania?
No.
You were asked about discussing Seroquel with the defendant, even though you weren't the prescriber. Why did you discuss that medication with her?
Because the patient was asking about it, and her husband was also asking me about it. They really wanted my opinions about it. It wasn't necessarily that I was prompting this line of conversation.
And what did you tell them about it?
Well, I shared that it has very good evidence for treating depression, and I may have shared that Seroquel does different things at different doses, right? So sometimes people are concerned that it is called an antipsychotic, but it actually doesn't function as an antipsychotic until you get up to really high doses, like 800 milligrams. So in low doses, it's more of a sleep medicine or an antidepressant. So I think that I explained that to them, and it's obviously a very important part of it. But they were also concerned about that causing the depression that she was experiencing. So we talked a bit about how you would tell. It kind of can be hard to tell whether a medicine is causing that or it's just occurring because of depression.
What did you tell them in terms of how to tell?
That it's really based on the timing. If you were to notice a significant decline after starting or increasing the medication.
And Prior to Ms. Clancy taking the Seroquel, had you noticed signs of depression in her?
Yes.
And after she was off of the Seroquel in January, did you see signs of depression in her?
Yes.
So that was completely off of Seroquel, both before and after, still showing signs of depression?
Yes.
During January, the defendant told you she had trouble getting out of bed?
Is there a specific visit?
I think it was right after she got out of the hospital. Maybe your first or second visit with her.
I see that on the 16th, she did say that she was able to force herself out of bed and take care of basics, so on and so forth.
Were you aware that she had gone to the Museum of Science with her family on January 8th and spent a few hours there interacting with the exhibits and the children?
No.
Were you aware on January 15th, the day before that session, she had been to the Cape Codder down in Hyannis with the family, interacting with the kids and going down little water slides and all of that?
No.
Were you aware that on January 14th, she watched all three kids while Pat went to a brunch and was fine?
No.
Were you aware that on January 16th, her husband took Cora skiing and she was alone with the boys all day and had no issues?
No.
You were asked about the thyroid and how that can affect mental health and postpartum. Were you aware that at both South Shore Hospital and Brigham and Women's Hospital, her thyroid limits were in normal range?
No, I was not.
You received a discharge summary from McLean Hospital?
Yes.
What's contained in the discharge summary?
So it includes information about how the patient initially presented, what they said when they first came to the hospital, and their initial assessment from the psychiatrist that they spoke with. It talks a bit about their treatment course, how things progressed, any changes that were made, and then it talks about how the patient appears on the day of discharge.
Does it also include what medications they were prescribed and what the diagnosis might have been?
Yes.
And was that sufficient in terms of your review of the information that you needed for you to know about your patient at that time?
Yes, that was a very helpful amount of information that I would typically review that amount of information for a patient after the hospital.
Now, you were asked about your January 23rd, 2023 session with the defendant. Defense counsel asked if you had, recommended a hospital evaluation for her on that day, and you said no. Why not?
Because she was completely denying any suicidal ideation or homicidal ideation. There were no signs of psychosis or mania. So there were no serious signs that her safety or that anyone else's safety was at risk.
And during that session, did she ever tell you that she planned to harm herself or the children?
No.
If she had done that, what would you have done?
I would have, it depends exactly how it would have played out. It would definitely include hospitalization. If the children were in immediate harm, it might include enlisting help from my staff so that they could call the police while I'm on the phone with her. I think it depends, but I would address it promptly.
You were asked by defense counsel about the amitriptyline that you prescribed on January 16th, 2023. That initial prescription was for 10 milligrams, correct?
Yes.
Explain the bottle from exhibit 155 of amitriptyline. Would you agree with me that this shows that the prescription was filled on that same day, January 16th, 2023?
Yes.
And out of this pill bottle here, there were 30 pills in this prescription, correct?
Yes.
And there are 8 pills missing from this bottle. So filled on January 16th, 16th, 17th, 18th, 19th, 20th, 21st, 22nd, 23rd would be 8 days, correct?
Mm-hmm.
And on the 23rd is when you said she could raise it to 20 milligrams?
Yes.
So if there are only 8 pills missing, she never took that additional dose, correct?
That's what I would think based on what you just said.
So the amitriptyline, increasing it from 10 milligrams to 20 milligrams, wouldn't have pushed her over the edge, correct?
Well, if she didn't take 20 milligrams, then that's correct.
I have nothing further. Thank you.
All right. Can we cross
Briefly. So one of the questions that prosecutor asked you pertained to whether or not you could reach out to a third party. You recall that question, like mother, father, husband?
Yes.
And we already on cross talked about that you didn't, and they didn't call you, but then the DA also raised that, and you said you didn't have HIPAA permission. You recall just telling that to the jury?
Yes. That was an additional detail.
All right. So what does that mean?
Well, HIPAA is the privacy law for patients, which we have to respect and honor very diligently. So we are not allowed to talk about a patient's treatment to anyone. We're not even allowed to say that they are a patient at our clinic unless they were to waive those HIPAA rights.
And she was very cooperative, would have been more than willing to have you talk to her mother, father, and husband, right?
Objection.
sustained?
Well, did you ever ask her to sign a HIPAA form?
So that was not the main reason why it wasn't done. It wasn't.
Ever ask her to sign a form?
A release, you mean?
Yeah.
Yes. No, I did not ask her to sign a release.
And if she did sign a release, even though her mother, her father, her husband didn't call you, you could have then reached out to them, right?
I could have, but it is not typically something that is done when you have an adult patient who's able to speak for themselves.
Yeah, what is that? It's not typically done when?
When you have an adult patient who is able to speak for themselves.
My God, you don't call the parents that she's living with because they're helping her or her husband?
No.
Because why? She's able to advocate for herself?
Yes.
Prosecutor yet again raises the issue of the marijuana. You recall that question?
Yes.
She wasn't smoking marijuana, was she?
She did not tell me she was smoking marijuana.
Did she tell you that she was using marijuana?
No.
Did she tell you that she was using gummies?
No.
Did she? Because gummies in plural is what the DA asked you, right? She was using gummies?
Yes.
Now, I asked you about getting access to the Women and Infants Hospital records, which you did not. Which you did not, right?
I did not.
And we already went over that. You could have, if you asked for them with a HIPAA form, right?
Objection. Didn't ask about those records.
I don't care if she asked about the records.
Beyond the scope.
Overruled. You can ask that question.
She asked you about marijuana gummies, right?
Yes.
Okay. Your Honor, I would offer the Women and Infants Hospital records from Rhode Island dealing with Lindsay Clancy.
No objection.
Okay, they may be admitted.
I just want to look at them at some point to make sure it's a clean copy.
Sure, yeah. Before it goes to the jury, you can review it.
And it's important for a patient to be forthright when asked questions by their provider, right?
Yes.
And you always, in your opinion, found her to be forthright, right?
Yes.
If I could approach you with Exhibit 220, excuse me, and see the second paragraph, it begins in the middle of November. Could you read that first sentence?
In the middle of November, she tried taking a marijuana edible to help her sleep, which caused her to have increased anxiety and palpitations.
So, the records, if you had obtained them, you would have seen that it was not marijuana, it was not gummies, plural. It was one gummy that she tried, and it didn't work out, right?
Based on what I just read, yes.
Then you told us that there's a difference between a thought of suicide versus a plan of suicide, one of which would result, in your words, were a commitment, right?
Yes.
What does that mean? Thought versus plan equals commit.
A suicidal plan means that they are, they know exactly what they're going to do to end their life, what they're going to use, maybe when they're going to do it. They've researched it, and that presents an immediate threat, and that is something that would require hospitalization.
District Attorney had asked you also about the thyroid levels, and you indicated, or she indicated that they were in the low range at Mass General Hospital, Reed. Is that correct?
I thought she said they were normal.
Oh, I thought she said low, but normal or low. MGH, Mass General Hospital, right?
Sorry, what's the question?
District Attorney asked you whether or not they were thyroid reads. Do you remember that question?
She said her thyroid had been tested.
My question now is, do you remember that question that she asked you that you answered with no problem?
Yes.
Okay. And your response was that, my memory, this is jurors' accounts, that it was low reads, MGH, and South Shore Hospital. Is that right?
I thought she said that it was normal, or within normal limits.
Almost fine. We'll go with normal. So your memory is that there were thyroid blood level reads of Lindsay Clancy from 2 healthcare providers. Is that correct?
Yes.
One would be Mass General Hospital, right?
I don't remember exactly. I think she said yes. I think she said Mass General.
Okay. Do you remember where the other hospital healthcare provider was?
It might have been South Shore.
Do you know what date those were?
No.
Those are old reads, weren't they?
I don't know.
One of the things that the district attorney asked you about on a number of occasions that seems to be important is if the person that you're treating has, I guess, what do they call it, pressured speech?
Yes.
And you told us repeatedly that you never detected that Lindsay had pressured speech, right?
Correct.
I'm sorry?
Correct.
Looking at the record from October 21st, would you...
Objection is writing on this.
Oh, all right. You know what? I'll ask you to just look at it.
Might take a look at it, and if you want to get the actual exhibit, we could do that.
All right. So forget all about my sloppy writing. I'm looking here on October 21st of 22. Is that correct, right up there?
Yes.
Okay.
Yes.
And can you just read this paragraph here for us?
No sleep last night. Falls asleep after 40 minutes. Heart racing, severe anxiety. Worrying about kids, baby, sleep. Yawns but not drowsy. Not hyper, pressured speech.
What was that? Not hyper what?
Not hyper, not pressured speech is what I meant. I know it doesn't say not, but that is exactly what I meant.
Wait, when did you see this that you noticed that it did not say not?
I don't care what it says. I know what I meant.
Well, when you wrote this, you did not say not pressured speech. You said in the medical record, pressured speech, right?
No.
Does it say that?
Yeah, the word is the word not is right before not hyper, comma, pressured speech. The
Right, so
two
what
are
does it-
following
what
the
does a comma mean
not.
to you? When you put down in a medical record, heart racing, comma, severe anxiety, comma, worried about kids, comma, baby, comma, sleep, comma, yawns but not drowsy, period. Not hyper, comma, pressured speech. That's what you wrote, right?
She did not have
Did
pressured
you write
speech.
that, doctor?
I wrote that, but you're misinterpreting my note.
Am I reading this correctly, and the jury will be able to look at it, that you put not hyper, comma, pressured speech? Did I read that right?
Yes, but your interpretation is incorrect.
As opposed to yours? Go ahead.
Just in regards to what was raised there.
Yes, just two brief issues. Approaching you with your records from October 21st, 2022, the section labeled speech, where there are all the boxes where you can put pressured, word salad, all of the different things. What do you check off for speech on October 21st, 2022?
Appropriate.
And defense asked you about the thyroid levels. Would it be accurate to state that I asked you if you were aware that her levels were normal at South Shore Hospital and Brigham and Women's Hospital?
Yes.
And your answer was no, correct?
No, I was not aware.
Because you don't have those records, correct?
Correct.
Thank you.
All right. Do we have any clue as to how old they were?
I don't know. You're asking me about something I never saw.
All right.
Nothing further.
All right. Anything further? All right. Thank you, doctor. You may step down. Thank you.
I'll just stop, please.
Your Honor, the Commonwealth would move to submit the certified copy of the Spalding rehabilitation records.
No objection. That's by agreement.
Okay. By agreement of counsel, the Spalding records will be introduced.
221. Can I call the next witness?
Please, counsel.
Commonwealth would call Julie Paul.
Good afternoon. Right there, raise your right hand for the clerk.
Good afternoon. Do you solemnly swear that the testimony and the evidence you should give to the court and the jury in the matter now having reached the Commonwealth will be Thank you. You may have a seat.
Watch yourself, please.
All right. Good afternoon.
Good afternoon.
All right. Yes, Attorney Buckingham, please.
Thank you. Good afternoon.
Good afternoon.
Could you please tell the jury your first and last name?
Julie Paul.
And what do you do for work?
I am a psychiatric mental health nurse practitioner, board certified.
And can you tell us a little bit about your educational background?
Sure. I graduated in 1991 from St. Anselm College with my nursing degree, worked as a labor delivery nurse for 17 years, and then graduated in 2006 from Frontier Nursing University with my midwifery degree. And then in 2018, I graduated from Frontier Nursing University with my psychiatric nurse practitioner degree. I also have a perinatal mental health certification from Postpartum Support International from 2018.
Okay. Are you also a certified midwife?
Yes, I am.
And are you licensed in the state of Massachusetts to be a psychiatric nurse practitioner?
Yes, I am.
And what is required in order for you to become certified to be a psychiatric nurse practitioner in Massachusetts?
I attended a certified program, did 2 years additional training, and then took the certification exam through the ANCC.
And can you tell us a little bit about your work history, your work background?
Sure. Like I said, in New Hampshire, I worked as a labor and delivery nurse before transferring to Massachusetts in 2006 to work as a certified nurse and midwife. And then in 2018, I started the perinatal behavioral health program at South Shore Hospital as a psychiatric nurse practitioner.
And so the perinatal behavioral health clinic, explain to us a little bit about how that came about.
Sure, there's a lack of resources on the South Shore for pregnant and postpartum people with mood disorders. So I really felt compelled, because I had a couple clients that really struggled with mental health issues as a nurse midwife, and really wanted additional education and being able to prescribe for them, and take care of them in a proper way. So I went back, got my psych NP, and then worked with South Shore Hospital to establish the program.
And where was the program actually located?
It was located right in Weymouth, Massachusetts.
And you said you worked with the South Shore Hospital?
Correct.
So the clinic is tied to South Shore Hospital in the South Shore Health System?
Yes, it is.
Now, when did you start that program specifically? When was it up and running?
2018 is when I started, in October of 2018.
And what, did you do that by yourself, or did you have other practitioners that were doing that with you?
Initially, it was just me. I started doing it 2 days a week and then grew the program gradually over the next year or two.
And what makes up this program other than you?
So at the time, when it was just me, I just saw patients 2 days a week, and then gradually built up to 5 days a week. And we included a therapist in the team, 2 additional prescribers. We also worked with women with substance use disorders as well, so we had additional support that way. And then when the building grew, we also had the Bridge Clinic on the other side, and then we were on the other side of that program.
And what's the Bridge Clinic?
The Bridge Clinic works with people with substance use disorders.
And all of this is kind of under that umbrella of what's classified as South Shore Behavioral Health, correct?
That's correct.
Now, as the clinic grew, did your role there change?
I'm sorry, can you repeat that?
As the clinic grew to what you described as having additional therapists and other prescribers on staff, did your role there change at all?
I became the director of the program.
And as director of the program, did you still see patients?
Yes, I did.
And was that at the same level as it had before, or did it decrease because of your administrative roles?
It actually increased because I increased my hours to 5 days a week. I did have a little bit of administrative time.
Okay. And can you tell us a little bit about how the clinic would work for a woman who is coming in either during the birth period or prior to birth and after birth? What kinds of things would they be offered at the clinic?
So I'd receive a referral, and then the client would come in. We would do a 90-minute intake. When they left, when it was just me, I was using outside therapists, that sort of thing. But as the program grew, we had moms groups run by doulas. We had therapists that was brought in from Aspire, but part of our program embedded within our program. And I brought in 2 additional prescribers as well as nursing staff.
And when you talk about people as prescribers and your role as a psychiatric nurse practitioner who could prescribe, what were you offering to patients as part of this clinic as a prescriber?
We were offering the proper medication for anxiety, depression, mood disorders, really any psychiatric disorder that came in, mostly for pregnant and postpartum people up to 2 years postpartum. We also offered therapy focused on sleep hygiene, really looked at the whole person, not just medication management.
And fair to say that the medication is one piece and the therapy is another piece, and this is part of a team approach that you had at the clinic.
That's
to
correct.
Address all these resources for patients.
That's correct.
So while you, as the psychiatric nurse practitioner, might have been a prescriber, were you also engaged in the therapy or psychotherapy?
I would do supportive therapy, but I'm not a therapist. I mainly am responsible for assessing, diagnosing, prescribing, but I also really understand the importance of sleep, nutrition, and exercise.
And so being that you had a history of working as a midwife and working as a nurse in labor and delivery, do you have a lot of experience with moms or women who are in that postpartum period?
Yes.
And how about your experiences with diagnosing and prescribing for women in that period? Do you have experience in that?
In the labor and delivery room, as a nurse midwife, yes, I diagnosed like labor and that sort of thing, and even depression, anxiety, not to the extent of higher acuity psychiatric conditions, but as a psychiatric nurse practitioner, I did.
Okay. And as far as your role at the perinatal behavioral health clinic, fair to say that your primary patient base was all going to be women who are either pregnant or after birth?
Correct.
And a part of this team approach at the clinic, is it also to work on developing a treatment plan for patients when they come in?
Correct.
And so what encompasses a treatment plan generally?
Generally, if it were a situation where we were referring them for therapy, then we would work with the therapist to kind of bring in the client to figure out what their needs are, and then really stress whatever. The therapist works on certain aspects of the therapy that we kind of work together, but not in tandem, kind of we talk, but not to the extent we each are in our own disciplines.
Okay. And as far as the resources that the clinic had available to you, is it fair to say that there are certain types of therapy, for instance, cognitive behavioral therapy or dialectic behavioral therapy, that are not necessarily encompassed with the social workers that you work with at the clinic?
Our social workers primarily did cognitive behavioral therapy. We did group therapy for more social support. What I did mainly was just supportive therapy.
Okay. And would you oftentimes through the clinic refer clients out to other local community providers?
Yes, we would.
Now, as the psychiatric nurse practitioner, does medication play an important role when you are dealing with a particular patient that came into the clinic?
Yes, it does play a role.
And how is it that you determine what's the appropriate medication track for any given patient?
We do proper screening, and then we do a complete interview with the client. And then based on what their responses are, together we work as a team to develop the best medication options or treatment options for that client.
When you say work as a team, does that include the patient themselves?
Absolutely. The patient is the most important part of the team.
And in your training and experience working with postpartum women, what is the acceptable period to determine postpartum?
Anywhere within the first year.
Did you know a nurse, or do you know a nurse named Susan Clancy?
I do.
How do you know her?
I worked with her off and on throughout my years as a nurse midwife.
And what's the nature of your relationship with her, other than the working with her?
Essentially, we just worked together. When we did births together, we worked well as a team.
Okay. And do you know where she worked?
She worked at Telstra Hospital.
On November 20th of 2022, did you have a conversation, or did you get a call from Sue Clancy?
I did. She was referred to me through Nanette Landry, another midwife that I work with.
Okay. And so as a result of the phone call that you had with her, did you get in contact with a woman by the name of Lindsay Clancy?
Yes, I did.
Was that the same day or a different day?
It was the same day.
And your contact with Lindsay Clancy, was it by phone or virtual or in person?
It was by phone.
And so what was the purpose of calling Lindsay Clancy?
I just wanted to get her side of what had been going on with her history, or marijuana or alcohol at that time.
Okay. And she also indicated to you that at this time on November 20th that she had stopped breastfeeding.
That's correct.
Now, did she schedule, or did you schedule with her an intake for the next day, November 21st?
We did.
And at the clinic, what generally is the practice for whether a person appears in person or on a telehealth visit or virtually?
Generally speaking, we like to do the intake in person as long as it's feasible. And for her, it was.
Okay. And just kind of while we're on that topic, going forward with a patient who's being seen at the clinic, what are the criteria to determine an in-person visit or a telehealth visit?
They're given the option about what works best for them.
And are there instances where you as a provider might insist a person comes in person?
If somebody needs to do like a urine drug screen or laboratory work, we'll have them come in. Or if they seem to be not making sense or having more difficulties, we'll have them come in person.
And if a person is scheduled for an in-person visit and there are no observed issues on your end, can they opt to change it to a virtual appointment at any point?
Yes.
Okay. And that's just the normal course of business at the clinic?
Correct.
Now, in this particular instance, you said the intake was in person, right?
Yes.
And during the course of the intake, are there particular types of questions that are asked of the person to get to know them and get to know their situation?
Yes, generally we do a full intake. The first thing they do is meet with the nurse who does all the screenings.
And one of the things that is asked of an individual when they come in is to tell you why they are there, right?
Correct.
What their complaint is.
Yes.
And so for this patient, for Lindsay Clancy, what did she identify as the reason for the visit?
Would it be okay if I refer to my note?
Sure.
So she said pretty much I cannot sleep was her major concern.
Okay. And is that something that you've seen in your experience with new moms that come through the clinic and are postpartum?
It's very typical.
Now, even with that report or that reason, do you do a full history to try to identify kind of what's going on in the present and what has happened in the past?
Yes, I do.
And generally, is it fair to say that that's kind of the goal of an intake, right?
I do that with every client. I have a standard set of questions.
Is that just for the intake or any follow-up?
Any follow-up, I have a basic kind of script, but I always adjust it based on what they're saying.
Okay. But fair to say, once a person gives kind of that history of their background, especially if they've had prior births before, prior experiences with mental health professionals or psychiatric history, that kind of follows the patient as they go through with their subsequent visits.
Yes.
So in this instance, you had some background information from the phone call you had with her, but did you go back through those standard questions that you'd ask in an intake?
I did.
And did you learn a little bit more about her current mental status? Did you ask her some questions about currently how she was in this November 21st meeting?
I did.
And so, again, do you kind of go through in each and every instance whether the person has any thoughts of suicide or harming themselves or others?
At every visit, those are standard questions that I ask if they have any type of suicidal homicidal ideation or auditory or visual hallucinations.
Do you ask the same questions each time, or is it kind of fluid based on your rapport and conversation with the patient?
Generally, I try and touch upon the topic. Sometimes we get to that answer indirectly just by the line of questioning that we're using.
Okay. And where it had been reported to you that she had been on the Zoloft and stopped due to insomnia, that she was overwhelmed and her mind was racing, did you talk with her about intrusive thoughts?
I did.
And did she indicate whether at that point she was having any intrusive thoughts of harming herself or her babies?
She was not.
Did she report to you how she was feeling at home with having now 3 children to take care of?
She was feeling overwhelmed.
And that, again, reiterating that around 12 weeks when Patrick went back to work, that she was having increased anxiety.
Correct.
And did she indicate to you that that was something that she had experienced to some extent with her other 2 children?
At least with her second pregnancy.
And was she able to manage that with her second pregnancy without medication?
As far as what I was told, yes.
And fair to say she indicated that she would use breathing, meditation, and yoga to work through it.
Correct.
And so on this November 21st intake date, you again ask about drug use, right?
Correct.
And at this point, she had told you that she did trial one CBD gummy at some point, but that did not help.
Correct.
And you also learn about any prior psychiatric medication she had been on?
Yes, she had been on the Zoloft, the Ativan. She had been prescribed Buspar, but she didn't indicate whether she had taken that or not.
Okay, and so that was a report of her most recent course of treatment, but did she talk about having anxiety issues
yes.
further back in her history?
Yes, in college she had trialed Prozac, propranolol, and Wellbutrin.
And fair to say she indicated that to you that she did well on those medications in nursing school?
Correct, with the only side effect being sexual side effects.
Did you talk to her at this point in November 21, 2022, about whether she had a plan to go back to work?
I don't know if that was a specific day. I know that we talked about work at a different date.
Okay. If you have your note in front of you, I just draw your attention to maybe the last paragraph of the history of present illness.
Oh, I'm sorry. And you're talking about the day of the intake?
Yes, sorry.
Sorry, I thought you said the 22nd. So, yeah, she had planned to go back to work in October, but it got delayed. She pushed it forward to November because she was having anxiety.
Okay. And during the course of this intake, again, you did those same mental status screens for any concerns, right?
Correct.
Did you know any in this face-to-face in-person meeting with her?
No, she was goal-directed linear. She was a great historian, actively participated in the care plan.
And as far as some of the screenings that you do during these visits, for a person who is in that postpartum period, are there any specific screenings that you do?
Yes, we do the Edinburgh Postnatal Depression Scale. We did the GAD, which is the Generalized Anxiety Depression Scale. We did the Mood Disorders Questionnaire Scale, the Colombian Suicidal Scale, as well as the 5 Ps, which assesses for substance use disorders in pregnancy and postpartum.
And so as far as in each one of those screens, what did you find as it pertained to this particular patient?
She was significantly high in the GAD-7, which is for generalized anxiety. She scored 21 out of 21, which is they're just screening, so it's not diagnostic, but it did indicate that she was experiencing extreme anxiety. And then with the Edinburgh Postnatal Depression Scale, she scored a 23 out of 30. But the one that I look for the most in that scale is number 10, and she was negative, and that's for suicidality.
Okay. And so why is it that you look at that one in particular, or why do you consider that most?
Because that shows significant depression, especially if they have thoughts of harming themselves.
Is it fair to say that that Edinburgh scale it also could fluctuate with postpartum mom depending on their situation?
Yes.
And the other screens that you performed, did you identify whether there was any substance use issues?
No, there wasn't.
Now, once you were able to kind of gather all this information from her and do these screenings, were you able to come up with an assessment and a plan for how to help her?
Yes.
And what was going to be the plan with Miss Clancy?
So we had discussed starting Prozac.
Okay. And is that, or why Prozac? Why start there?
Because she'd had a history of being successful on it in the past. And that's a good indicator that instead of trialing multiple medications, to start with the ones that actually work. So I gave her 10 milligrams for the first 4 days to make sure there were no adverse reactions. And then I was going to increase her to 20 milligrams if she tolerated that well.
Okay. And what about some of the medications that she had already, that she was already on, the Ativan and Benadryl and the Trazodone? Did you have a plan for those?
I did. So I encouraged her to take the Ativan. So when Prozac can sometimes be very activating, it can make the anxiety worse before it gets better when you first start it. So I wanted to pair it with the Ativan just in the beginning, just to help her be more comfortable with the anxiety and to make sure that it didn't interfere with her sleep.
And as far as Prozac goes, what class of medication is it?
It's an SSRI, a selective serotonin reuptake inhibitor.
Is it commonly prescribed to treat people with depression?
Yes, it is a first-line treatment.
You said first-line treatment?
Correct.
And the idea of pairing a particular medication like an SSRI with another medication, is that a fairly common practice with psychiatric medications?
Yes.
As far as you mentioned that sometimes symptoms could get worse before they get better. Is that also common with SSRIs?
Yes, it is.
Does it take a while for a medication to get into a person's system and stabilize them?
Generally, side effects are the first week or two, but to get to a therapeutic level, it's about 4 to 6 weeks.
And was this something that you discussed with her about the timetable it would take to reach a therapeutic level?
Yes.
And when we say therapeutic level, what's the goal of reaching therapeutic level?
Is remission in symptoms.
People start to feel better then, right?
Correct.
Now, even though you were advising that she continue with the Ativan, and she had told you that she had concerns about continuing with the benzodiazepine, did you indicate that there would be a plan to taper that or reduce that?
Yes, once the activating symptoms went away, then we would look at reducing that and moving away from the Ativan and moving more towards like a Buspar.
Okay. And as far as talking about that plan and what the risks and benefits of that plan were, did she appear to understand and engage in conversation with you about that?
Yes, she verbally understood and said that she understood the instructions.
Did she ask the appropriate questions or follow up?
Yes, she did.
And as far as kind of overall what the plan was moving forward, was medication the only recommendation that you were making, or did you have other recommendations for her?
No, I set her up with talk therapy with Letitia Dukes as well.
Sorry, when you say talk therapy, what do you mean by that?
So coming in and actually doing cognitive behavioral therapy with a clinician, someone who is trained in this.
Okay. And so you mentioned Letitia Dukes.
Correct. She was the clinician in our program at the time.
And when you make this recommendation and this intake visit, do you work with the patient to schedule something before they leave, or is it up to them to schedule the time with the social worker?
It was set up with her before she left, I believe.
Okay. And you're aware that the first scheduled appointment with Letitia was for December 2nd?
Correct. I believe because it was a holiday week that week.
Okay. Now, this time that you were with Ms. Clancy during this initial intake, fair to say it was approximately 60 minutes?
Yeah, she spent 30 minutes with my nurse and 60 minutes with myself.
So she was there for an hour and a half? Correct. And is that normal time period that you allot for people coming in for intakes?
Yes.
And as far as follow-up with you as the clinician and prescriber, was there a plan set for when she was going to return?
Yes, we had established to return in 2 weeks.
Now, at this point, because you had made that initial contact with her and you had done this intake, was she going to be assigned to you as a patient?
This was going to be a short-term arrangement. I was already in the process of leaving the program at the time.
Had that been communicated to her?
I don't recall.
Okay. And as far as what your plan was, how long were you remaining at the practice?
I was at the practice until mid-December.
So this was like a pre-planned...
I was moving back to New Hampshire, yes.
But as far as the preliminary care, did you continue on with Lindsay as a patient?
No, I transferred her care on November 30th. And I communicated with that to Lindsay.
Okay. So as far as after the intake, she was provided with that December 2nd intake or meeting with Letitia Dukes, the social worker. And then the next scheduled event would have been December 7th, right? For a follow-up?
She had I believe, I don't recall the actual, what her next follow-up with me was. I don't recall that date, but she did have a follow-up with Rebecca Gelada.
Okay. Prior to you communicating on November 30th that you were transferring her care, did you have further contact with Lindsay Clancy?
Yeah, we had a few phone calls and MyChart messages going back and forth.
Can you just explain to the jury what the MyChart messaging system is in your practice?
It's kind of a chat feature between the client. They can reach out directly to the provider. It goes right to our inbox, and we can talk back and forth between visits.
And do you encourage patients when they come in and that first meeting to utilize the MyChart messaging system?
I do. Often it's the quickest way to get a hold of me if they're experiencing any major issues.
And fair to say it's just an easy way in between visits to communicate particular points of information or concerns or symptoms?
Yes.
Do you, in your practice, often use MyChart messages if you're not available to meet with the patient, to make changes to their treatment plan?
Occasionally, yes.
Now, prior to your first MyChart message with Lindsay Clancy, did you get a text message from her on your personal phone?
I don't recall.
Okay. Do you recall whether Sue Clancy provided your number to Lindsay?
I know I did. So she had my number because I called her from my personal phone call because it was on a Sunday when I reached out to her initially.
So that November 20th phone conversation was a communication between you and her on your personal phone?
Correct.
And so do you recall on November 22nd getting a message from her saying, "Hi, Julie, this is Lindsay Clancy. I'm sorry to contact you like this, but when you have a minute, can you please call?"
I can't recall whether that was a MyChart message or if that was on my personal phone. I apologize.
That's okay. As a result of some way her contacting you, did you then have or send her a message or have a conversation with her on November 23rd?
I know we communicated on the 22nd. I sent a message saying that was the day she was getting nervous about starting the Prozac, so we encouraged her to go ahead and start the Prozac. I know we communicated on the 23rd, either by phone or by MyChart message, that indicated that she had taken the medication. She had started it on the 22nd.
Okay. And were you aware at this time period that she was currently already a patient in the South Shore Health System Network with a primary care physician named Margaret Anastasia?
Yes.
And she's a nurse practitioner, right?
Correct.
Now, as far as these concerns that she relayed to you about starting the Prozac, do you know whether she did start the Prozac?
Yes, she stated that she started the Prozac on the 22nd of November.
Okay. And by November 25th of 2022, did you start having some MyChart communications with Lindsay Clancy?
I did.
And so just referring first to November 25th of 2022, fair to say that you gave her or sent her a MyChart message encouraging to kind of stick with the plan, right?
Correct. Prior to that, yes.
At that point, had you prescribed her something to help her sleep outside what you had previously provided or outside what she had?
Before November 25th, I did not.
Okay, so on November 25th, did you prescribe her some additional medications?
I did. So she wasn't tolerating the Prozac, so we had a conversation about stopping the Prozac. I gave her, she was really having a hard time sleeping, so I gave her a one-time dose of Ambien. And then I also prescribed mirtazapine, which is another antidepressant, but it works really good for sedation and anxiety. So started that at 7.5 milligrams, told her to stop the Prozac. And I also paired it with Klonopin, but I told her explicitly not to take the Ativan, just to take the Klonopin to help. It's longer acting benzodiazepine to help her with sleep and longer acting anxiety support while we got this new medication up and running.
And so in your conversations with her about her concerns about the Prozac, fair to say she reported to you that she was feeling disconnected, out of it, a little bit spacey. Does that sound right?
Yes, that's correct.
And so you said your recommendation at that point was to discontinue the Prozac.
Correct.
And as far as the Prozac went, she hadn't taken it for very long, had she?
She took it for 3 days.
3 days?
Correct.
And again, you had that conversation with her about kind of waiting it out for the 4 to 6 weeks. But based on what she was reporting to you, did you have any concerns about her stopping the Prozac after only 3 days?
When a client doesn't have buy-in to the medication, it's awful. It doesn't work as well. So I was working with Lindsay to try and find a medication that would make her feel more comfortable. She was feeling very uncomfortable, very anxious. And the Prozac, she just wasn't tolerating the activation from the Prozac. So mirtazapine is a little bit more calming, which I thought she would resonate with better.
Okay. And so, again, this is not one of those follow-up visits on a telehealth or a face-to-face. So were you relying heavily on what she was reporting to you?
Yes.
And again, in that MyChart message, you did indicate to stop the Prozac, Benadryl, and Ativan, and don't take while taking Klonopin, right?
Correct.
And in your practice as a psychiatric nurse practitioner who prescribes medication, is it common that you have to kind of trial different medications to find the right one to work for any given patient?
Yes, it's pretty common practice in psychiatry.
And fair to say, there's no way to anticipate how a particular patient is going to respond to any particular treatment, medication treatment.
Correct.
So after prescribing the Klonopin, the mirtazapine, and giving her that single dose of Ambien, did you do anything or set anything up to follow up with her after changing those prescriptions?
I just told her to she can my chart message me over the weekend. It was the holiday weekend. So I made sure she knew I was available to answer her questions.
And fair to say she did, in fact, my chart. You sent you my chart messages over the course of that weekend, correct?
She did, yes.
And so starting at 7:51 on November 26th, she reported to you kind of how that night went, didn't she?
Yes.
Where she said, I did better last night. I took 7.5 mirtazapine and 0.5 Klonopin at bedtime, slept fairly well on and off until 3:45. And then she asked, do you think increasing the mirtazapine will help me stay asleep longer? I can survive like this, but would be helpful to get to sleep until at least 5. Thoughts? Thank you, Lindsay.
Yes.
Did you respond to that message?
I did.
And what did you advise her to do when she asked about increasing the mirtazapine and wanting to stay asleep longer?
I said she could trial the 15 milligrams.
And again, is that something that is common for you to do in prescribing, that maybe you have to adjust the dosage?
Yes.
Did you have any concerns that increasing the mirtazapine up to 15 would have had any issues or problems?
No.
And then again, on November 27th, you had a correspondence with her starting at 9:59 a.m., where she again reports to you how she did that night. Is that something you encouraged her to do, to just give you a nightly or like a follow-up the next day, check in to let you know how she was or what she was experiencing by way of symptoms?
I do that with a lot of clients that are really anxious. I like to make myself available to them so that they have that reassurance.
Okay. So this wasn't kind of unexpected.
It wasn't out of the ordinary for me.
And so on the 27th, she indicated she slept well, taking the 15 mirtazapine and the 0.5 Klonopin, feel rested but super disconnected with myself and reality, and describes it as a scary feeling, thinking of stopping Klonopin tonight and just taking the mirtazapine. Do you recall that?
I do.
Communication? And she acknowledges that I've only taken it 2 nights, so that should be right, okay? Or, sorry, I've only taken it 2 nights, so that should be okay, right? Do you recall her asking that?
She's referring to the Klonopin, and yes, she did. She was really anxious about being dependent on benzodiazepines, so I think her goal was to not be on them. And if she was going to, the disorientation might have been because of all the sedation from the mirtazapine, which is a common side effect, which is why we chose that, and she knew that. And adding the Klonopin, maybe removing that, might have helped with some of the sedative factors for it.
So did you find there to be any issues with stopping the Klonopin or her deciding not to take it after 2 days?
No, I did not.
And in fact, you indicated and told her that should help with the disorientation, right?
Yes, it might.
Okay. And so that was on November 27th. And fair to say that there was another communication via my chart on November 28th with Lindsay Clancy.
Yes, there was.
And at this point, she was asking for, or there was some back and forth about needing a note for work, correct?
Correct.
And is that something that you had talked about with her, about getting another note for work?
Yes, that's what I do that often.
And in fact, you kind of went back and forth with her, and ultimately she said never mind, that she didn't qualify for short-term disability anymore, and she's just going to be on personal leave.
Correct.
So on the 28th, there was no back and forth about her taking the medicine and the effects or how she was feeling?
She actually had a panic attack earlier in the day before those communications about work. And I recommended she take 0.5 of Ativan and go for a run. And I also recommended that she consider doing the partial hospitalization program at women and infants.
And what was her response to the recommendation for the partial hospitalizational program?
At that time, she felt it wasn't going to work logistically for her or her family.
Okay. And why did you recommend maybe going for a run?
To get rid of some of the adrenaline from the anxiety. And running has been a really good thing for her in the past, and I thought it would help calm her down.
Okay. Now, on November 29th of 2022, that was the first day that she actually met with Rebecca Gelada, but you had some conversation with her, or she sent you a message, I should say, earlier in the day, correct?
She sent me a message earlier in the day, and at that time I wasn't working that day, and Rebecca had an opening, so I offered the appointment with Rebecca for her. So I didn't actually communicate with her that day.
Okay, but you did receive her message at 6:05 a.m. Where she reported that at that point she took 15 Remeron and CBD and it only worked slightly.
Correct.
So how did you get from what you have told us now was the mirtazapine, or that's Remeron, right?
Correct.
How do we get from just the mirtazapine with not the other, without the Klonopin or without some other?
The Klonopin was an as-needed medication, so I honored her choice to be able to decide whether she wanted to take that or not.
Okay. So after this panic attack, after the communication about the work form, she reports the next morning that she took the 15 of the mirtazapine or Remeron, and then she was having some sleep issues, right?
Correct.
And that she tried breathing meditation and muscle relaxation, but that she ended up having to take the Ativan.
Correct.
Now, had you had any conversation with her in this back and forth in these MyChart messages about whether Ativan was something that she should continue to take?
It was understood that she wouldn't take it until I had that conversation with her. I was under the understanding that she wouldn't be taking it while taking the Klonopin.
But she had told you she wanted to discontinue the Klonopin.
Correct.
And so you said as of November 30th that you had then fully transferred care.
I let her know that I would be leaving the clinic, and I thought it would be best if she saw a clinician that was working 5 days a week.
And Rebecca Gelada, is she a clinician that works at the clinic?
Correct.
And had you worked with her for quite some time?
She had been in the clinic, I think, for 2 years, I believe, at the time.
And you said that you had recommended on the day before, on the 29th, that she set up that meeting with Rebecca because she was available.
Correct.
So it just was kind of happenstance that she ended up with Rebecca, or?
I was in the process of transferring all of my patients between Rebecca and our new hire, and Rebecca was an experienced clinician, so I felt she would be a better match for Lindsay.
Okay. And as far as when you sent or communicated to Ms. Clancy that you were transferring her care, that was via MyChart message, right?
Correct.
And Lindsay then responded to you, or do you recall if she responded to you? I'm sorry.
She did respond to me saying thank you for the care that I provided. She appreciated it and wished me luck.
Did you have any other contact with Lindsay Clancy after that point?
No, I did not.
And just to be clear, so when we were talking about moving from November 28th to the 29th in time, did you have a phone call with her outside the MyChart messages about that panic attack? Or do you recall having entering a progress note about that?
I do remember entering a progress note about that. Okay. And that's when I told her to go for the run. I made the recommendation for the PHP.
Did you ever have any further contact with Sue Clancy about Lindsay Clancy's care after that first contact on November 20th, 2022?
I don't recall that.
I have no further questions at this time.
Council, can I see it?
Well, what do you think of that? What do you make of that, Lee? I'm sure you're ready to tell us. Come on down. Am I even on air? Can you hear me? Just in case you can't.
I
Leanie?
hear you. I hear you, girlfriend. I was
Go
in the
on, girl.
kitchen.
Let's hear what you think.
I'm thinking that we need half days. And now,
You
I've
need...
been here all day before. We've been doing this 5 days a week. I usually miss 2
Hang
days a
on,
week.
I'm talking about the medication part.
Oh, sorry.
That's all
Hey,
right, I'll
listen,
accept it.
don't get testy with me at this point in my life, Maggie.
Shut up.
I'm on the struggle bus, Maggie.
I know,
Maggie,
girl. And you know what? I'm
you know
your
what?
shoulder to cry on, you know that.
I know.
All right, you may step down.
221, God bless
You
my
already
baby.
said you may step down, Lee.
He's going to end it here. Come on, Judd, we're done.
For the
Yeah,
day,
he
do you
looks
think?
way too. Yeah, he looks.
It was
too
20 to 9
Members
last
of the jury,
time.
just a couple minutes later. So we're going to break. The Commonwealth is finished on their direct. We're going to start with the cross-examination of this witness, but we're going to start that tomorrow. All right, so we're going to break till tomorrow. Remember my instructions.
Yeah, in the morning.
Don't
he
talk
finished the
about this
same
case.
last.
Don't
He
read
finished
about
the
this
same
case.
on.
Even
When
similar
was it,
cases in
Friday?
regards to this. Don't read anything. Don't take any field trips. Don't do any research. You kind of know what the instructions are. I'm going to ask you those questions. We'll come in. We might start. I'd ask you to be here ready to go at 9. There may be an issue I have to talk to counsel. It might cause a little bit of a delay, but we'll try and keep that minimized. We'll get you in here tomorrow. Okay, great. Thank you for all your work, and
He's got
hope
a
you
rash on his face.
have a nice evening. We'll see you tomorrow.
All right.
Well, what do you think of that, girls and guys in chat? Where are you? Where are you at? Are you all mixed up more than you was before? I was prescribed Klonopin, and that stuff will knock you out. Oh, Britty.
See, I think
See what I mean?
I think that though it just depends on the person.
The sound's still on you now, Lee.
Oh, sorry.
Okay, look.
I thought that really think that it just depends on the person because I was on Klonopin too. Klonopin and Buspar together. Hold on.
Okay, so the plan will be to start tomorrow. Before we bring the jury back in, my plan would be to address the defendant's motion for that additional witness. We could maybe do that first thing, and then after we argue that, go right back into the presentation evidence. All right. Thank you, everyone. Thank you.
What was that, Leanie?
So I guess they're wanting to bring on an additional witness, and that's what they're going to talk about in the morning. Jesus, we don't need an additional witness. No.
God, are we going to go do more meds again? We must be, because she's been on everything, and it's everyone who's prescribed it they're going to see. How many have we seen now? 3.
Well, we haven't talked to the lady who this one is saying that the other one that prescribed her stuff. What was her name? Son of a biscuit eater.
Oh.
She was just talking about her, how she put her over because she retired and she gave that case to this other lady. And this other lady was also subscribing medication. I forget what her name is now, if anybody remembers.
I'm trying to think. Oh, God, can anyone think?
Gelada. Yes. Thank you. Thank you so much.
Thank you, Misty.
So I'm pretty sure that is, let me take this down real quick, you guys. We don't need this up anymore. All right, here we go. So, yeah, Dr. Tufts has already been up there, but we haven't heard from Gelada yet, and I'll bet you he is the next one. She is the next one that's coming in. And after that, I think we should be done with the doctors. Although, maybe you guys can answer this for me.
What about the one from the hospital?
I don't know. But I want to ask you guys, did you guys hear did they talk to the medical examiners from Cora and Callan? I thought from Cora and Yeah, Corey and Callan. I think we only heard about Dawson, right?
Yeah,
So
I never
there.
knew.
Why haven't we heard of a medical examiner about them?
That's what I said. So we're going to speak about the other kids when it happens. I don't
Yeah.
understand why they only talked about one. It's so much missing, Leanie.
Mm-hmm.
It's
Yeah,
not
so
making
they
sense.
better bring that in because this is crazy. Monica Rose said, how does she not recall any contact with Sue after her care with Lindsay? She either knows or she doesn't. Right, and they were friends, right? That's how Sue found her, was because they were friends and they worked together for years, and you can't remember if you talked to her since then? Fuck off. We know the real deal, you guys. We know what they're doing.
Yeah.
It is a lot. It's a lot to take in, and I don't think where I'm standing right now is I just don't see that the prosecution has proved anything of her guilt yet. Have we learned a lot? Yeah, we've learned a lot.
About
Like
meds.
a lot of medicines. Yeah. And we've learned a lot about how she was failed and how none of them were saying, I'm so sorry. I mean, if I had a hand in this, I'd be bawling my eyes out about those babies that that's who I would feel like I let down. Too many gummies, yeah. Every single
Yeah,
day there's more questions than answers, lads and
there
ladies. You are
is.
right, Gemma.
Mm.
It's just so weird. The whole thing is weird. And I think it's because they're being really cautious about what they're letting into the court. And I think it's bullshit. Think it's bullshit, you guys. But
Mm.
anyhow, any hoot and a holler. It is what it is. I'm glad I'm not on this jury because I think I would have to say, you guys, I cannot. There's no
I'd
way
be the
in good
same.
conscience that I can make a decision here.
Hi, Arabella. What do you think about the conspiracy of the husband doing it? I don't think he did. That's what I think. What do you think, Lee?
Absolutely not. And if you go back a couple hours ago, and I know nobody feels like doing that, nobody cares. Just listen. Let me just put it this way. Just listen to the timeline of the forensics of getting both of their phones and how they had downloaded all of their GPS,
Mm-hmm.
downloaded all of their text messages and calls to one another, and then just use all you need is Callan, the baby. Uh, he would have only lived at the very max for 6 minutes after he was strangled, and I'm talking about even to be revived. So we know that he had brain damage. He was on life support inside the hospital for 3 days, and it only takes 4 minutes for the severe brain injury to kick in. No coming back from. So, yeah, and they were able to revive him. So Callan had to. Somebody was trying to kill him within 6 minutes of him getting help. So no, I don't believe that the
Yeah.
husband did it. But every people want to blame the husband. People want to blame, everybody has someone to blame. I'm blaming all of them. They all had a role in this.
Yeah.
Everybody involved in this has a role.
He's obviously gone and told his mum or his sister or whoever that it's been my brother telling me that, as I said, oh, you're going to have to get them kids out, bring them to me. You're going to have to sit down with Lindsay and you're going to have to try and explain. It doesn't matter if she goes off her head, the kids have got to be moved. End
Right.
of.
And I'm not gonna lie, I'm pretty well, I'm not open about most things, but some things like this, I can be, but I don't like taking new meds. Sometimes I don't like taking them. I'm scared of them too, and I've always been very honest. You guys know me and my doctor, we BFFs, and he knows I'm scared of it. And he was always like, it's fine, Lena, you're going to be fine. And then finally I was like, I'm really scared of taking that medicine. Y'all, he said, go sit in my lobby because I have got other patients to see. Y'all, we fuss at each other all the time. It's like we're brothers and sisters. He's like, he's like, bring her a cup of water. And he sits there and he watched me. I take the medicine. He's like, now I need you to go sit in my lobby for 30 minutes. I know CPR. If you're going to try to die on me, I'll do CPR till the ambulance gets here. And you're going to be just fine. If you haven't passed out within 30 minutes, I need you to go home. That's what he would say to me. So anytime I have a new medicine that I'm prescribed, I just sit in the lobby and I take it. Bye,
Well, if
Charlotte.
it makes
Good
you
to
feel
see you.
safer.
Bye,
Bye,
Lisa.
Charlie. See you soon, love.
So, and it makes me feel better and it kind of makes me giggle. But I am getting better at, like, now I don't sit there for 30 whole minutes, right? Now I'm down to, and not all the time, but now I could sit there for 5 minutes and be like, I would have felt it by now, and I'm good to
It's
go.
like when they give you the jab, they say to you, just wait in the waiting room 5 minutes.
Yeah,
If
to
you
see
feel
if
all
you
right
have,
after that, go. Yeah, it's one of them, isn't it?
yeah.
I mean, I don't like taking meds. I really don't. As much as I'm on now, I just hate taking them. I'm always wary.
Yep. But you got to do what you got to do, And I always
Exactly,
think
to
after
help
I get the
yourself.
first, and he would tell me, if you get the first one down and it doesn't kill you, the second one won't either. Don't even worry about it. But
Yeah.
yeah, not lying to you. That's what we used to do. And now it's only if I'm really, really scared, then I'll sit in his lobby for 5 or 10 minutes and then I'm gone. But if I don't sit in the lobby, I'll come home and I tell Beefcake, like, he's put me on a new med, so I'm taking it right now. Watch me for 30 minutes. If I don't die, I'm fine. But if I do die, then tell him, don't cut me open, that that's what killed me. And then get a hold of Dr. Beck and then let him know that I really did die from a medicine he put me on. Well, it's the truth. It's just the way that I am. It's the way that I am. All right, you guys, that does it for us for today. We're off a little bit early, not much early, but just a little bit. We thank you so much for being here. We listen. If this trial has done nothing else but confuse us, one thing it has done is it's brought many, many of you into this channel who I enjoy your company. Maggie enjoys your company. You make this a lot easier for us because you are
Certainly
interacting
do.
and
Certainly do.
being so welcoming even to new people in chat. That is just
brilliant.
Yes, I love it so much. So I thank you for being kind people and for hanging out with us, because listen, we all know you could be somewhere else, and
it lets us slip away to make a quick cuppa because you're keeping the chat going. It really helps us.
Really, and we appreciate y'all so much. I'm serious. So if the trial did anything else, I think that it's building relationships, and
It's
listen,
found
that's what,
us all of you.
yes. And it's been wonderful. I'm so grateful. In fact, Maggie, I really do think this is probably, even when we did Nancy Guthrie,
I
our
think this is
chat,
the biggest one we found, people.
yeah, the chat was not as good as even the Nancy Guthrie, and we were we were doing over 100,000 views at times.
We've
But
got loads of people who've got loads of opinions, and
yeah,
it's great because they're all commenting and they're all giving, they're getting in with it all, and it's brilliant. Some of the things they're coming out with, I'm like reading, I don't even understand the big words, but I'm getting it and I'm watching it and I'm crocheting that fast and I'm making mistakes because they're making me do. I'm like, oh, I love it's like reading a book.
And we aren't fighting, and that's a big deal too. We don't do none of that stuff here. Look,
No.
I get passionate. I know other people get passionate.
I jump in then and go, it's okay, you can have an opinion, because I know she's getting heated.
But the minute that we just know we're on opposite sides of the page and we cannot just meet to say, hey, you have yours, I'm going to have mine, and I'll try not to be offensive to you because I don't want to be, then we just move on. Why? I mean, there's plenty of channels out there, guys. If that's your jam, going in there and just like letting people have it and arguing your point, do it. Go do it. Hi, Aussie True Crime. Good to see you.
Gemma's got to go in the office tomorrow.
I might actually need to go in the office.
We're going to be Gemma.
Oh, Gemma, honey, listen. Just quit your job. Just quit your job. We've all done that. We're all just quitting our job for according to Lainey. We're all going to go broke together.
Good day, Poss. Thanks for being here.
Awesome. Yeah, it was so good to see you. All right,
Hope
guys.
to see you tomorrow.
that is it for us. Maggie, do you want to play us out, or
Aye.
do you want me to play us
I'll
out?
play
What would
it
you
out.
like to do? All right,
I want
guys,
you
we
to go
will
and
see
read
you.
your message
Yes, ma'am, I will.
on your phone, and I'll
Okay.
play us out. Good night,
Thank you guys
everyone.
for
Good
being
day,
here,
wherever
everybody.
you are. Love you all. See you in the morning for course, 9 a.m. EST, 2 p.m. GMT. Take it easy, and I'll see you all soon. Bye for now. Bye.